Hello, good morning, doctors. Welcome back to the game changer session. And today it's really very special and it's really a game changer session because today we'll be covering the most important topics which will change your game from 149 to 150. Okay, so the subjects which include forensic medicine, ENT, ophthalmology, and the final one, which is the PSM, all they are this very much high yielding one. If you miss out all the sessions, I can agree you, but don't miss out these sessions because this is the most important part of all the 19 subjects which will give you a push and will make from 149 from 150. Okay, first of all, good morning guys and welcome back to see you guys again. Like is everything is fine from your end? How is your things going on? Yeah, good morning Dr.G, Dr. Puneet, Dr. Rituraj, Dr. Gautam. Yeah, good morning Dr. Rahul, Anirudh. Yeah, good morning Dr. Rekha, good morning Dr. Anjali. Yeah, well. Yeah, it's nice. Good morning, Dr. Kanish Chaudhary. Nida, yeah, good. Yeah, all okay, fine. Good. Yeah. Unnoted not received, like fine. Yeah, actually I did receive the comments, but actually we shared from our end. There is the studio team, they are processing this PDF, they will share you in a while. Okay, don't worry about those things. I told you PDF, it is our responsibility, we'll give you back. Okay, we won't take it home and we'll lock it in, we'll share you back. Okay, there is this small technical glitch from the studio end, we'll cope up with it and we'll share you back. Okay, and I got you received this unnoted one, right? Yeah, good morning. Like Здравствуйте from Kyrgyzstan. Like 𝗧𝗵𝗶𝗀𝗀𝗀𝗀. Yeah, sure. Yeah, I will share the PDF earlier. And before starting of the sessions, I usually share this unnoted PDF. Yes. Right. Yeah. Good morning, Dr. 𝗚cie. Good morning. Yeah, Praveen, about this last few days, we'll discuss it. Don't worry. I'll share you on the last day of our session. I will share you like how you can ace your preparation as well. Okay, don't worry. Just keep up and hold your breath for 2 more days. We'll be doing it. We'll be doing everything and about your doubts also in between the sessions. Okay. Yeah, unnoted PDF. That's what I told you. I shared to the studio team. They are processing this and they will share you back. Okay. So we'll share you. Don't worry, Dr. AD. Okay, yeah, no, one day before it is, yeah, I'm really awesome. Thank you, Dr. Ankit. One day before it is a bit difficult for me because we are in the final phase of editing and we'll share you back. Don't worry. There is 2 more days, right? So I will share you mostly in the night, during night sessions, whereas we'll give you a timing the morning where you can take this one. Okay. Yeah, sure, we'll share it back. Fine. Yeah, that's it, guys. I hope you are doing well and you are doing this revision of this all 19 subjects, and as well as you are doing the questions of this FMGE previous year questions. Okay, make sure you are doing this. Yeah, fine. PYT sessions, like I'll talk to them and we'll make it done. Don't worry, Dr. 𝗚cie. Okay, we have all these things which are collectively done for you. Okay. Yeah, Anirudh, if you the best questions which I ever asked it is, yeah, is this videos are enough for revision? My answer is yes. This video is enough for your final part of your revision, and please make sure you are doing your PYQs along with it, and make sure you are attempting your GTs, because you are revising and not doing questions. It means it's just halfway. You know things, but you don't know how to apply. But you know how to apply in question solving, whereas your mindset will come while solving your GTs. So you should give at least few GTs before going to the main examination, because in main examinations it will be flooded by all 19 subjects questions, and in such manner you'll be panicked. So in those times you will be aware of what's going on. So make sure you are giving at least 2 to 3 GTs to cope up with you in time. Fine. Yeah, Vignesh Venkatesan, I'm from South. I'm from Tamil Nadu. Okay. कोई दिक्कत है उसमें? Fine. Yeah, Pharma, like yeah, sure. I will take up all your leads and we'll process it. Okay, don't worry, don't chill out. As of now, we'll stick to the session. We'll complete the first 19 subjects. That is our primary goal. We'll complete it and we'll talk the rest of these things and we'll have a chit chat for sure. Okay. And without that, we'll start our session. Today is the forensic medicine part. First part. It is the forensic medicine part. It may look very simple. And this subjects, forensic medicine, it will yield you questions of 10 to 12 with a small PDF, small things. You know the basic things you should need to apply. If you know these things, you will get this 10 to 12 marks easily. Okay, easily. Okay, fine. Yeah, that is tala for a reason. Yeah. Fine. Next, we'll start with this medical negligence. Mostly from the medical negligence part, they will ask you like this. For example, there is a radiologist is there, and you are a practicing surgeon, okay, you are a practicing surgeon or a medicine department guy, you send a patient to this radiologist and you are asking percentage, मुझे इतना कट दो, ठीक है, you are asking a percentage for this, and you are splitting the money, okay, you are splitting the money between this radiologist and you. It is known as dichotomy, okay, dichotomy. Actually it is not punishable, but it is not a proper conduct, so it is known as infamous conduct. It is known as infamous conduct. Yeah, good. Yeah, good, Dr. Puneet. Yeah, fine. Next, about this few medical negligence cases, if you see this image, you will be able to see what is the mistake. Is the X-ray taken wrong or the surgery done wrong? देखिए इसमें क्या किया हुआ कि एक्सरे जिन्होंने लिया है वो गलत लिया है, कि ये सर्जरी जिन्होंने किया वो गलत किया है. या ठीक है, इसमें क्या हुआ, मींस दे केप्ट द फोर्सेप्स इनसाइड, ठीक है ना, मिस्टेकनली. कभी कभी हम क्या करते हैं, हम भूलकर, मींस समथिंग विल कीप इन द रूम एंड विल लॉक इट, राइट. लाइकवाइज the surgeon has left his forceps inside his body, so it is what, yeah, good Dr. Ayush, Dr. Anju, good Dr. Parul, good Dr. Kanish. So the surgeon has left this forceps inside, ठीक है, so it is what, it will come under this negligence, which is known as 𝗃𝗃𝗀𝗀𝗀𝗃, or the thing, means he kept inside, that is grossly visible, so it is what, the thing speaks for itself. This is known as 𝗃𝗃𝗀𝗀𝗀𝗃. It is known as 𝗃𝗃𝗀𝗀𝗀𝗃. Yeah. Okay, good, cool guys. Yeah, truth speak for itself. Yeah, that's true. That is a thing or the truth which speaks for itself. Next one, it is known as doctrine of common knowledge, because in this era or any era, you know, like if the patient is coming with dehydration, ठीक है, हमें पहले क्या करना चाहिए, हमें फ्लूइड देना चाहिए. Even this normal layman knows, okay. So अगर if there is any hemorrhage, then we should start with IV fluids, ठीक है, पहले हमें IV fluids देना चाहिए. अगर आप इसमें भी आप ग्रॉस नेग्लिजेंस कर रहे हो, इसको बोलेंगे डॉक्ट्रिन ऑफ कॉमन नॉलेज. इसको बोलेंगे डॉक्ट्रिन ऑफ कॉमन नॉलेज. ये भी एक वेरिएंट ऑफ 𝗃𝗃𝗀𝗀𝗃. या बढ़िया डॉक्टर अनिरुद्ध. या गुड, बेटा. Yeah, previously it was under IPC, now it is being replaced by this BNS. Okay, good doctor. But it is not in IPC also, it is not 354, it is 304. Okay, and there are few more things. Okay, we'll talk about this BNS part. There are few more things. If you see, there are which actually happens by its own. For example, there is this therapeutic or diagnostic misadvantage, means because you are trying to save the life of a patient, but in such unfortunate situations there will be small nick or click you do that leads to this bleeding or leading to some damage or death of the patient. So it is known as therapeutic or diagnostic misadvantage. Okay, injury of or death of a patient due to unintentional, so you don't want to harm, okay, you don't have, उनसे तुम्हें कोई लेना देना बिल्कुल नहीं है, लेकिन but you had this inadvertent act, okay, because by mistakenly it happened. It is known as therapeutic or diagnostic misadvantage. So इसीलिए हम क्या करेंगे, हम पहले जो भी प्रोसीजर करेंगे उसके पहले हम कंसेंट लेंगे. Okay, consent लेंगे. Okay, remember, we'll take consents. उसके बाद then about this inevitable accident or medical maloccurrence or act of God. Yeah, the same thing, around the same, like there will be few things which is not in your hands, like we'll try to save the patients with CPR and intubation and everything, but unfortunately the patients goes off, so it is not in our hands. Okay, this is known as act of God. Next one, it is this your hands which is making the difference. Nervous actus intervenens, fine, means you are putting a new act. For example, there is a patient who presented with you for an RTA. Okay, he presented after an accident. Okay, some small injury in his finger. Okay, but what you did, you want to take his blood sample, so you tied up this tourniquet, and you withdraw this blood, but you forgot to remove this tourniquet. So because of not removing this tourniquet, this guy is an introvert. You know, right, how this introvert feeling looks like. Yeah, तुम्हें पता ना जो introvert होते हैं तो कैसे बात करते हैं. तो he thought like maybe it is one of the treatment method to reduce his pains. After few hours, like maybe it is in the night, in the morning when you come on back and see, you saw this all of this limb which is being edematous and swelling, and the patient is crying with pain, and this is leading to this ischemia. So the patient came for small thing, but you made another thing which is causing this death of these patients or causing any injury to the patient. It is known as novus actus intervenens, means you are trying to add a new act, or you did a new act which causes this injury. So it is known as novus actus intervenens. Okay, yeah, good Dr. Puneet. Yeah, Next, फिर उसके बाद आगे बढ़ते हैं. There is two res. One is res judicata. Next one is known as res indicata. For example, if some of your friends who did any of this medical negligence, but in lower courts, for example, in the case of district courts, it has been proven that no, he didn't did any medical negligence. Then once it is being decided, the patients cannot go on appeal in the further court. So it is known as what? It is known as res judicata. It is known as res judicata. Once decided, then you don't need to go for this multiple things. Okay, this is known as res judicata. Whereas res indicata means you have written a prescriptions. You have written a prescription for a patient with means you are in sleepy mood or something in your different duties. You are written a prescription which is actually wrong, but this prescription or this case should be made within 2 years. It should be made within 2 years within the act of concurrence. For example, today if the doctor is making any mistake, the file or the complaint should be registered within 2 years. If it is registered after 2 years, then it won't be taken for calculation. So this is known as res indicata. So it should be within 2 years. Okay, that is the thing. It should be within 2 years. फिर उसके बाद आते हैं contributory negligence. Okay, contributory negligence में दो चांस होता है. ठीक है, one is known as last chance clear rule. Another one is known as avoidable consequences rule. Like for example, the same patients you saw, like the tourniquet has been tied, but the patients didn't told, or if means the patient didn't told. Okay, it is not his mistake, right? So in such cases, like you had a last chance that you came to visit him, but you didn't remove the tourniquet. So you had a last chance, but you didn't use it. So it is known as last chance clear rule. Next one, there is a few avoidable circumstances. For example, you need to do multiple dressings, you know, right? When there is a wound, we need to do alternative day dressings initially, or some cases we need to do everyday dressing. So if the dressing has not been done properly, then it leads to these infections. Whereas here the point of care or the problem or this negligence lies with the patients. So it is known as contributory negligence. Like you also didn't advise other patients properly that to change these things properly. That's why he didn't change. So it comes under the contributory negligence. Okay? Yeah, that's correct. Dr. Gautam, Dr. Puneet, yeah, both of them, the doctor and the patients, both of them, they do this negligence or do these mistakes. It is known as contributory negligence. Okay, and the final one, it is known as what? Doctrine of respondent superior, also known as vicarious liability. Okay, let the master to answer. For example, if you are the surgeon, you are the chief surgeon, imagine you are the chief surgeon, you are asking scalpel please. Okay, once you ask the scalpel please, they will give the scalpel because you are the chief surgeon, right? Then there are few people who will be assisting you. If any of them they mistakes any mistakes, or if they make any mistakes, then you should answer because you are the chief surgeon or you are the chief responsible for them. Any nursing officer or any technical assistant or OT assistant, if they make any small problems, then you should be responsible for it. So it is known as vicarious liability, also known as respondent superior. Okay, yeah, good, Dr. Ashutosh. Next, we'll move on to this hierarchy of courts. If you see about this hierarchy of courts, they will ask you, if the second class judicial magistrate can do imprisonment for how many years? Okay, for imprisonment, how many years he can give a maximum imprisonment, like that they will ask you. So in such cases, you need to remember this. So remember as 1, 3, 7, okay, 1, 3, 7, 10, 1, 3, 7, 10. Yeah, good, Dr. Anjali. If you see this, see the second class, it is the lower class. So second class, then first class. So second class magistrate, then first class magistrate, and then chief judicial magistrate. Then followed by this, there will be this assistant sessions. Then additional sessions are actually the sessions court. Okay, there will be the second class, first class, then chief, then there will be assistant and sessions. Then followed by this, there will be this high court and supreme court, followed by this high court and supreme court. So these are the hierarchies. First there will be second class magistrate, first class magistrate, followed by this chief, and followed by this assistant sessions, followed by the sessions court, and followed by this high court and the supreme courts. Fine. So here they will ask you, if a second class judicial magistrate finds that he is the culprit, then he can fine up to or given maximum imprisonment up to 1 year. Whereas this second class is up to 1 year, whereas first class is up to 3 years. The chief can give up to 7 years of imprisonment, and the assistant sessions can give up to 10 years. and the sessions court. The sessions courts can give any sentence including death sentence. But here the catch. They will ask you the assistant sessions can give a death sentence. The answer is no. Whereas if they will ask you the sessions courts can they give a death sentence? Yes. But it should be confirmed by the yeah, good Dr. Gautam, it should be confirmed by the High Court. Confirmed if any death sentence. Okay. And after this High Court, then Supreme Court and High Courts, both of them, they can give any sentences including the death sentence. Okay, remember. And about the fines, the second class judicial magistrate and the first class, they have these limitations. The second class judicial magistrate can give up to 5,000 rupees of fine, whereas this first class can lay up to a fine of 10,000 rupees. Okay, so this is the hierarchy of courts. So second, first, then chief, then assistant, then sessions, then High Court, then Supreme Court. So remember it is 1, 3, 7, 10, and then unlimited. Fine. Yeah, that is correct. Yeah, lowest court which can give you a death sentence in India, it is what it is, the sessions court. Okay, but it should be confirmed with High Court. Bas itna yaad rakhna. Okay, then remember. Then we'll move on to the next part. We see there are few more punishments you should remember of. Like for example, recently they changed this IPC into BNS. Okay, so in July actually they implemented, so there were less chances which are being asked in the June examination. Like in FMG is such an examination whether like where the NB want to try new things, like that's, you know, like the where NB want to try the new things. So I have this gut feeling that if they want to ask, they will start with this FMG examination, okay, or else they won't ask. But if they want to start asking BNS, they will ask in the FMG examination first. Okay, so remember it is the BNS. Okay, Bharatiya Nayana Samhita. Fine, yeah, that is this BNS. So in the case of BNS, we should know few important sections for sure. One is this rape, next one is the miscarriage, and next one is about the sexual assaults. So these are the three things you need to know. First one about this rape. Section 63, like the chapter 5, it will discuss about the offences against the woman and children. Okay, in which if you see the section 63, it will defines the rape. Whereas 64, it will give punishments for the rape. So 63, it is rape. 64, it is the punishment for the rape. So on 65, if you see, it will give punishment for rape in special situations. If this rape is done in a female or this child who is less than 16 years of age, or the child who is undergone this rape who is under 12 years of age. Yeah, previously under IPC it was 376. Yeah, good Dr. Puneet, but don't confuse much things with IPC. Okay, mostly if they want to ask, they will ask with recent BNS systems, or else they won't ask. Okay, they have two options, they will ask BNS or they won't ask anything about this one. Okay, and about section 66 of this BNS, remember it is all of these BNS sections. Okay, so okay, if this section 66, if you see, yeah, it will come under the POSCO also. Yeah, section 66, if you see, it is the punishment for causing death or resulting in persistent vegetative state, like a coma state after this incident of a rape. So it will be under section 66. Whereas in the case of BNS 67, there will be this sexual intercourse by this husband upon wife during these separations, means they are seeking divorce, but the husband is insisting to do sexual intercourse, and it is considered as rape. Okay, and it is considered as rape. Section 68, there is a sexual intercourse by this person in an authority. And 69, okay, 69, it is what? It is this sexual intercourse by employing in deceitful means. Okay, whereas 70, it is for the gang rape. 70 is for the gang rape. And 71, that is for this repeat offenders. And 72, if a rape victim comes to you, okay, if the rape victim comes to you, then you should not disclose her identity. Okay, so if the identity of this rape victim has been shared outside, it will be punishable under 72. Okay, punishable under 72. So no, there is no need of reading IPC as per me, because they implemented new BNS. So what is the role of previous ones? Okay, because whenever a new act comes and it is implemented and it is currently using it, then what is the need of the previous one? We need to replace them back. Okay, just remember, Okay, so most in 99.9% cases they won't ask IPC. Okay, don't grab on them. Just if you want to read this sections, you read BNS. Okay, this is my advice to you. Fine. And next about this assault. If you see about this assault, there will be 74. It is considered as the assault or criminal force to the woman to intent to cause her outrage to her modesty. Okay, so if there is any assault or anything which is happening to intent to outrage her modesty, okay, so this is known as what? This is known as assault. So assault, it will be classified as this BNS section 74. Okay, no need of IPC. Okay, then section 75, it is for the sexual harassment. So remember, it is 74, it is the sexual assault, whereas 75 it is for the sexual harassment. 76, it is the using of this criminal force to woman with intent to disrobe her modesty. Whereas 77, you know, right, voyeurism, the peeping tom, like someone is having this sexual intercourse and you are or the patient is seeing with seeing them having the sexual intercourse. So it is known as what? It is known as voyeurism. Whereas voyeurism, it is what? Simply it is the watching the act of sexual intercourse. Section 78, it is what? It is stalking, means there is a female, she is going and there is a guy who is following her. Okay, who is following her. Okay, so who is following her. Okay, so who is following her. So this is what? This is known as stalking. Okay, yeah, this is known as stalking. Okay, next one, next one, section 77. If you see, it is a word or the gesture to insult the modesty of the woman. It is a word or the gesture, like if you're telling some words or in your different gestures. Okay, if you are making different gestures and which is causing this insult or of this modesty of the woman, it is what? It is treated as section 79. So in this you need to remember, 74 it is the assault, 75 it is the sexual harassment, 76 it is using the criminal force for this assault, and 77 it is the voyeurism, 78 it is the stalking, and 79 you are using a word or a gesture to disrobe the modesty of a woman. Fine. And about this rapes, you remember, 68 it is for this person in authority, 70 for the gang rape, and 66 for this causing death of the rape patients, and 67 it is the sexual intercourse of this husband during separation to her wife. Okay, बस इतना याद रखो अगर आपको सब कुछ याद नहीं हो रहा है. ठीक है, then we'll move on to the next part. फिर उसके बाद offenses related to marriage. One of the offenses, what? It is the dowry death, and dowry death, it is under the BNS section of 80. Okay, 80 it is the dowry death, and section 85 it is this cruelty of this husband or this relative of the husband to the woman. If the husband's relative, like mother or sister-in-law, mother-in-law, sister-in-law, if they are making any cruel to her, so it is be treated and it will be comes under this 85, or the punishment for this will be given under the section 85. Fine. And about this abortions, if you see, abortions means causing this miscarriages. So if it is section 88, it deals for this causing of miscarriages, and there are different types of miscarriages. This miscarriages can be done with consent or without consent. Usually they are the illegal abortions. Okay, and section 89, it is for what? It is for this causing this miscarriage, but it is not without the consent of the woman. Okay, without the consent of the woman. See, if there is a family, like they need, like in few families they need only girl child or they need only boy child. So in such scenarios they do these abortions, in which the female, she don't want to undergo abortion. In such cases she can file this case, means they are causing this miscarriage without her consent. Okay, फिर उसके बाद section 90. Okay, section 90, it is this death of the woman, because if they are doing these illegal abortions, then we know they use unsanitary conditions and there won't be any proper sterilization. So because of this, they can lead to this death of the woman, and this death of the woman, it will be punished under the section 90. Section 90, remember. Okay, and about section 91, it is we are preventing this birth of the child. Okay, we are preventing this birth of the child, because in some cases there will be there, right, like the female will be there and the husband must be the army warrior, or the husband is died. If the child borns, then obviously the property will be inherited to this child. So in such cases, the mother-in-law or the father-in-law, what they will do, they will prevent this birth of this child by doing abortion. So this, it will be treated as, and it will be punished as in the section 91. And in section 92, it is also causing death of the quick unborn child by amounting to, and this will be aided with this, and it will be amount to this culpable homicides, like amounting near to the killing. Okay, remember. Next, about this few offenses to this child. If you see, you saw a child and exposure to this abandonment of this child of 12 years by this parent or this authority or who is having this care of it, okay, it will be punished under section 93. Fine. Next, if you see this section 94, you will see, like, there is a child who is being born, like, you know, like there will be some affairs will be there in such scenarios, because I have been experienced a case in while during my hospital internship. So if you see, like, I saw a case, it was in the morning 8 a.m. like there are few mob of peoples, they are bringing a small child to the emergency department, to the pediatric emergency department where I was posted. And when I saw this child, the child was having these bruises over his face and his skull. And when I asked what happened, क्या हुआ, then they told, sir, किसी ने बच्चे को फेंक दिया. So they told this, literally this word. ठीक है, they dropped this child from the 5th floor to the ground floor. Okay, so this type of things will happen, and mostly when we did this investigations along with the help of police, and we as we know, like, we treated the child as well. But when we did this proper investment, then we got to know that that is because of a affair. So in such cases, then the baby will be dead, like we are causing this death of the baby, or by concealing the birth, okay, by secret disposal. Okay, yeah, sure, like, yeah, I will tell about superfetation, fecundation, sure, okay, don't worry. Okay, about 95, about the section 95 of BNS, okay, that is hiring or employing or engaging a child to commit an offense. Like, means we know this previously they used to tell, right, like if a child commits crime, it won't be punishable, but there is a age limit we have limited. Like, if the child, if it is around this 12 to 17 years of age and he is knowing the act while doing this act, then it will be considered as a heinous crimes. Okay, and there is a doubt which asked about this superfetation and fecundation. So remember this C, ठीक है ना, तुम्हें मतलब दोनों एक देगा, like they will be similar to this. Okay, both of them, they look similar to this, but what is the catch factor here? So if you see fecundation, so अगर C में, ठीक है ना, this is the only one letter which is different, which is this one of the letter which is different is C. So C, remember, it is the same cycle. It is the same cycle. Same cycle, C for same cycle. अगर same cycle में दो बच्चा पैदा हो रहा, if same cycle two babies are born, okay, means both of these two babies in a same cycle, one is white baby and one is a black baby. Okay, remember, one is a white baby and another one is a black baby, means sexual intercourse within a same cycle with two different men. Okay, it is what it is, the super fecundation. So that's why one baby is white and one baby is black. Whereas if you see the superfetation, it is within this two cycle. Okay, two cycle, okay, because there is no C. No C means it will be in two cycles. So इसीलिए क्या होगा, एक बच्चा बड़ा होगा, एक बच्चा छोटा होगा. So one baby will be large and one baby will be small. Okay, बस इतना याद रखो. Yeah, good guys. So there will be one small baby and another one it will be a large baby. Okay, so this is the differentiate factor for this superfetation and superfecundation. I guess you got this right. फिर उसके बाद आगे बढ़ते, one of the few interesting and most important topics. आगे बढ़ते hanging की तरफ. In a case of hanging, there are different types of hanging. If you see this hanging, the leg is suspended. Okay, the leg is not properly touching the ground, so the leg is suspended. So in such cases, this ligature material, what it will do, it will cause compressions. It will cause compressions, and there are different reasons for its death. पहले क्या होगा, when this start compressing, because क्यों compress कर रहा है, क्योंकि body लटक रहा है, the body is swinging, okay, and it is causing this compression. So one initially around 3 to 5 kg of forces, it will initially causes this cerebral ischemia. Followed by this, there will be venous return will be there. It will compress this jugular vein and it will cause what? Venous congestion. फिर उसके बाद क्या होगा? When you know, like, there will be more than 15 kgs. So when it will start experiencing the pressure, it will compress the airways, and it will compress the airways, and it will cause this asphyxia, and it results into the death. तो इसीलिए इसको बोलते हैं, क्या बोलते हैं? Asphyxial deaths. It is known as what? It is known as asphyxial death. Okay, there are two types of hanging. Okay, if the body is not touching, it is known as complete hanging. Okay, अगर आप इसमें देखोगे, the body is touching, ठीक है, बॉडी नीचे टच कर रहा है. अगर if it is touching to the ground, it will call them as partial hanging. ठीक है, लेकिन इन partial hanging में वो कैसे बढ़ेगा? If you see, in the case of complete hanging, it is because of the whole body which is constricting the neck at the ligature level. Whereas in the case of partial hanging, वो अपने सिर जो because of this our weight of the head, what will happen? It will go and compress this. Our head will compress with this ligature material and will cause cerebral ischemia. The compressing force in the case of partial hanging, it is what it is the head. ठीक है, and फिर उसके बाद हम yeah, that is the head weight. Good. फिर उसके बाद if you see, there are few signs whether you need to know whether they are this antemortem, means he died because of suicide or he died because of homicide. So if you see, there are two signs you need to know. Like one is this 𝗵𝗵𝗀𝗀 sympathetic. If there is this knot, this will compress the sympathetic chain and it leads to this opening of this eye along with the dilatation of pupil. So it is known as 𝗵𝗵𝗀𝗀 sympathetic. Okay, then another one is if it is compressing this salivary glands, mostly the opposite side salivary glands, it leads to the dribbling of the saliva. It is known as what? It is the two of them, they are this antemortem sign of hanging. फिर उसके बाद if you see this ligature material, you know this hanging, it won't be complete. If you see here, it is not complete, right? There is some gap here, so it is what? It will be incomplete in nature. So इसीलिए वो it will slip off and above the thyroid, and it won't be transverse, it will be like this. So it will be what? It will be oblique in nature. So it will be remembered as IOS. It will be incomplete, oblique and suprathyroid in nature. फिर उसके बाद because he's hanging like this, this blood will start pooling into his hands, and this hands will be having this type of patterns, and with the same will be happening into his legs. Okay, so it is known as glove and stocking pattern. So it is known as glove and stocking pattern of hemostasis. Glove and stocking pattern of hemostasis. इतना याद रखना. फिर उसके बाद in the case of judicial hanging, like judicial hanging में तो हम इतना देर नहीं रुकते हैं. तो in the case of judicial hanging, what we'll do? We'll give a jerk. Okay, we'll make them to hang, but give a jerk. When you give this jerk, there will be this fracture of this C2 vertebra and fracture and dislocation of C2 over C3. So this is known as hangman's fracture. So in a case of judicial hanging, the fracture is means the death is due to this spinal cord injury and this hangman's fracture. Okay, remember it is the hangman's fracture. और जैसे हम will give a jerk, right? So at this moment, this aorta will stretch and it will produce this internal tears. ठीक है, जैसे खींचेंगे, then there will be this stretch, right? And this stretch lead to this bleeding point. It is known as what? It is known as Amusard sign. Yeah, good Dr. Anirudh, good Dr. Puneet, and good Dr. Anjali Sathaj. Yeah, good. Fine. This is this hangman's fracture. It is a fracture and subluxation or dislocation of C2 over C3. Yeah, good Dr. Sathaj. फिर उसके बाद आते हैं few more asphyxial deaths. Like for example, the first one, if you see, these are the strangulations, means causing this compression over here. So if you use your hand to compress the neck, it is known as what? It is also a strangulation method, but it is known as throttling. ठीक है, here हम क्या यूज कर रहे हैं? हम उंगली यूज कर रहे हैं. We are using these fingers. So we know this fingertips, right? These fingertips will be having the pressure over there. So if you see here, once you press, there will be this blanching will be there, right? That's likewise, if you use these fingers, here you will be able to see this finger marks as this discoid or this copper penny bruises. Okay, we'll be able to see this. They are known as what? Copper penny bruises. Okay, yeah, good Dr. Gautam, good Dr. Anirudh, good Dr. Quainan. Okay, then if instead of using your hands, if you are using your elbow as a constricting force, then it is known as what? Then it is known as mugging. Yeah, good Dr. Naresh. Next. Yeah, the same thing. If you cut open and see, then there will be this external abrasions and bruises will be seen. Okay, then then because of this there will be a fracture of this bone which is known as what, which is known as hyoid bone as well. Okay, फिर इसके बाद instead of keeping your hands, you can use some of this wire or this one wire or some of this ligature material. Of this wire if you are putting, it won't go oblique, right? You will just put straight. So this type of ligature if you use, it is known as ligature strangulation. Okay, it is known as what? It is known as ligature strangulation. ठीक है, फिर उसके बाद this ligature strangulation, as I told, it will be straight. It will be straight. So it will be transverse in nature and it will be complete in nature. ठीक है, इसमें हम तो बिल्कुल जगह नहीं छोड़ेंगे. So there will be no place left behind. So it will be complete and it will be transfer. और हम इसको मतलब mostly will slip into the downside. So it will be infrathyroid in nature. It will be infrathyroid, it will be transverse and it will be complete. ठीक है, ये तीनों चीज रहेगा. Whereas in the case of hanging, it remember it as IOS. या क्या होगा? इट विल बी इनकम्प्लीट रहेगा, फिर उसके बाद ये ऑब्लिक रहेगा, फिर उसके बाद ये क्या रहेगा? इनकम्प्लीट ऑब्लिक और दूसरा कौन है? दूसरा क्या है? IOS. इट इज व्हाट? इट इज द suprathyroid. It is the suprathyroid. Okay, IOS, it is the suprathyroid. Okay, remember, whereas in the case of here it will be infrathyroid. तो इतना याद रखना. Yeah, good डॉक्टर गौतम. फिर आगे बढ़ते. Then there are few more methods. Instead of doing this much, what you do, you just compressing, you just block his nose and mouth. If you block his nose and mouth, then there will be no way him to breathe, right? Then he will die. Okay, so in such cases, instead of blocking in the way of blocking nose and mouth, it is known as what? It is known as smothering. हमें पता है कि usually no one will want to do, right? So अगर instead of using your hands, you can use this pillow as well. Okay, अगर आप pillow रख रहे हो तो there is a chances his nose may get fractured, nasal bone fracture. अगर आप हाथ रख के कर रहे हो तो then you will cause compression over this area, तो leading to this bleeding. ठीक है, इसके अंदर छोटे छोटे bleedings आपको नजर आएंगे, तो इसको बोलते हैं ये क्या है? smothering है. तो it is what? It is the smothering. Okay, and yeah, we are compressing this passage of air at the external level. Fine. So there will be this bruising of the lacerations over the lips and gums. अगर ठीक है आप इतना नहीं करना चाहते तो आप क्या कर रहे हो? तो मीन्स यू आर कलेक्टिंग दिस क्लॉथ. ठीक है, कोई भी क्लॉथ उठा रहे हैं उसको मुंह में के अंदर डाल दे रहे हैं. मीन्स यू आर grasping a cloth and you are putting into his mouth to not him to breathe. So अगर क्लॉथ अंदर डाल रहे हैं इसको बोलेंगे gagging. It means pushing a gag. It is known as gagging. A good doctor 𝗧𝗵𝗶𝗀, good doctor गौतम. फिर उसके बाद if you are doing this smothering along with this, you are means compressing him, you are causing trauma to the chest and you are making him immobile. Okay, making him immobile or making him immobile to breathe. Okay, if someone is sitting over chest, will you able to breathe? No, right? It is difficult for you to breathe. So this combination of this traumatic asphyxia, along with this smothering, okay, it is known as what? It is known as this one. It is the balking. Yeah, good Dr. Puneet, good Dr. Anjali, good Dr. Anirudh. Yeah, best. Wow, good. ठीक है, फिर उसके बाद आते हैं ड्राउनिंग पे. Okay, there are different types of drowning. Okay, one is this typical drowning, another one is this atypical drowning. ठीक है, typical drowning, atypical drowning. Typical मतलब हमें पता है तो usually होता है. Drowning typically मतलब पानी अंदर चले जाता. Okay, there will be two types of पानी. Either there will be a good water which is this fresh water or this salt water. ठीक है, फ्रेश वाटर में हमें लगता है कि अच्छा पानी है तो थोड़ा देर से मरेंगे. बिल्कुल नहीं. Now if it is a fresh water, the patient will die soon. So the patient will die around within 4 to 5 minutes in a case of fresh water drowning. Okay, and in a case of fresh water drowning हमें पता है बहुत ज़्यादा पानी अंदर आएगा. जैसे पानी बहुत ज़्यादा अंदर आएगा, it leads to this breakage of this RBCs and lead to this हाइपरकैलेमिया. हमें पता है कि सेल के अंदर क्या होता है? बहुत ज़्यादा पोटेशियम होता है. So when this break out, this potassiums will come out and it will cause ventricular fibrillation and it will cause death within 4 to 5 minutes. Whereas in the case of saltwater drowning, we know when the water enters, it has more salt. So it will make the RBC to shrink and it will cause this pulmonary edema. And because of this pulmonary edema, फिर उसके बाद cardiac failure जाएगा. तो it will take some time. So it will take some 8 to 12 minutes to make him die. Okay, so this, if there is a passage of this water, it typical है. So it is known as typical drowning. Okay, it is known as wet drowning. अगर atypical drowning में बहुत सारे चीज हो सकते हैं. For example, like he drowned downside. ठीक है, वो मतलब he drowned by closing his nose and mouth. But when he went to the down, at some point he need to breathe, right? When he try to breathe, this water comes in and it will cause this laryngeal spasm and causing him to death. So it is known as what? It is known as dry drowning. It is known as dry drowning. ठीक है, फिर उसके बाद एक और होता है इमर्सन सिंड्रोम like means usually जिसको कूद के मरना है means who want to slip off and die, ठीक है, or who wants to deep and dive, they won't like do like a flat, right, they will just go like this, ठीक है. अगर if instead of diving like this, if someone is falling like this or mistakenly someone while swimming falling like this will cause this body parts to be exposed to the water. अगर जो body parts से और this पानी का temperature, if there is any difference in this body and this पानी का temperature, then what it will do, this will cause this vagal incubation. हमें पता है if there is any vagal incubation of this heart, it leads to this bradycardia and death of the patients. अगर vagal incubation से हो रहा है उसको बोलेंगे इमर्सन syndrome, ठीक है. Then yeah, means you are passing by a road, you saw in a lake, there is some person who is trying to do suicide, okay, but you know swimming, so you grasp the patients, you brought out him and you treated him in the hospital, but he died in the hospital. अगर वो पानी से नहीं मरा, ड्राउनिंग से नहीं मरा, वो हॉस्पिटल में आकर मरा, उसको बोलेंगे near drowning, okay, near drowning. After this because of these complications he died, so we call them as near drowning. Yeah, good Dr. Puneet, yeah, good, yeah, good Dr. Puneet, good Dr. Satash. फिर उसके बाद there are few signs of this antemotum signs of this drowning. अगर आप देखोगे तो this the patients will be swallowing water, right, instead of swallowing air he will swallows and he will respirate the water itself, so it leads to this boggy lung which is known as emphysema-aquosum. फिर उसके बाद if there is one more thing, this exposure to this water, it will produce this goosebumps. इसको बोलेंगे हम क्या बोलेंगे, cutis and serena. Okay, फिर उसके बाद if it is exposed to usual water, if it is postmortem antemortem, it will lead to this washerwoman's hand. Okay, fine, yeah, good, yeah with this Sridevi, yeah, good Dr. Mohammed Anash, nicely you are correlating, fine. Next, फिर उसके बाद if it is occurring at the level of lungs, there will be these small hemorrhages can be seen. It is known as Pultoff's hemorrhage. And we know there is in some such situations like we need to know whether the patient is died by suicide or by homicide. So suicide किया है, then he will be drinking this water, respiring with this water, then this water will go into his circulations. तो water में छोटे छोटे particles होते हैं, उसको बोलेंगे diatom test. देखिए diatom will go and reside into this bone marrow, तो bone marrow का examination करेंगे, then we'll see this diatoms there. फिर एक और टेस्ट करते हैं, उसका नाम है Gutless टेस्ट. दिस Gutless टेस्ट, it is used to differentiate between this salt water drowning and the fresh water drowning, whether the patient is died from this salt water drowning or fresh water drowning. तो उसको differentiate करने के लिए we'll use this Gutless टेस्ट, ठीक है, या गुड गाइस. फिर उसके बाद है now the patient is died, ठीक है, patient तो मर गया, ठीक है. Now once the patient has been died, then the body will undergo few changes. There are few signs which we can see, yeah, the patient is died. The first one or one of the few signs, it is the liver mortis, means there will be the discoloration of this dead body. And another one is there is no thermoregulatory mechanism. Okay, we studied, right, there are two nucleus which helps in this thermoregulations. Cooling is done by this anterior nucleus of this hypothalamus, whereas heating it will be done by this posterior nucleus of the hypothalamus. कोई भी नहीं चल रहा, तो इसी वजह से this body will start dropping its temperature one, so it leads to this cooling of the body, ठीक है, body को ठंडा होने देगा, ठीक है, या. फिर उसके बाद आते हैं rigor mortis, it is the stiffness. So these are the three early signs. फिर उसके बाद क्या होगा, means then there will be this bacteria inside his gut, so because of this bacteria क्या होगा, there will be this putrefaction. Because of this bacteria there will be this putrefaction and there will be few enzymes. We studied in pathology, right, there will be few enzymes inside the cell, they are known as lysosomal enzymes, जो cell membrane का भी break कर रहा था, तो the same enzyme will cause lysosomal lysis. This is known as autolysis. ये भी करेगा. Then the decomposition, because of this bacteria it will start decompose the body, ठीक है. What are the signs we'll see? First one of the sign we'll see, this is asked in the previous FMG examination. They will tell there is a body which was unattended for 4 to 6 hours and assumed to be dead, and in this body of the patient or in this patient you will be able to see this type of triangle shaped deposition into his cornea. इसको क्या बोलेंगे, this triangle shaped क्या बोलेंगे, no it is not tram track, triangle को क्या बोलेंगे, इसको बोलेंगे टेकिनोयस स्क्लेरोटिका, इसको बोलेंगे क्या, टेकिनोयस स्क्लेरोटिका. या गुड गाइस, गुड. फिर उसके बाद if they ask you what is the earliest sign, you will see in a case of death in as a retinal changes, तो तब हम बोलेंगे 𝗶𝗶𝗀𝗀 sign. या गुड गाइस, 𝗶𝗶𝗀𝗀 sign, it is what it is this cattle tracking. It is the cattle tracking. Okay, remember, it is the cattle tracking. So these are the signs which we see in eyes. As I told you, there is this decrease in temperature, which is also known as postmortem cooling, also known as अल्गरमाटिस. तो इसको हमें क्या करना है, हमें थर्मोमीटर रख के हमें इसका टेम्परेचर हमें मेजर करना है. तो टू मेजर दिस टेम्परेचर यूजुअली वी यूज रेक्टम. ओके, रेक्टम विच इज इजीली एक्सेसिबल. लेकिन इन अ केस ऑफ सूडोमी मीन्स इफ देयर इज अ केस ऑफ डेथ इन विच देयर इज अ anal intercourse, suspected anal intercourse was present, तो तब हम रेक्टम में नहीं डालेंगे. तो ओके, सो जस्ट रिमेंबर देयर वी वोंट यूज रेक्टम. ओके, वेयर इज दिस आइडियल साइट, इसमें आइडियल साइट क्या है, वी यूजुअली मींस इन द केस ऑफ आइडियल साइट विल यूज सब हेपेटिक स्पेस, वेयर एज हम यूजुअली उसको नहीं करते हैं क्योंकि रेक्टम तो इजीली एक्सेसिबल है ना, तो विल डू फ्रॉम द रेक्टम इटसेल्फ. एंड दिस रेट ऑफ फॉल ऑफ दिस टेम्परेचर इज व्हाट, इट इज दिस 0.5 डिग्री सेल्सियस per hour. ठीक है, लेकिन ठंडे या गर्म मौसम में बेस्ड ऑन दिस टेम्परेचर दिस रेट ऑफ फॉल may differ. Fine. Then this rate of fall, it is more in a case of water, because water it is a good conductor of temperature, right? तो इसीलिए हम PC में देखोगे there will be this water cooling systems. In a case of radiators in the cars, will use the same water as a coolant, right? So same, this water and this body will get cooled very much faster in water, followed by this air, followed by the soil. ठीक है, इतना याद रखो. It is the टेम्परेचर फॉलिंग विच इज मैक्सिमम इन वाटर. ठीक है, विल एक और डिस्कस करेंगे बाद में. ठीक है, देन अबाउट दिस पोस्टमॉर्टम कैलोरिसिटी, देयर आर फ्यू कंडीशंस इन विच द पेशेंट इज डेड but his temperature is maintained or the temperature is more actually. So what are the conditions? One of them, it is the sunstroke or point in hemorrhages leading to this thermoregulation mismatch. Then the tetanus and strychnine, both of them they cause this stiffness, and because of this stiffness there will be an increased temperature. And we know in case of septicemia उसमें बहुत ज़्यादा बैक्टीरिया रहेंगे, and because of more bacteria what will happen, there will be more in metabolism, there will be more temperature increase. ठीक है, या बढ़िया. Then about this liver mortis. So after death the blood it will start cool down based on the gravity. So based on the gravity the blood will pull on. For example, if the body is like this, then it will come and fall around the base. You know, in the case of hanging, हाथ नीचे ऐसे लटकेगा, तो because of this the hand and the leg becomes the dependent part, then it will come and deposit. This hemostasis occurs in these hands, which is known as what? Which is known as glove and stocking pattern of hemostasis. ठीक है, तो इसको बोलेंगे hemostasis. And this once this hemostasis occurs, it is also known as suggulation. बढ़िया. So it is also known as hypostasis, वाइबिसिस एंड सजुलेशन, इसका दूसरा नाम है. ठीक है, चीकू, बेटू, बेटा, ये सब कुछ है, ये सब कुछ प्यार से जैसे बुलाते हैं ना, वैसे द लाइवर मोटिस इट इज आल्सो नोन एज हाइपोस्टेसिस, क्योंकि हाइपोस्टेसिस हो रहा है. दूसरा नाम है वाइबिसिस एंड सजुलेशन. ओके, रिमेंबर. Next about this sugulation once it occurs, after some time this will be fixed. Okay, means after 6 to 12 hours it will be fixed. Okay, so once it is fixed, we'll call them as fixations. Like अगर आपने कोई भी body recover किया, means it was in this position, and when you try to put them in a different position, if the hemostasis is not moving, फिर याद रखना, means it is more than 8 hours or more than 6 to 12 hours, ताकि ये hemostasis fixed हो गया. Okay, just remember. Yeah, sure, Dr. Bajrang, like I'll confirm it personally from my end in the break. Okay, don't worry, chill. ठीक है, अभी के लिए क्लास पे ध्यान दो, PDF मिल जाएगा. ठीक है, बस ठीक है, have this patience. About this, फिर उसके बाद based on this color of this hypostasis, we can tell which type of or what is the cause of this hypostasis. Fine. So if you are able to see this carbon monoxide, it will produce this cherry red. Carbon monoxide produces this cherry red. And can anyone tell me which part of this electron transport chain does this carbon monoxide inhibits? Okay, which one? Which complex of this electron transport chain? ETC complex 4, yeah. Badia Mohammed Anj. Okay, good. Dr. Puneet, yeah. Then cyanide, if you see, it will produce this brick red hypostasis. Yeah, good, Dr. Anirudh, Ritusha, Ashley, Gautam, wow, badia. बहुत बढ़िया. ठीक है, Varun and Parul, yeah, good. Shaifali, yeah, good, Kainun. Then if you see this hypothermia, means if the body is being under this hypothermia refrigerated, it will be in bright pink. Whereas sodium chloride, nitrate, all of them, they will be in chocolate brown color. It will be in chocolate brown color, yeah. And the sign it will produce this histotoxics anoxia. Okay, histotoxics means that the tissues will be having this oxygen, but they cannot use it. Okay, and this is the brick red. ये हमारा brick red hypostasis. It is the brick red hypostasis, and it is the cherry red. ठीक है. फिर उसके बाद as I told you, this is the stiffness of the body which is known as rigor mortis. It is known as rigor mortis. It is due to the depletion of ATP. And then this rigor mortis एकदम से नहीं होता. It will take some time. It will take 12 hours to appear, and it will stay for 12 hours, and it will go, and it will remain completely zero after 12 hours. So initially it will be flaccid, then it will go to this rigor mortis. Okay, rigor mortis, then secondary there will be flaccidity. So there will be flaccid, then rigor mortis, then flaccid. Okay, then it will follow a rule which is known as Reisten's rule. Like there will be things, right? For example, अगर आप जैसे आप पढ़ना चालू करोगे, आप फर्स्ट पेज से शुरू करोगे, फिर उसके बाद पूरा नोट्स पढ़ोगे, फिर उसके बाद क्वेश्चंस करोगे. तो वाइज द सेम, like with this Reisten's rule, this rigor mortis occurs in a sequential fashions. First they will start occurring in this upper eyelid, उसके बाद नेक पे आएंगे, फिर फेस पे आएंगे, फिर जॉ पे, फिर अपर लिम्ब पे, फिर चेस्ट पे, फिर प्यार से abdomen पे, then about this lower limb. So about this, the sequential this will happen. Okay, remember, yeah. And as I told you, there is this rule of 12. फिर उसके बाद आते हैं cadaveric spasm. They will often ask about this differential diagnosis. ठीक है, you see there is a patient who want to do suicide and die. ठीक है, लेकिन उसको कूदने के बाद ही उसको पता चला, मीन्स आफ्टर डाइविंग इनसाइड ओनली ही रियलाइज दैट ही हैज अ फैमिली टू टेकन केयर ऑफ. So in such moment he try to save himself. He try to save himself by catching the nearby particles. So what will happen but he cannot climb up and he cannot save his life. So in such cases he try to escape, but he will catch only this small debris or the small plants in his hands, and because of this final movements this will remain closed and it will not go under the flaccidity. It will remain as closed, okay, remain as spastic. So it is known as what? It is known as cadaveric spasm. Yeah, good Dr. Puneet. Okay, and it is a sign of antemortem. क्या वो जीना चाहता था and he was alive while during diving, or while trying to catch it he was alive. Okay, so it is known as what? It is known as cadaveric spasm, also known as instantaneous rigor. फिर उसके बाद there is this putrefaction, and here if you are able to see this type of veins which are visible because of this hydrogen sulfide, it is what? It is known as marbling. It is known as marbling, or it will usually takes 36 to 48 hours to occur. Okay, remember. I tells about this last act. Yeah, good Dr. Ashley, good Dr. Naresh, good Dr. Anjali. Yeah, well said, well said. फिर उसके बाद आते हैं, there are few changes which will happen after death. One of them, that is this one, which is known as what? Saponification. Saponifications. अगर if the dead body is disposed in a humid climate, then it will go under this one which is known as saponification, also known as adipose sear. Okay, and they will ask you one thing: is this adipose sear is smelling or not? So it will be having this ammonical smell. It will be having this ammonical smell. Okay, and about this point you should remember about this Casper's dictum. Remember, as I told you, for loss in the temperature, the water will act as a conduct medium of the heat, whereas in a case of decomposition, the air will be having this enormous number of bacteria. So the rate of decomposition, it will be maximum with air. So air will be having this maximum rate of decomposition, then water, then the soil. Okay, then the soil. Okay, remember. Next, this is the mummification. Yeah, this is the mummification, whereas in a case of mummifications it won't be having any order, so it will be orderless in a case of mummifications. Okay, yeah, good guys. Then about this human identification methods, one of them is what? One of them is this fingerprint. Or fingerprint में they will ask you what are this type, or what is the most common type of fingerprint. So इसको याद रखने के लिए आपको याद रखना है कि love, wife and children. So the most common one, okay, it is this loop. It is the most common one. So I say loop बना रहा है ना, so it is the most common one. Okay, followed by this whorl, like this is whorl, like समूह बड़ी सामने देखे, myelin figure सामने देखे, ठीक है. So ये सारे whorling pattern है. So this is the whorl patterns. Then about this arch, okay, जैसे arch बना रहा है. So it is what? It is the arch. Sometimes this is can be as composite ones, मतलब दो तीन, मतलब जैसे whorl बना रहे हैं उसके साथ साथ arch बना रहे हैं. So composite means kind of mixed one. Okay, and this fingerprints, it will start appearing by 12th week of intrauterine life, and it will completed by 24th week, and it will be different in even twins, even monozygotic twins. इतना याद रखना. It will be different, yeah, it will be different even in monozygotic twins. इतना याद रखना. फिर उसके बाद we need to have at least 10 to 12 points of comparison, so that will tell, yeah, this is his fingerprint, this is her fingerprint. Okay, फिर उसके बाद आगे बढ़ते हैं. Then if you see about this bone identifications, means with this bone, how will you identify whether this is a male bone skeleton or is this a female bone skeleton? Like, because in police stations there will be more number of missing cases, right? First you will get a skeleton. Okay, you need to tell whether this is male or female. फिर उसके बाद we'll take up the cases which is related to the male and we will take up the cases which is related to the female. तो पहले आप देखोगे, तो what is the main difference? If you see, there are much more differences, but if you see this sciatic notch, in the case of sciatic notch in a males, it will be what? It will be narrower. Yeah, we'll use one more method, I will tell you. Okay, this sciatic notch, it will be narrower and deeper in males, whereas it will be wider and shallower in case of females में वो shallow रहेगा. Okay, then if you see this, I don't have it. So if you see this pubic tubercle, I will show in the gynecology part. If you see this pubic tubercle, it will be having this narrow angle in a case of males, whereas it will be having this wider angle because of in a case of females, whereas narrow in a case of males. So females में बड़ा रहेगा, males में थोड़ा छोटा रहेगा. Okay, yeah, good guys. फिर उसके बाद based on the skull, how will you differentiate? Based on the skull, you will see the male skull will be steep in nature, whereas in female skull it will be vertical in nature. Okay, vertical in nature, that's why we'll keep this sindoor will keep. Okay, just remember it will be vertical in nature. Okay, and gabella, the female skull, it will be very small, very soft, right? So it will be very less pronounced and it will be smooth in nature. Okay, and supraorbital ridge also, it will be less prominent in nature. Okay, इतना याद रखना. And there is one more feature which is differentiated in females. It is known as what? It is known as pre-auricular sulcus. There will be sulcus which will be present here. It is known as pre-auricular sulcus, and this pre-auricular sulcus, it is not present in this ear, it is present in the hip bone, and it will be prominent in the case of females. ठीक है, pre-auricular sulcus female में रहेगा और ये prominent रहेगा in a females, and it will be even more prominent in the case of pregnant females. Yeah, good Dr. Anirudh, good Dr. Anash. Fine. Yeah. And they will give this one more X-ray. They will give this X-ray image, and they will give this skull image. Okay, they will give this skull image. Okay, this is, imagine this is the skull. Okay, and this is the guy's face. Okay, so they will tell you to superimpose and find it. Okay, and they will ask you what is the name of this investigation. To use this skull X-ray along with this previous photo, we'll call them as superimposition. Yeah, good guys. Then about if the small child has been born, we need to tell the child is might be of this month age. How we will tell? If it is 1 to 5 months, then we'll use this rule of Hesse. Okay, rule of Hesse, and we'll do this square root of it. Okay, for example, if it is 25, we'll tell them it is 5 months. Okay, then about 2nd to 5th months, what we'll do? We'll use this rule of Morrison. We'll use this crown hump length divided by 5. Okay, if it is 30 by 5, 6 5s are 30. So it is what? It is 6 months. Remember. Okay. Yeah. There's two rules, rule of Hesse and rule of Morrison. फिर उसके बाद है autopsy techniques. This autopsy techniques include, like usually हम क्या करेंगे? हमें तो काम आसानी करना है. तो what we'll do? We'll take a knife. We'll touch from here till this pubic tubercle. तो एक ही लाइन बनाएंगे. तो ट्रकिया से लेकर पूरा उठाएंगे, ट्रकिया से लंग उठाएंगे, फिर इसोफेगस पकड़ेंगे, पूरा खींच के ले जाएंगे. सो इट इज द आई मेथड विच इज मोस्ट कॉमनली डन, आई टाइप ऑफ इंसिशन. फिर उसके बाद क्या करेंगे? देन इन सम केसेस, इन केस ऑफ फीमेल्स और सम केसेस, हम क्या करेंगे? विल कीप अप द इंसिशंस अराउंड और बिलो दिस ब्रेस्ट रोड्स. सो देन इट इज नोन एज व्हाट? दिस इज नोन एज व्हाट? वाई शेप्ड इंसिशन. सो acromion प्रोसेस, देन टू दिस ज़ाइफाइड प्रोसेस, फिर उसके बाद स्ट्रेट. फिर उसके बाद एक करते हैं मॉडिफाइड इंसिशन. यूजुअली हम इसको जब हमें नेक का स्टडी करना है तब यूजुअली हम ये मॉडिफाइड वाई करेंगे. मोस्टली इन केस ऑफ नेक हैंगिंग हो गया, थ्रोटलिंग हो गया, तो देयर विल यूज दिस मॉडिफाइड वाई इंसिशन. या बढ़िया डॉक्टर अंजलि क्वाइन. फाइन. देन there are few more incisions like T-shaped or buccal handle incisions and this X-shaped incisions. Like there will be history, they will tell, like in a case of custodial death, what is the type of incision you will use. Like custodial death mein they will use to beat with lathi in the back. So you need to do an incision which is known as X-shaped incision, so to see whether there is a presence of any tram track bruise because of this lathi bites. Okay, fine. Next about autopsy techniques. What are the techniques of autopsy? Yeah, good Dr. Ashi, Kaunin, Anirudh, Sataj. Good. Then about this, what are these autopsy techniques? If you see virchows, remember vir, okay, remember it is vir, okay, it is vir means it is 1 by 1. So remember it is virchow. So it is what? It is removing this organ 1 by 1. Vir, then again vir, then again where. So it is what? It is one by one. Okay, it is removing the organ one by one. Then about luteoles. Okay, let me remove them in en masse. So removing in a total. So it is known as luteoles. Okay, luteoles techniques means removing in en masse or removing all together. Okay, and next one, it is what? It is the Ghon's techniques. Like we are focusing on only few blocks. So we are focusing only few blocks or removing only few blocks. It is known as Ghon's technique. Whereas 𝗏𝗏 techniques, for example, the patient has HIV. Yeah, patients को क्या हो गया? Patients को COVID हो गया. So in such situations, we need to do this infectious diseases under this in situ dissections. तो body के अंदर ही सब कुछ काटेंगे, तो उसको बोलेंगे 𝗏𝗏 techniques. Yeah, good, Dr. Gautam. Yeah, good. Then there are few methods of dissections for organs. For example, heart को कैसे dissect करेंगे? पहले we know the flow of blood, right? पहले हम right atrium को कटेंगे, then right ventricle, then left atrium and then left ventricle. It is known as inflow outflow method. It is known as inflow outflow method. ठीक है? Then about for spinal cord, usually we won't do. If we want to remove, we'll remove from the posterior aspect. और अगर कोई poisoning case है, then we'll remove the stomach along with this part of duodenum. और stomach को हम कैसे कटेंगे? We'll do two ligations, one above, one below. ठीक है? One above and one below. और greater curvature से कटेंगे. Start the cut at greater curvature. Greater curvature, yeah, correct. Greater curvature. ठीक है? इतना याद रखो. Next about this, few types of wounds. ठीक है? In case of types of wounds, अगर superficially है, superficially just grazing just few parts of epidermis, तो उसको बोलेंगे grass aberrations or aberrations. फिर उसके बाद अगर aberrations हो गया, उसमें जो weapons का pattern दिख रहा है, weapons का pattern दिख रहा है, so it is known as what? It is known as patterned aberration. अगर in a case of hanging, if you see, this patients will be able to see two things. One is this pattern aberrations of this weapon, and another one is the pressure. So remember, क्यों बंदा hang करेगा? Because he will be in lot of under stress and pressure. So remember, this hanging will show this pressure aberration, especially pressure aberration. ठीक है, इतना याद रखना, aberration. फिर उसके बाद contusion means if there is any blood clot, blood means if there is any tissue damage outside, it will come out, right? Whereas if there is any in situ tissue injury, it will lead to this collection of bloods into this subcutaneous layer. उसको बोलेंगे हम contusion बोलेंगे, contusion बोलेंगे. Yeah, good. This is the recognize. And in some cases of this contusions, for example, if I hit here, the contusion will be here. Whereas in some areas where if you hit here, the contusion will be here. So it is known as what? Ectopic bruises. Example of ectopic bruises, yes, it is what it is. This raccoon eyes. This raccoon eyes, they are what? They are the example of ectopic bruises, which is due to the fracture of anterior cranial fossa, which is this anterior cranial fossa fracture. Next about this, around this mastoid region or posterior to this ear, you will be able to see this type of discolorization. We'll call them as battle sign. We'll call them as कौन सा sign? Yeah, good, Dr. Ashley. Yeah, we'll call them as battle sign. And this battle sign seen in a case of middle cranial fossa fracture. Will be seen in a case of middle cranial fossa fracture. ठीक है, इतना याद रखो. फिर उसके बाद आगे बढ़ते हैं. If you saw over this bony prominence, for example, during the skull और patella के ऊपर कोई blood, means I am not using any sharp objects. जैसे कोई blunt object से मैंने मारा, ठीक है, मैंने मारा, तो there will be this, because of this bony pressure, this will cause this type of laceration, which is known as split laceration. Split laceration. And then we know in the case of laceration, उसमें क्या रहेगा? There will be this splitting of skin and there will be this tissue bridges outside. ठीक है ना, वो छोटा छोटा टुकड़े में there will be tissues inside will be there and the bleeding will be oozing out. ठीक है, आराम से आएगा. It won't be just एकदम से नहीं आएगा. ठीक है, and if it is like this, which is known as degloving injury. Degloving injury. ठीक है, बढ़िया. Yeah, there will be this irregular tissue margin along with this tissue bridging. Okay, right. Irregular margin and tissue bridging. Tissue bridge. इतना याद रखना. फिर उसके बाद आते हैं इधर. तो it is what it is the proper incision. The proper incision में क्या रहेगा? There will be this tail, this process, which is where at the end it will be very small. It is known as tailing. Okay, and beveling होगा. फिर उसके बाद if it is happening on this multiple cuts, multiple superficial cuts on the around this forearm region, around this elbow, तो उसको हम क्या बोलेंगे? उसको बोलेंगे हम hesitational cuts. Hesitational cuts. ठीक है, hesitational cuts. Yeah. It is the suicidal cuts, they are known as hesitational cuts. Okay, they won't die because of this, they'll just make the gesture of it. So it is what these are, this hesitational cuts. whether if they go very in depth, which may cut this radial artery, which may cause bleeding. Okay, these are this multiple cuts, they are this hesitational cuts. Okay, then about this few skull, if you see this kind of ping pong ball, ठीक है, ball जैसे उसका अंदर हो गया, तो it is known as what? It is known as bone fracture. And if you see here, you are using this some kind of weapon, and this fracture, it is kind of depressed and taking the shape of the weapon which you used. So it is known as what? It is known as depressed fracture, also known as fracture alla signatura. Means it will tell, means the fracture itself, like which type of weapon is used. So it is known as fracture alla signatura. Okay, then one it is the gutter fracture. फिर क्या है? एक gutter fracture. Gutter मतलब जो छोटा सा, if there is any bullet injury or something, then it will lead to this kind of small bony part which is missing. It is known as gutter fracture. Yeah, बढ़िया. A loss of bone. It is the loss of bone. फिर उसके बाद आते हैं bullets का. In bullets there are few wounds. One is this entry wound, another one is the exit wound. Entry wound को हम कैसे बोलेंगे? Means in a case of entry wound, there are different changes will be seen based on the range of injury. For example, if it is very close, or if it is close injury, then there are different types will be coming from the gun. Like there will be this fire will be coming. Okay, then there will be what? There will be this gunpowder, and there will be this burnings will be there, and followed by this there will be a bullet entry wound will be there. Okay, this is this entry wounds. Whereas in a case of distant, there will be just bullet entry wound will be there. Whereas in exit, none of them will be present. Only this bullet exit will be there, but it will be very massive. Will be having this eversions. Okay, we'll see how will you differentiate this entry wound versus exit wound. Okay, in अगर entry wound को देखोगे, if you see this entry wound, it will be what? It will be very small. Okay, very small. Okay, smaller in diameter. Whereas if you see this exit wound, it will be larger in nature. Okay, and the edges will be the bullet अंदर जा रहा है, तो it will cause this inversion. There will be inverted margins, and there will be here everted. ठीक है, तो bullet में क्या होगा? There is a bullet. Okay, while it goes, there will be this wound. तो पहले क्या करेगा? वो abrasion करेगा. ठीक है, और हमें पता पहले bullet में हम lubricants यूज करते थे. ठीक है, तो this will cause grease color. तो this will cause क्या है? Grease color. तो दोनों कहाँ रहेगा? तो both of them will be present in the entry wound. फिर उसके बाद there are few things like smudging, tattooing, all of them will be seen here. Whereas bleeding less कम रहेगा, लेकिन इधर ज़्यादा रहेगा. और fat का जो भी बाहर आना है वो mostly exit wound पे रहेगा. तो remember the entry wound will be very small, whereas the exit wound will be big. Okay, and entry wound will be having this tattooing, burning, singeing, and along with this abrasions color and grease color. Okay. Yeah, good. That's it, guys. Then about this types of gunshots, one is this contact, close, near, and distant. Okay, contact मतलब एकदम से इधर. ठीक है, so if it is contact, तो whatever is there, whatever thing is there, then what will happen is this, all of these things it will go inside the sun. मतलब inside the skin के अंदर जाएगा. तो जैसे अंदर जाएगा तो एकदम से वो फुला होगा. Means एकदम से means it will start bulging out and it will burst like this, like a stellate wound. So this is the contact shot. Okay, this is the contact shot. Okay, then about close shot means you are not in contact, you are just in close. So in a case of close shot, there will be what? There will be this fire will be coming, bullet will be coming, there will be this gunpowder will be there. Okay, so all of these things like burning, singeing, tattooing, and blackening, and also the bullet wounds will be seen in a case of closed shot. Okay, in a set of close में हम क्या रहेगा? See, there will be this circular bullet wound है. फिर उसके बाद क्या? बर्न एंड सिंजिंग है. तो ठीक है, इधर कुछ बर्न है, लाल दिख रहा है. फिर उसके बाद इस सिंजिंग ऑफ हेयर्स, तो इसीलिए इधर बाल नहीं है ना, बिल्कुल इधर बाल नहीं है, लेकिन इधर बाल है. मींस लाइक देयर इज नो हेयर नियर बाय, whereas here wherever this bullet caused fire there is no hair because of this singeing. फिर उसके बाद there is this blackening, वो तो हम ये देख ही रहा है. There is this blackening. And tattooing means there is small tattoos will be there, that is tattooing. And aberration color, like अंदर से देखेंगे तो there will be small aberrations will be there. This is known as aberration color. ठीक है, तो इतना सारा आपको याद रखना. तो कॉन्टैक्ट शॉट वो इट विल बी इन स्टेलेट शेप, whereas in a case of close shot it will be having this all these features. Whereas near range में कुछ चीजें नहीं रहेगा. Example, there won't be this no burning and no blackening. ठीक है, burn भी नहीं रहेगा, blackening भी नहीं रहेगा, लेकिन tattooing हमेशा रहेगा. Okay, in a case of near range. Whereas in a case of long range में क्या रहेगा? Long range में सिर्फ और सिर्फ इस बुलेट का एंट्री रहेगा. सिर्फ और सिर्फ दिस बुलेट का एंट्री रहेगा. और उसके साथ इफ देयर इज एनी लॉन्ग रेंज देयर विल बी दिस बुलेट एंट्री, और जैसे बुलेट जाएगा इट विल अबरेड एंड गो, देयर विल बी दिस अबरेशंस कलर विल बी प्रेजेंट. ओके, whereas in a case of शॉटगन्स हम थोड़ा डिफरेंटली बोलेंगे. इट इज नोन एज नियर रेंज एंड इंटरमीडिएट रेंज. नियर रेंज में there will be this single bullet wound. Like usually उसका पहले close shot almost make the same, whereas near range में there will be this bullet wound, लेकिन हमें पता कि it is made up of different shots. It is made up of different shots which is combined together. लेकिन इसमें जाने वक्त कैसे जाएगा ना, वो rat hole जैसे जाएगा, क्योंकि when they try to separate it out, it will separate like a rat hole. So the bullet entry wound will be like a rat hole, okay, and it will be single in nature. Like whereas intermediate में क्या होगा, there will be this main entry wound followed by this dispersion, okay, dispersion रहेगा, okay. Then that is how we will differentiate this near range and the intermediate range. फिर very distant range में तो पूरा dispersions रहेगा, ठीक है, पूरा dispersions रहेगा. Yeah, good Dr. Gautam, good Dr. Anirudh, fine. Then about there are few types of bullet. Dum bullet. That is dum. Okay, it is not dumb, it is dum. Okay, so dum bullet. What will happen is it will go on dum. Okay, it will go on expands. It will go and expands when it reaches the surface. Okay, so इसके बाद है tandem bullet. Tandem bullet also known as piggyback bullet. Tandem are two bullets. There will be old bullet which is stuck inside the barrel. When you fire the next bullet, two bullets will come together. Okay, that is this tandem bullet. Next one is the souvenir bullet. Like there means there is an army officer who got multiple bullet injuries, so few bullets has been removed, but unfortunately few bullets has been left over. So it is like a souvenir. The bullet was kept inside, so it is known as souvenir bullets. And souvenir bullets से पहले these bullets were used to made up of lead, though it can lead to the lead toxicity. ठीक है, इतना याद रखना. Okay. Then about this incendiary bullets, when they touch, they will cause fire. Okay, when they touch, they will cause the fire. Okay. And about there is a rule which is known as Puppy's rule. Like it will tell which is the first fracture. Okay, अगर पहले मानो this is the first fracture. This is the first fracture. If it is this is the first fracture, it will cause this fracture. अगर उसके बाद जो भी fracture होगा, it won't causes this first fracture. ठीक है, क्योंकि already the fracture हो गया. So this is known as Puppy's rule. अगर third fracture रहेगा, it won't causes this first fracture also and second fracture also. Okay, so if you see this, the red is the first fracture. Red is the first fracture. So this rule it is known as Puppy's rule. It is known as Puppy's rule. फिर उसके बाद आते हैं blast. Yeah, they do not crosses. About this blast waves. Initially during a bomb blast, there will be these blast waves which will cause damage to this air-filled structures like your tympanic membrane and lung. So this is the primary blast wave. In its secondary blast wave, there will be this. Yeah, thank you, Dr. Ritiraj. Thank you. About the secondary, there will be these small flying projectiles. देख रहे हो ना, नजर आ रहा है, ठीक है? The small flying projectiles, they will come and hit and will cause three things, which are known as Marshall's triad. Marshall's triad. Okay, it is this aberration, contusion, and laceration. Yeah, good guys. Yeah, flying missile. Then about this tertiary blast, here the victim will be displaced from one place to other. So he will go and hit into these buildings and he will get the injuries. Okay, जैसे वो hit करेगा, then the building will fall back into him. It is known as quaternary blast injuries, like this structural collapse or fire. Okay, structural collapse or fire. And finally, this quinary blast, where there is this. Finally, there might be some chemical reactions. There might be radiations in a case of kind of Chernobyl accident. So this is what is the quinary blast injuries. Okay, and next we'll move on to this identification methods of blood and semen. So I don't know why they love this thing, blood and semen. They are keep on asking these things. So इसमें आपको बिल्कुल confusion नहीं करना. Remember, there are two tests for blood. ठीक है, blood को confirmations के लिए भी use करेंगे spectroscopy. तो spectroscopy it is for confirmation of the blood sample. पहले चीज याद हो गया. फिर उसके बाद there are two tests. Takayama. So remember, it is a kind of Japanese name, right? So if you see this Japanese things, it will be very cute and small. So cute and small. So it is the pink color. It will be cute, small. It is big, cute, and it will be small, and it will be in attractive colors. So it will be in pink color. So if it is kind of this pink feathery crystals formation, it is known as what? It is known as Takayama. Take a Takayama test. फिर उसके बाद आते हैं Takeman's test. Takeman remember it as T-man. ठीक है, T-man. चाय कौन से कलर होता है? Means what is the color of the tea? You know, right? It is the brown color. ठीक है, brown color पे होता है. Yeah. Remember, you can also remember it as man. ठीक है, man. ठीक है, mostly mans are brown. Or else you can remember it as chai. Okay, the universal like nasha of India. Okay, so it is what it is the tea. The tea will be what? It will be brown in color. So this take man will be having this brown rhombic crystals. Okay, and about this next test, which is for this सेमन के लिए हम यूज करेंगे टू टेस्ट. वन इज नोन एज व्हाट? वन इज नोन एज दिस टेस्ट विच इज व्हाट? विच इज दिस येलो शेप्ड नीडल क्रिस्टल फॉर्मिंग टेस्ट. ठीक है, अगर आप बार जाते हो, इट इज मीन्स इफ यू आर गोइंग टू अ बार, ओके, ठीक है, इफ यू आर गोइंग टू बार यू वोंट गो एंड ड्रिंक कोका कोला, राइट? ओके, व्हाट यू विल डू, यू विल ड्रिंक बियर. ओके, यू विल ड्रिंक द बियर. तो बियर कौन सा कलर का होता है? It is the yellow color. It is the yellow color. So remember, it is the yellow needle shaped crystals will be seen in a case of Barberio's test. So bar में हम beer पियेंगे. So it is the yellow shaped needle crystals which is seen in a case of Barberio's test. ठीक है, the same here. If there is any dark brown rhombic crystals, this dark brown rhombic crystals will be seen in a case of Siemens. It is known as what? Florence test. It is known as Florence test where you will see this dark brown rhombic crystals. Whereas bar में हम जाके beer पियेंगे. So it will be yellow in color. It will be yellow needle shaped crystals. ठीक है, इतना याद रखो. या बढ़िया बढ़िया गौतम, बढ़िया डॉक्टर शाहनवाज. ठीक है. Then for semen we can use also this acid phosphatase test, by which if there is more level of acid phosphatase then we can tell yeah it is a semen specimen. Okay, yeah it is a semen specimen. अगर ये more than 100 units से ज़्यादा, then we will tell yeah this sexual intercourse or this criminal attack has been commenced just less than 12 hours. ठीक है, less than 12 hours पे ये हुआ करके बोलेंगे. Then we'll move on to this plant toxins. It will be very interesting. Okay, plant toxins में भी एक questions आएंगे. Okay, because there will be 10 to 12 questions in forensic medicine and there will be mostly fixed. Okay, they will roam around only this trauma, this poisons. Okay, the snakes, only this. Okay, so just make sure you are getting them correct. ठीक है. Yeah, perceptin test, it will differentiate whether this is a human blood or an animal blood. Okay, then about this plant toxins, agar if you able to see, this is the root of aconite, okay, and this aconite it is also known as like our x को हम क्या बोलेंगे? मीठा मीठा बोल के जहर खिला दिया. ठीक है, so it is what? It is the मीठा जहर. And if you see your x again, फिर क्या होगा? Means you will start stumbling with your eyes, right? So your eyes will be stumbling. So it is known as what? It is known as gibbous. It is known as gibbous, and your heart will be feeling the pain. So it is what? It is a cardiac poison. क्यों? इसने आपका दिल तोड़वा दिया. It has broken your heart. So it is what? It is a cardiac poison. It is a cardiac poison. Okay. And the next one, it is the yellow oleander. It is also a cardiac poison. Yeah, cardiac poison. Yeah, fine. Yeah. I guess you got it. Next one, this is what? This is not santra. Okay. Okay, it is what? It is this. It is not santra. Okay, it is not santra. It is what? It is this 𝗧𝗵𝗀𝗀𝗃. It is this 𝗧𝗵𝗀𝗃 which is having this strychnine poisoning. It is the strychnine poisoning which causes this glycine. Okay, fine. And like it will take around more 15 minutes to finish this forensic. After this, we'll have a small break. Okay. So yeah. So this is what? This is this 𝗧𝗵𝗀𝗃 which is having this type of RBC shaped seeds. RBC shaped seeds, and it will be mimicking which of the following poisoning? 𝗧𝗵𝗀𝗃 will mimics which of the following poisoning? Yeah, guys. कौन सा poisoning ये mimic करता है? It mimics the tetanus. Yeah, tetanus. Yeah, बढ़िया. Good. Fine. It is the tetanus. Fine. It will act by antagonizing the glycine. ठीक है. फिर उसके बाद good Dr. Ansh, good Dr. Gautam, good Dr. Anjali. Fine. Next about this plant which is this Abrus precatorius, which will be having this toxin which is known as abrin. ठीक है. So remember, it is the red color one. It's with a black color. So it is the Abrus precatorius. Okay. Then about this nut which is known as what? Which is known as marking nut. Okay, marking nut which is used to produce artificial brews. So it is known as 𝗵𝗵𝗃 anacardium. Okay, 𝗵𝗵𝗃 anacardium. Then about this we know like this is the Ricinus communis which will produces this resin toxin. Okay. Yeah, the tetanus it is presynaptic and it will inhibit GABA and glycine. But thing is that it also produces this spasm, like kind of this opisthotonus kind of spasm, right? Likewise, this strychnine poison also will produce the same. That's why it mimics tetanus. Okay, it mimics tetanus. Fine. Then about this one, this is the spectacle shape, having spectacle. It is the common cobra. Yeah. Okay. And if you're able to see this type of band, sorry. If you're able to see this type of band, it is known as right. ठीक है. And दोनों हमें पता है. Both of them, they are what? They are which toxic? Neurotoxic या vasculotoxic? कौन सा toxic है? It is what? It is the neurotoxic. इट इज द न्यूरोटॉक्सिक, ठीक है, न्यूरोटॉक्सिक, ठीक है। हमें पता है इसमें हम ASV देंगे और नियोस्टिग्मिन देंगे और विल अवॉइड नियोस्टिग्मिन इन केस ऑफ क्राइट, ठीक है, इतना याद रखो। Then about this viper, this triangle shaped, yeah, बढ़िया, okay, yeah, this triangle shaped, it is what, it is this viper, okay, and we know this viper, it is what, it is vasculotoxic, and we know this vasculotoxic viper, okay, it will be having this V shape, okay, remember, okay, it is V shaped, and if you are able to see this kind of wings like fins, it is what, it is the sea snake, okay, and in a case of any snake poisoning हम क्या करेंगे, carry no right, okay, what we'll do, we won't make the patients to walk, we'll carry them, okay, there will be no incision, no suction, no Shah Rukh Khan movies, no ligature, no tourniquet, no cautery, and no coffee, no alcohol, okay, no coffee, no alcohol, and none of them, and after that we'll reassure them, yeah, कुछ नहीं होगा, सब अच्छा ही होगा, then we'll immobilize them with a Sutherland's wrap if it is there, if not we'll just make them flat in a bed and we'll make them immobilize, and then we'll bring them to the hospital, ठीक है, और फिर उसके बाद हम क्या देंगे, ASV और नियोस्टिग्मिन देंगे, ठीक है, और कोब्रो के लिए नियोस्टिग्मिन देंगे, फिर बाकी के लिए हम ASV देंगे, ठीक है, या गुड, इट इज नोन एज व्हाट, साउथरलैंड्स व्रैप। फिर कल हमने देखे थे, इट इज व्हाट, इट इज दिस रोड साइड और रेलवे साइड पॉइजन, या रोड साइड और रेलवे साइड पॉइजन, ये क्या, इट इज द दतुरा विच इज आल्सो नोन एज stone apple, ठीक है, everything will be dry, D for datura, D for will be dry, okay, तो क्या होगा, everything will be dry, there will be this dry eyes, dry mouth, okay, dry secretions, okay, and there will be what, there will be this flicking sensations, it is known as what, it is known as like this kind of rolling sensation, it is known as what, carpologia will be present here. Then in a case of phenol poisoning, the urine means, in a case of phenol poisoning, the urine will be turned like this, the normal urine will be turned like this in a greenish color, okay, because of this components which are being converted into hydroxyquinone and pyrocatechol, okay, urine ऐसे हो जाता है, ठीक है, या datura का flower will be in white color, yeah, mostly it will be in white color, इतना याद रखो। Then this normal urine on oxidation produces green color, okay, can anyone tell me in which of the following conditions where this urine will convert into normal to the black color in a child, and there is a presence of this pigmentations who are known as ochronosis, yeah, good, Dr. Gautam, it is what, it is the 𝗏-καπτονuria, and what is the enzyme deficient, it is the homogeneous oxidase deficiency, yeah, good guys, good. Then फिर आगे बढ़ते, mercury poisoning will lead to this condition which is known as acrodynia, also known as Pink's disease, okay, and if it involves this nervous system, it leads to these conditions because of this organic mercury, उसको बोलेंगे �𝗏𝗏 disease, it is known as �𝗏𝗏 disease, okay. Then this arsenic will cause this kind of raindrop pigmentation, okay, and it will cause this vasoconstriction, causing this ब्लैक फुट डिसीज। और हमें पता है अगर हमने किसी को आर्सेनिक दे दिया, अगर वो बंदा मर भी गया, then if the patient is even died, then we can recover from his ashes also this arsenic poisoning. His hairs, his tooth will be consisting of this arsenic poisoning, and this arsenic poisoning बोलेंगे क्या हुआ, मतलब how he has died, बोलेंगे like अचानक से थोड़ा दस्त होने लगा, means like suddenly he started having this episodes of diarrhea like gastroenteritis, like cholera, and the patient died. So it is what, it is this arsenic poisoning, yeah. Here you will able to see this Aldrich means lines, हम उसको Derma में देखेंगे। Then फिर आगे बढ़ते lead poisoning. In the case of lead poisoning, you will see this type of lines which is known as Brutonian lines, okay, and here you will see this anemia, okay, there will be this colic and constipation, along with this there is a wrist drop and lead palsy, and along with this there is a presence of this gout which is known as Saccharine gout, और उसको treatment के लिए हम क्या करेंगे, EDTA और penicillamine देंगे। EDTA और penicillamine will be used in the treatment of lead poisoning, ठीक है। और cadmium poisoning में it will be painful, also known as 𝗏𝗏 disease, also known as ouch disease, 𝗏𝗏 or ouch disease, which is seen in a case of cadmium poisoning, ठीक है। Then there is this chronic phosphorus poisoning, उसमें there will be this 𝗏𝗏𝗀𝗀 jaw, okay, or also known as Lucifer jaw, where we will see this jaw swell, ठीक है। Then there will be this boiled lobster appearance which is seen in a case of boric acid poisoning में, yeah, Yeah, that is EDTA is used in purple vial. This will see in vacuotinous part. Okay. Then about this intoxicants, mainly you need to remember about, yeah, good Dr. Shanavas, quinine, Ansh, Shanavas Khan, Ashley, then what? Then yeah, few more, Rahul. Yeah, good, good. We'll see about this intoxicants like alcohol, cocaine, and opioids. Okay, we know the legal limit of India to drink alcohol. It is what? It is the 30 milligram per deciliter. Or usually this alcohol patients, if they consume more, they will be having this anterograde amnesia. जो भी उनको हुआ और जो भी उन्होंने किया उनको याद नहीं रहेगा. So they won't be having this things in their mind after alcohol intoxication. अगर if they start to withdraw from this alcohol, they'll be having this few features. अगर if he withdraw just 6 hours back, then he'll be started having this tremors. तो पहले क्या होगा? ट्रमर्स करने लगेगा. Okay, हाथ कांपने लगेगा. Then after tremors, it will be having this seizures. There will be having this seizures, also known as GTCS, after 12 to 24 hours. Sorry, like there will be around 12 hours. There will be these hallucinations. First will be tremors, followed by these hallucinations. Then after 24 to 48 hours, there will be this seizures will be there. And around 48 hours, there will be one phenomena which is known as delirium tremens. There will be these hallucinations along with these tremors. This is known as what? This is known as delirium tremens, which will happen after 48 hours. A बहुत important question है. So there will be seizures. Like initially there will be tremors, followed by these hallucinations, followed by seizures, and followed by this delirium tremens. Okay, 6, 12, 24, 48. Okay, 6, 12, 24, 48. Then to treat this, we'll use this chlordiazoperoxide, which is a benzodiazepine, and along with this thiazide. Okay. फिर उसके बाद मेंटेनेंस के लिए हम एंटी क्रेविंग ड्रग्स दे सकते हैं, नहीं तो नालट्रैक्सोन, अकाम्पोट्स और टोपिरामिड, सारे क्रेविंग को डिक्रीज करने के लिए दे सकते हैं. देन अबाउट दिस कोकाइन, व्हिच इज आल्सो नोन एज व्हाट? या, विल गिव आल्सो गिव्स विटामिन B1, व्हिच इज द थायमिन. ठीक है. देन कोकाइन, if you see cocaine, it is the white lady. Okay, it will cause vasoconstriction. तो इसीलिए क्या होगा? There will be formation of this septal perforation and along with this jet black tongue होगा. अगर कोकाइन और हेरोइन को साथ में मिलाएंगे उसको बोलेंगे स्पीड बॉल, विच इज नोन एज स्पीड बॉल. ठीक है. एंड कोकाइन से इंटॉक्सिकेशन करने वक्त विल गेट दिस हैलुसिनेशन, स्पेशली दिस विजुअल हैलुसिनेशंस. फाइन. एंड अबाउट दिस टैक्टाइल हैलुसिनेशन, in the case of cocaine, we'll call them as Magnan's phenomena. मतलब like they feels that some worms they're moving, or some ants are moving, so they will keep on scratching. So there will be presence of this scratch sign. Presence of the scratch sign are also known as matchstick sign. Matchsticks. Okay. Then about this opioids, there will be what? There will be this, yeah, there will be this morphine and codeine. There will be this morphine and codeine, and these are this usual opioids, whereas abusive potential will be more for this heroin. ठीक है, heroin, and it is known as the brown sugar. Okay, अगर opioids हम ज़्यादा लेते हैं, then it can lead to this respiratory depression. So there will be this slow respiration, hypothermia, hypotension, bradycardia, and pinpoint people. Remember, in the case of OPC poisoning, you will see pinpoint people, whereas in the case of opioid poisoning also, you will see pinpoint people, and in the case of pontine hemorrhages also, you will see pinpoint people. So remember this POP, okay, like OPC poisoning, okay, pinpoint people will see in the case of OPC poisoning. फिर उसके बाद this one, pontine hemorrhage and opioid poisoning. Okay, opioid poisoning. Yeah, codeine is used in cough. Yeah, that's good. Then when the patient is trying to withdraw from this drugs, they will be experiencing this flu-like symptoms like rhinorrhea, lacrimation, sweating, and along with this yawning and piloerections. They will ask you which of the drug will cause yawning and piloerections during the withdrawal phase. It is what? It is this heroin, which is an opioid drug. Fine. And finally, the maintenance dose, we'll use two drugs. One for immediate, we'll use naloxone, followed by this, we'll use naltrexone. So immediate, we'll use naloxone. Okay. Maintenance, will use naltrexone. So immediately, हम क्या करेंगे? Naloxone देंगे. Finally, the final one, it is the sexual paraphilias. It is what? It is the sexual paraphilias. Agar there are few natural sexual offense and there are few unnatural sexual offense. Okay. And usually in a case of natural sexual offense means the penetration of this penis into the vagina. So it is known as what? Natural sexual offenses. Okay. One is this rape. Okay. Rape, हमें पता है कि it is what? It is considered as an offense. So it is a rape without consent. Whereas incest means within blood relations, okay, blood relations, and it is not punishable in India. And adultery means you are having an affair, an extramarital affair. It is known as what? Adultery. And there are few unnatural sexual affairs, means there is no vaginal and penile intercourse, whereas the intercourse or the sexual gratifications happens in another level. For example, in the case of sodomy, it is what? It is the anal intercourse either with male or female, okay. And bestiality means with lower animals, okay, not human animals, it is the lower animals, okay. And about this lesbianism means within the females. And buccal coitus means oral sex, okay. These are the few unnatural sexual offenses, okay, yeah, which is against the nature, yeah. It is known as what? Greek love, yeah. Good guys. Then about there are few sexual perversions also known as paraphilias, okay. These are the sexual gratifications not by sexual intercourse but by with other mode of activities. For example, in the case of sadism, the partner will inflict pain, means this will cause pain to his opposite partner, means he will beat, and with this he will having this sexual gratification. So it is what? It is this inflicting pain, yeah, giving pain, yeah. Sadism, it is the giving pain. Sadism, it is the giving pain. Whereas in the case of masochism, kya? Suffering pain. You tell your partner to beat, so it is what? It is the suffering, okay. And it is known as fetishism with inanimate objects like undergarments. So it is what? It is this fetishism, inanimate objects, fine. Next about this transvestic fetishism, means by wearing the dress of this opposite sex you are feeling the sexual gratification. So it is the transvestic fetishism. So it is the what? It is the wearing the dress of opposite individual and having this with the sexual pleasure, okay, sexual pleasure. And exhibition means showing off, means walking nude or flashing. So all of them, they will come under exhibition, like flashing or walking nude, okay. Next one, it is what? It is this masturbation, also known as ipsation, also known as onanation, okay, masturbation. Then about voyeurism, we told it is the peeping Tom. It is the peeping Tom, means like watching the people who are having this sexual intercourse. It is known as what? It is known as voyeurism. Then about this frotturism. Frotturism means rubbing, means someone is traveling in the public transport like bus, but they are keep on rubbing this private parts of this females or males. So it is known as what? It is known as frotturism, rubbing the private parts in public. Remember, yeah, correct, Dr. Anirudh. Next about few more things. It is what? It is the transvestism, also known as eonism. It is also just wearing the dress of this, mainly it is in bus, wearing the dress of this opposite sex. Next about this triolism, means like inducing the person's A's wife to having sex with B and watching it, like the A's wife is having A's and his wife. She is having sex with, means he is insisting to have sex with B and is watching it, okay, he is watching it, okay. So it is known as what? It is known as triolism. And scatologia means sexual arousal by using this obscene language, especially over the phone. So it is known as what? Scatologia. Then urologia means, or coprologia means like means sexual gratifications by seeing or smelling the smell of urine or using this poop, okay. Remember. Then clismophilia means sexual gratifications by admitting more amount of enema. Then pyromania means sexual gratification by setting things on fire. So it is known as pyromania. Then pornographomania means collecting and viewing this pornographic material or reading this pornographic books. So it is known as pornographomania. And finally, this erotographomania means drawing obscene pictures in the toilets. In the toilets you may see, right, public urinals, by writing or drawing these obscene things, okay. It is known as erotographomania, fine. And finally, that is main most important things in the forensic part, and we have few extra edge, okay. It is nothing but, if you see this investigations, they will ask you if they ask simply magistrate inquest is done in case of, it will be done in case of death, in a case of asylum, in a case of bostals, or in a case of police custody, or in a case of dowry death or exhumation. So your answer should be within this. Or in previous FMG examination, they went one step ahead. They will ask you which of the following the dowry death will be conducted by. It will be conducted by magistrate, हमें पता है. लेकिन they asked you the dowry death will be conducted by which of the following magistrate. Okay, you should remember this dowry death will be conducted by this executive magistrate, and the same executive magistrate will conduct the exhumation, means removing the body and seeing for this autopsy. Okay, then judicial magistrate, death in prison, death due to police firing or police custody or under police integration or in any psychiatric hospital and any child reformatory schools like Bostels. So all of them it will come under the judicial magistrate. Okay. Then finally they will ask you in which of the following you will see this leading questions. Or leading questions हम कब पूछेंगे और कब नहीं पूछेंगे. If you see the first one, leading questions can be asked in a case of cross examination. That means you are crossing the person and you are asking the questions. It is the cross examination. Whereas in a case of hostile witness, means you bought him, like he's on your side, but he got money from other side and he turned to the opposite side. We'll call them as hostile witness. And there is the person is willing to deposit his death, so it is known as dying deposition. Leading questions are permitted. Okay, whether there you can ask this leading questions, whereas we don't do dying deposition in India. Whereas in a case of leading questions हम कब नहीं पूछेंगे. Then we won't ask in a case of direct examination and re-examinations. Direct examination and re-examinations we won't ask any leading questions. And during death declaration, okay, death declaration also we won't ask any leading questions. Yeah, fine. Yeah, I guess you got things now solved. Okay, this is about this forensic part. Just have one thing in mindset. You know, like this FMG and this degree what you got, it is very much important to you. Okay, so you know this is very much important to you, means to you. Then you can do it enough some things that if whatever happens, if whatever happens, if it is raining, if it is snowing, if it is much hotter, but if you have this motto that this thing is more important than anything in your life, then you will come out of all these odds and you can do this correct thing, that you can pass this examination. That's what. So have this hope and you can pass this examination for sure. Okay guys, this is all about this forensic part. I guess I took a bit more time, but I guess after this watching this session you will get all your forensic questions correct, and we'll have a short break of 10 minutes. Now 20 minutes we'll have. Okay, we'll meet up at 12 o'clock. We'll meet up at 12 o'clock. Then we'll discuss ENT and PSM. Then we'll have a great lunch break. Right? If any questions, put up in the chat section. Next section is the ENT one. ENT and PSM. You're welcome. Fine, guys. Yeah, thank you. Hello doctors, welcome back to the ENT part of Dr. 𝗧𝗵𝗶𝗀𝗀 game changer session. Okay, I guess the audio and video is audible and visible. If you have any queries, please put me up. Yeah, hello Dr. 𝗵𝗵𝗶𝗀. Yeah, I guess we are back after a chai break. Yeah, okay, thank you for confirmation, Dr. Parul, Dr. Ansh. Yeah, okay, fine. Okay, so this is the ENT part of this game changer session, and in this around 15 questions will be asked in your main examination, and most of the questions, which will be around 10 questions for sure, you will get from this session. Okay, from this PDF itself you will get minimum number of questions, it is 10, and maximum you can get all the questions also from this PDF. Okay, and try to analyze this all the concepts and try to solve questions by applying it, because you read, you forget, there is no mean, but you should read, you should solve questions, then only you will be able to remember in a long run. So your motto should be read now, revise it, and do questions. Okay, yeah, fine, that's it. Yeah, we'll move ahead. First we'll see the first condition, which is known as malignant otitis externa. What is this malignant otitis externa? We know otitis externa means it is the infection of this external layer, but usually they will spare, like they will spare asking this, but they will ask this condition, which is known as malignant otitis externa. It is not a malignancy condition, it is malignantly means it is for chronic condition. It is a chronic conditions or chronic inflammation of this external layer. And if you see this here, you'll be able to see that is the inflammation, and in this inflammation and infection, you will be able to see there is this chronic ear discharge, and along with this, they will tell the proper history of elderly diabetic patients. These are diabetic patients who is presenting with features of earache and blood-stained ear discharge. Earache, blood-stained ear discharge, and an examination. And once you do an examination with an otoscope, you pull the hair out. Okay, and you just kept the otoscope, and once you kept the otoscope, you will be able to see there is this formation of granuloma. So here there will be the presence of granuloma formations will be seen in a case of malignant otitis externa. Yeah, granuloma formation, and we know around the middle here the patient will be coming, and in some cases this otitis externa can extend into this middle ear, and then it can cause this facial nerve involvement and facial nerve palsy as well. Okay, so for treatment of these conditions, what we'll do, we'll give this third generation cephalosporins. Yeah, correct. Yeah, we'll give this third generation cephalosporins, and the main catch point is that there is a diabetic female who is presenting with this chronic ear discharge. On examinations, you will be able to see there is a presence of this kind of granuloma formations. There will be presence of this kind of granuloma formations. So this is typically suggestive of a condition which is known as malignant otitis externa. Malignant otitis externa. Yeah, fine. And next conditions, they will classically describe in the history. There is a female, mostly they will describe it is a pregnant female who is having the features of bilateral conductive hearing loss. So pregnant female having a features of bilateral conductive hearing loss, which was progressive in nature, and on otoscopy, you will be able to see this type of pinkish or mass. Okay, this type of pinkish mass. Okay, samosa khila denge yaar. Yeah, okay, no worries. So there will be this young female who is, sometimes it will be pregnant, okay, and with this bilateral gradually progressive conductive hearing loss, and they will become, and on otoscopy examinations, you will be able to see this type of pinkish mass behind this tympanic membrane, and this pink, it is what it is known as a flamingo pink behind this tympanic membrane. It is known as what? It is known as Schwartz sign. It is known as what? It is known as which sign? It is known as Schwartz sign. And in these conditions, you know, in this condition, the patient will be having a typical complaint that the patient or the female can hear more in the noisy environment. So the patient will tell, like, sir, in normally I am having some hearing loss, whereas if it is very loud environment, she can able to hear much better. So she hears better in noisy environment. और उसको बोलेंगे 𝗵𝗵𝗶𝗀𝗃 villi. Yeah, 𝗵𝗵𝗶𝗃 villi. So इतना याद रखो, if there is a diabetic female who is presenting with chronic ear discharge, और जैसे आप देख रहे हो, when you examination, you will able to see this, there is a presence of granuloma, then you will diagnose it as malignant otitis externa. Agar if there is a pregnant female who is presenting with progressive conductive hearing loss, And on evaluation, you will be able to see this flamingo pink mass behind this tympanic membrane, okay, which is known as Schwartz sign. And on asking more history, she tells a normal quiet environment, she is having this hearing loss, whereas if there is any noisy environment, जैसे noise होता है, then she can able to hear better. So this is a classical history of this otosclerosis. Otosclerosis, yeah, बढ़िया, okay. And in the case of otosclerosis, हमें पता है there is this PTA. In the case of pure tone audiometry, you will be able to see there is a drop at 2000 Hz in the bone conduction curve. In the bone conduction curve, there will be a drop at the level of 2000 Hz. Drop at the level of 2000 Hz. What is the name of this notch? What is the name of the notch? You will call it as, yeah, there is a dip at 2000 Hz. It is known as which notch? Which is known as what? 𝗏𝗏𝗀 notch. It is known as what? 𝗏𝗏𝗀 notch. It is known as 𝗏𝗏𝗀 notch. ठीक है, तो इतना याद रखो. It is known as 𝗏𝗏𝗀 notch. अगर आप जैसे आप देख रहे हो, आपका पता चल गया there is a presence of this flamingo pink mass behind this tympanic membrane, then you should think, yeah, it is an active disease. In the case of active disease of this otosclerosis, तब हम एक ड्रग दे सकते हैं, उसका नाम है सोडियम फ्लोराइड. Then we can give a drug which is known as what? Which is known as sodium fluoride. So if there is any presence of this active disease, तब हम सोडियम फ्लोराइड दे सकते हैं. ठीक है, इतना याद रखो. Then, but if it is a chronic progressive disease, if it is not an active one, फिर उसके बाद हम दो चीज कर सकते हैं, स्टेपिडोटमी और स्टेपिडेक्टमी, दोनों कर सकते हैं. बट मोस्टली विल प्रेफर दिस स्टेपिडोटमी. will do स्टेपिडोटमी. इतना याद रखो, will do स्टेपिडोटमी. या this sodium fluoride, if it is vacutainer, it will be in a gray color vacutainer which is used for the blood collection. So yeah, nice, good correlation. Good guys. Fine. फिर उसके बाद आगे बढ़ते. There is a child, like now there is a child who is presenting with features of this adenoid hypertrophy. Okay, there is this features of this overcrowding of this teeth, and there is this high arched palate, and complaints of cough, fever, and he also complains there is a presence of some degree of hearing loss. तब आपको पता चल गया, yeah, there is something fishy in this child. Then you pick up the otoscope, आपने गौर से देखा, then you will able to see there is a presence of this air fluid level behind the tympanic membrane. Okay, जैसे bubbles देख रहे हो ना. So if you are able to see this air bubbles inside this tympanic membrane, this will be suggestive of a condition which is known as serous otitis media. Serous otitis media, which is also known as, yeah, multiple air bubbles, which is known as what? Serous otitis media, which is also known as glue or secretory otitis media. Okay, glue are also known as secretory otitis media. और हमें पता है this secretory otitis media, it is a sterile. Okay, because of this eustachian tubal block, there will be these secretions which will be collected into the middle ear, which is causing this serous otitis media, and it will be sticky like a glue. So it will be a glue, also known as glue ear. Okay, and if it is seen in children, it is mostly due to this adenoid hypertrophy. अगर आपको glue ear मिल रहा है, then you will tell, yeah, don't worry, mostly सही हो जाएगा. तो initially you should reassure and do conservative management. Agar if it is not managed for more than 6 months, then you should do what? You should do this one, which is known as what? You should do grommet insertion. Okay, you should do grommet insertion. Okay, इतना याद रखो. If it is more than 6 months, if it is not managed conservatively, फिर उसके बाद आप grommet insertions करोगे. ठीक है? Then we know it is happening because of this adenoid hypertrophy. So in a case of children, if it is happening because of adenoid hypertrophy, फिर तब हम दो चीज करेंगे, एक adenoidectomy करेंगे, एक adenoidectomy करेंगे. अगर जैसे adenoidectomy हो गया, then the glue ear will regress. If it doesn't regress, फिर उसके बाद will do grommet insertion. Then in a case of adenoid hypertrophy, will do adenoidectomy along with grommet insertion. तो इतना याद रखना. Plus, if you see elderly patients and he is mostly presenting with features of unilateral hearing loss, along with some cervical lymphadenopathy and bleeding nasal mass. Okay, all of this suggestive of nasopharyngeal carcinoma. So in the case of nasopharyngeal carcinoma, it will cause unilateral serous otitis media. Okay, it will cause unilateral serous otitis media. इतना याद रखो. Fine? Yeah. Good doctors. Yeah. EBV Chinese. Yeah. Good. Yeah. Good. Then in a case of this nasopharyngeal carcinoma, it is due to this Epstein-Barr virus, and we know here also we need to treat the cause. We need to treat the cause. Fine. We need to treat the cause, and if it doesn't resolve, then we need to do myringotomy along with this grommet insertion. Or shall I ask you a question? In the case of tympanogram, In the case of tympanogram, what is the name of the curve this serous otitis media will produce? Will this produce which type of graph in the case of serous otitis media? Batao? It produces flat. It produces this flat type of graph, which is what? Which is this B type of graph. It produces this B. No, it's not C, it is B type of graph. Okay. Remember, B for Barawa Pani. Okay, means it is filled water. Okay, it is filled water which is present. That's why it is known as serous otitis media. Next, if this infections, if this condition, if it is getting infected, okay, then it will lead to two conditions, which is known as what? Serous otitis media. Okay, it can convert into two conditions, which is known as what? Acute suppurative. Acute suppurative means there is this pus formation. Acute suppurative otitis media. So, okay, acute suppurative otitis media. So, in the case of acute suppurative otitis media, there will be formation of this pus. Okay, pus, and will produce a type of appearance which is known as cartwheel appearance. Cartwheel appearance. Okay, cartwheel appearance karega. Then, if this ASOM regress, take it, badhiya, koi dikkat nahi hai, sahi ho gaya. Lekin in some cases, there will be this ASOM which is being progressed to this next condition, which is known as chronic suppurative otitis media. Means chronic suppurative otitis media means chronically the patient is experiencing this discharge. Okay, and this chronic suppurative otitis media, how will the discharge will be coming? It will be coming via either two route. Means there will be like mostly there will be small opening or small perforation in the tympanic membrane, which is mostly aligned at the center, and the pus is coming out. Whereas in some cases there will be a large opening and large amount of pus will be coming out, or scant or blood tinged pus will be coming out. So based on it, we'll differentiate into different types. If you see this type of central perforation, we'll call them as 𝗡𝗵𝗀𝗀𝗀𝗃. Now we'll call them as 𝗵𝗵𝗶𝗀 cosm. It is known as 𝗵𝗵𝗶𝗀 chronic suppurative otitis media. Okay, it is known as 𝗵𝗵𝗶𝗀 suppurative otitis media. Okay, there is this presence of this permanent central perforation and this first stanza of this tympanic membrane. Okay, and here the discharge will be more. Here the discharge ज़्यादा रहेगा, लेकिन but there will be no foul smells. There will be no foul smell and there will be no blood stain. So there will be a more discharge with no blood and no foul smelling. It will be without any smell. Just remember. And here the hearing loss will be conductive because there is a perforation. It will cause a conductive hearing loss. फिर उसके बाद आगे बढ़ते हैं. Then in some cases, if you see, the perforation can reach up to the margins. This is known as marginal type, which is also known as aticoantral. It is known as aticoantral type of 𝗡𝗃𝗀𝗀𝗃. It is known as aticoantral type of 𝗡𝗃𝗀𝗃. Whereas in the case of aticoantral type of 𝗡𝗃𝗀𝗃, remember, there will be small discharge. Okay, there will be opening is large, but there will be small or scanty discharge, which will be foul smelling and blood tinge. Okay, opposite of this tubotympanic type. So it will be what? It will be foul smelling and blood tinged. Okay, it will be foul smelling and blood tinged. Blood stain present along with this foul smelling. In some cases, this will heal and it will retain some of this epithelial tissues, normal epithelial tissues from the EAC to into this middle ear. So this can lead to this formation of thing which is known as cholesteatoma. Cholesteatoma is nothing but in presence of a skin in the middle ear cleft. Okay, presence of the skin, which is this epithelial cells into this middle ear cleft. So it is known as cholesteatoma. In the condition, in a type of cholesteatoma, there is this intact tympanic membrane. If the tympanic membrane is intact in a case of cholesteatoma, then it will be which type of cholesteatoma? It will be a congenital cholesteatoma. It is the congenital cholesteatoma. It is the congenital cholesteatoma. So remember, if the cholesteatoma is present, but it is present along with this intact tympanic membrane, फिर आपको याद रखना है, it is a congenital type of tympanic membrane. ठीक है, बढ़िया, yeah. Next, this aticoantral type of 𝗡𝗃𝗀𝗃𝗀 can also be complicated with one more syndrome, which is known as Granny-Dingo syndrome. Like it can involve this petrous part of this temporal bone, and it can lead to this following complications. तो क्या कर सकता है? So if you see here, obviously it is a complication of the 𝗡𝗃𝗀𝗃. It will produce this ear discharge. Ear discharge रहेगा. फिर उसके बाद there will be a presence of this retroorbital pain. There will be the presence of this retroorbital pain. तो आंख के पीछे there will be दर्द रहेगा because of the involvement of this fifth nerve. Because this petrous part, it will be in relation to the fifth and the sixth nerve. Then there will be diplopia. हमें पता है this extraocular muscle LR6 and SO4. So the lateral rectus, it will be supplied by the sixth nerve. Okay, so because of the sixth nerve involvement, there will be presence of this diplopia. So remember, it is the GERD, GE. Okay, this gradinogo syndrome, it is the ear discharge, R for retroorbital pain and D for diplopia. Remember it as GERD. Okay, remember, yeah, good guys. It is the retroorbital pain, then followed by this there will be a diplopia. So itna yaad rakho. Then about this next condition, the patient now will be presenting with features of pulsatile tinnitus. There will be features of pulsatile tinnitus, and sometimes there will be complicated by this bleeding from the ear. Okay, bleeding from the ear. Pulsatile tinnitus, bleeding from the ear. Both of them, they are suggestive of a condition which is known as glomus jugulare. Okay, and we know this glomus jugulare, it is a non-capsulated tumor which is mostly locally invasive, like it will invade this part of this middle ear, especially on this floor of the middle ear. Okay, and it is a highly vascular tumor. Okay, and the female means mostly it occurs in young females with the features of this pulsatile tinnitus and bleeding ear mass. Okay, and if it is not bleeding, then once you see with your otoscope, you will be able to see there is a presence of this pulsating red side or this mass which is arising from the floor. So it is known as what? It is known as rising sign. Okay, जैसे नीचे से ऊपर आ रहा, so it is known as what? It is known as rising sunshine. It is known as rising sunshine. Okay, then there is one more sign, like if you put pressure by an instrument which is known as 𝗚𝗚𝗀𝗃, then this blood, it will blanch. So this blanching is named as brown sign. Okay, the blanching, it is known as brown sign. तो इसको diagnose करने के लिए क्या biopsy करोगे? What will be answer? Will you do biopsy to diagnose this glomus jugulare? What will be answer? No. Yeah, big no. If you see, in the case of glomus jugulare, it is a vascular tumor. Yeah, good, Dr. Shanvas, Drukshi, Rahul, Quenin, Gautam. Yeah, good, well said. Okay, so here you won't do biopsy. So biopsy is contraindicated in the case of glomus jugulare. Okay, to removal, we'll do embolize and we'll do surgically remove it. Okay, we'll do surgically remove it. That's it about this glomus jugulare. Next, about this BPPV. This BPPV, the patient usually tell like there is a presence of this vertigo. And this vertigo, this BPPV vertigo, it is the most common cause for this peripheral vertigo, and it happens because we know this crustan maculae, where there will be presence of these small stones, where they are known as otoconia. This otoconia will be displaced to this semicircular canal, and it will cause irritation and it will cause vertigo during the positional change. Okay, so their chief complaints will be change of position will causing this vertigo. Yeah, it will just remain for a few seconds. Few seconds. And to diagnose this vertigo, remember there are two tests we'll use here. Means two things we'll use here, are two manuals. To diagnose this, remember D for D. To diagnose, we'll use 𝗧𝗵𝗶𝗀𝗃 maneuver. It is known as D for D. To diagnose, we'll use 𝗧𝗵𝗃 maneuver. Okay, and D for D, it has how many moments? It has two moments. Okay, एक और दो, बस. अगर उनको vertigo हो रहा है तो हम बोलेंगे या इनको BPPV है. ठीक है, then to treatment this, we need to reposition. ठीक है, this otoconia, they will come and settle in here. Okay, तो गलत जगह आगे रुक गए, so we need to reposition them. तो reposition करने के लिए we'll use a maneuver which is known as 5-step maneuver, which is known as what? Which is known as E. It is a ABCDE. It is the fifth alphabet. So it is what? It is the 𝗚𝗃𝗃 maneuver. So 𝗚𝗃𝗃 maneuver, it is used for the treatment of this benign paroxysmal positional vertigo. ठीक है, बढ़िया. या बढ़िया Dr. Ashley, बढ़िया Dr. Drukshi, Dr. Quenin. Yeah, good. Okay, good Dr. Shanvas. Yeah. Next, we'll move on to one more condition, which is known as what? Which is known as Meniere's disease. Meniere's disease does nothing but it is just hydrocephalus or more water or glaucoma of this inner ear. So there is थोड़ा बहुत ज़्यादा पानी भर गया. There is more water into this middle ear, especially the scala media part. Okay, so इसमें we know this endolymph, it will be produced. It will be mainly in the scala media part. It will be produced by this stria vascularis. Either it will produce more or what it will do, it will absorb less. तो दोनों टाइप पे क्या होगा? There will be increased fluid or increased endolymph. So because of this increased endolymph, the ear will swell. Take it, the ear will swell. It is known as endolymphatic hydroph. Okay, it is known as what? It is known as endolymphatic eye drop. Yeah, good, doctor. Yeah, here the vertigo will be usually more than the this part. Which one? This BPPV part. Okay, it is usually, this is a type of unilateral and will be having episodic in nature. It will be unilateral and it will be episodic in nature. Kaise? For example, it will be having this peculiar features. There will be initially, there will be this tinnitus, ringing of the ears. Followed by this, the patient will be having vertigo. Followed by this, the patient will be having vertigo, and it will be relieved by this hearing loss. Okay, and it will be relieved by this hearing loss. So remember, it is tinnitus, vertigo, and hearing loss. Tinnitus, vertigo, and hearing loss. Here you will see few phenomena. Okay, few phenomena. Recruitment phenomena means here the patient hears loud sounds as more loud. Okay, you will tell "Kaise ho?" You will tell "How are you?" The patient won't listen. You will tell "How are you?" Then you will tell "How are you?" Then when you shout, it feels like the patient, means you are shouting at the patient. So while shouting, actually the patient feels it is more shouting. So the patient feels that the loud is perceived as more loud. So it is known as what? It is known as recurrent phenomena. Yeah. Yeah, the patient also, yeah, good, Dr. Shanwas. Yeah, the patient also will get this vertigo episodes when they exposed to this more sound environments, like where there is this boom speakers are there, where they may predispose this vertigo event. Okay, and there's this phenomena which is known as 𝗃𝗃𝗃 phenomena. Okay, and hearing this loud sound, this vertigo occurs, which is known as 𝗃𝗃𝗃 phenomena. And here there will be two things. They will hear a same sound in a two frequency, that is known as 𝗃𝗃𝗃. It is known as 𝗃𝗃𝗃. So here in a case of Meniere's disease, you will see this 𝗃𝗃𝗃. Okay, तो याद रखना Meniere's disease में हम 𝗃𝗃𝗃 देखेंगे. ठीक है, here there will be Meniere's disease में क्या क्या लिखा होगा? There will be unilateral disease, there will be a tinnitus, vertigo followed by the hearing loss. ठीक है, whereas in a case of otosclerosis बोलेंगे progressive hearing loss. ठीक है, progressive hearing loss and hearing better in the noisy environment. Hearing better in the noisy environment. ठीक है, BPPV में बस vertigo which is associated with the movement of the head. BPPV में vertigo which is associated with the movement of the head. तो ये सारे चीज आपको क्वेश्चन से उठाना है. Means you need to see this pointers because question set will be written this much long. तो आप एक एक करके पढ़ते रहोगे A is, was, he, she, like that. You won't able to get them and grasp them in seconds. तो आपको ये कीवर्ड्स पता होनी चाहिए. फॉर एग्जांपल अगर आपको मेनिस डिसीज के बारे में पूछ रहे हैं, इफ दे आर आस्किंग अबाउट मेनिस डिसीज, यू शुड सी दिस. या फ़िलियो phenomena mentioned, like there is tinnitus, vertigo followed by this hearing loss, and there is a mentioning of this 𝗃𝗃𝗃. So all of this if you find, then you will be able to see it is the Meniere's disease. It is the Meniere's disease. Okay, bas okay. Yeah, Meniere's disease is the glaucoma. Right. Then we'll move on to this some PTA findings. We'll move on to this PTA findings. Right. This PTA findings, if you see, this is how this normal audiograms looks like. This is how this normal audiogram or normal hearing loss looks like. Whereas if you're able to see, there is a gap between this bone conduction and here ear conduction. Yeah, if you're able to see this AB gap present, so it is what it is. Typically, it is the conductive hearing loss. It is the conductive hearing loss. See, it is the 50 decibel. Here 50 decibel loss is there. So there is a gap between this bone conduction and air conduction. So it is what it is this. It is the conductive hearing loss patients. Yeah, good guys. Then I know I will show you this mixed node. Fine. Then if you're able to see here this bone conduction is decreased, air conduction also decreased, and you also able to see there is a gap. So air conduction decreased, bone conduction also decreased, and there is a gap present. So this is a type of mixed graph. This is a type of mixed graph. Okay, but whereas if you're able to see both bone conduction and air conduction, both of them they are dropping. So it is the sensory neural hearing loss. And if you have a sensory neural hearing loss having a dip at 4000 Hz, it is seen in a case of which type of sensory neural hearing loss, guys? What's the type? It is seen in a case of which type or which condition? Yeah, good. It is seen in a case of noise induced hearing loss. It is seen in a case of noise induced hearing loss. Badhiya. Fine. Then we'll see this tympanometric findings. Okay, or tympanogram findings. Yeah, good. Yeah, already started answering. If you see this next graph, if you're able to see this, how this tympanogram looks. Okay. Here, what we'll see the mobility of the tympanic membrane. So, based on this mobility of the tympanic membrane, we'll tell what is the problem with the tympanic membrane. See, the normal one, it is what? It is the normal one. It is the A type of graph. This is the normal one. Okay, this is the normal one. Okay, this is the normal one. This normal one have this A type of graph. Okay, A type of graph. Whereas in the case of, as I told you, yeah, good guys, good. You are already answered everything. Okay, there's nothing to ask for me. If you see this type of flat graph, if you see this type of flat graph, it is seen in a case of, if you see this type of flat graph, it will be seen in a case of, कौन से में देखेंगे? B types flat, B type will be seen in a case of serous otitis media. ठीक है, अगर आप ज्यादा पानी पी लेते हैं, अगर ज्यादा दारू पी लेते हैं तो फ्लैट हो जाते हैं. Remember, it is the serous otitis media which is having this पानी, which is having this दारू और alcohol, then it becomes flat. ठीक है, तो इसी वजह से फ्लैट हो गया. Then if you see this another type of graph, if you are able to see this type of, if you are able to see this type of same A type of graph, लेकिन ये बहुत छोटा है, small graph. A type of graph will be seen in a case of otosclerosis. Otosclerosis. It is seen in a case of otosclerosis. ठीक है, फिर उसके बाद आगे बढ़ते हैं. Then if you see this graph which is not meeting, like you, like our your X and you. Okay, if it is not meeting, okay, they are not tend to meet each other in future. So if they are not meeting, okay, not meeting, so it is what? It is this AD, which is what? Which is this dislocation. It is due to this ossicular dislocation. It is due to this ossicular dislocation. Yeah, they are discontinued. That's why she is your X, right? So it is what? It is this ossicular dislocation. Ossicular dislocation. Okay. Then, if you are able to see this type of same type of A graph, but it is located somewhat before it. So it is what? It is type C graph. It is the type C1, and this type C type of graph will be, type C1 will be seen in a case of, where कहाँ देखेंगे हम? Type C will be seen in a case of eustachian tubal obstruction. Eustachian tubal obstruction. Okay, type C. Yeah, good guys, good. Dr. Shanavas, Mohammed Ansh, Ashley, and 𝗧𝗵𝗶𝗀𝗀 and quinine. Yeah, good guys. Nice. You are doing well. Fine. So these are the tympanometric findings you need to remember. Fine. Next, we'll move on to this facial nerve anatomy and injuries. Initially, we know the facial nerve will come as a labyrinthine segment. Means then it will be having this horizontal segment, which is what? Which is our tympanic segment, and followed by this tympanic membrane. Then it will be in vertical position. Vertical के साथ ये, फिर उसके बाद stylomasted foramen से बाहर आ जाएगा. Okay, so there are this few phases or few segments of this facial nerve. Okay, mainly what you need to know is that at which section or which part will give rise to this which branch. Okay, and based on this branch, you will tell what is the complication or at which level the facial nerve is got injured. For example, initially we know around this first genu, it will give rise to this nerve, which is known as what? Which is known as 𝗫2 Okay, and before this 𝗫2 around this first genu, means wherever it is taking turn, it is known as first genu, and around this first genu, it will give rise to this greater petrosal nerve. It will give rise to this greater petrosal nerve. और हमें पता है this greater petrosal nerve, it will go and supply this lacrimal gland. Or if there is any damage at this greater petrosal nerve or at around this first genu, then it will lead to this loss of lacrimation. Take it. Then after this first part, then it will be having this tympanic part. Here it will give rise to this. Before this second turn, it will give rise to this 𝗫2 So in the case of 𝗫2 क्या होगा? There will be the cause of hyperacusis. See, you are attending a marriage function. You know there will be this woofer side. There will be more noise will be there. And in such scenarios, you need to be protected from this noise-induced trauma. So in such cases, the stapedius will act and it will pull the stapes bone from this window. So once it pull, this sound won't be get transferred. So that is how this stapes works. So this, if there is a damage to this stapes, it leads to these features of hyperacusis. Fine. And then we studied in the taste sensations. There is this the normal sensations of the tongue, they are carried by this 5, 9, 10. Whereas this taste sensation will be carried from this anterior part by this facial nerve, which is known as coda tentonii. So this coda tentonii will be responsible for this taste sensations, and will come out by this styloid process. Okay, after coming out through the styloid process, it will supply the muscles. Okay, it will supply these muscles of our facial expression, our smile muscles. So if there is any supply over here, this will result into this facial nerve palsy. So based on the locations, you can tell. So if there is any absence of lacrimation, then before genu there is a fracture, or before first genu there is a damage. And if there is any hyperacusis present or hyperacusis mentioned, then you tell there is this origin of nervous trapezius has been injured before the origin. Okay, remember. And if there is no taste sensations, then you will think this coda tympani is gone. So based on the history, you need to select the option like where it has been injured. Okay, yeah, Bell's palsy, yeah, 𝗧𝗵𝗶𝗀𝗀, fine. These are the things. Then about this few ear implants. If you see about this ear implants, this implant which is known as what? Or bone anchored hearing device. Bone anchored hearing device. See, initially what we can do is that we can give this type of usual hearing aid, but in some cases, like for example, if there is atresia of this 𝗚𝚎, if there is no formation of this 𝗚𝚎 itself, then how the sound wave will travel? So in such cases, what we'll do, we'll insert this instrument into this bony part. So it is known as bone anchored hearing device. It is known as what? 𝗵𝗲, not 𝗧𝗲. Okay, it is what? It is the 𝗵𝗲. Okay, it is what? It is the bone anchored hearing device. Fine. And next one, it is this cochlear implant. If you see this cochlear implant, you will able to see, you will pass this electrodes into this inner ear, and there will be this receiver and there will be this transmitter. Okay, here outside there will be this transmitter and inside there will be this receiver. Okay, you will collect this sound and you will process it and you will set through this sender, and following this transmitter, then you will receive inside. So this is what? This is this cochlear implant. Next one, if you see, sometime in a case of, for example, there will be the neuronal damage. For example, we'll see in a case of 𝗏𝗏. For example, in a case of acoustic 𝗏𝗏, the nerve will be impaired, right? If there is no nerve itself, then how this impulses from this cochlea will be get transferred to there? So in such cases, we'll go and implant directly into the brainstem. It is known as what? It is known as auditory brainstem. Yeah, correct. It is the auditory brainstem implant, which is known as what? 𝗵𝗵𝗶. Okay, it is what? If you see here, if you are able to see, there is this small electrodes. So it is this auditory brainstem implant. So, and this 𝗵𝗲, as I told you, it is indicated in the case of anosmia or absence of this ear. Okay, and 𝗚𝚎 atresia, or because of some procedures or some things, the 𝗚𝚎 becomes stenosis. Fine. And next one, if there is any chronic ear discharge, okay, we cannot keep the hearing aid, right? It will become wet and it will kharab ho jayega. So in such cases, we'll use this bone anchored hearing device. Yeah, 𝗚𝚎 means absence of pinna. Fine. Next, we'll move on to the nose part. In nose part, mostly they will ask you from the trauma perspective. Trauma mein kya puchenge? If you see, the most common bone to be fractured in the nose, kya? It is the most common bone which is fractured in the face, kya? It is nose. So nasal bone, it is the most common bone to be fractured. Okay, so if there is any nasal fracture, like we saw, right, agar आप pillow रख के smothering कर रहे हो, तभी भी nose bone fracture होगा. So in such cases, first we need to see what are the types of fractures or what are the types of nasal bone fractures. ठीक है, अगर the fracture line is horizontal, okay, अगर fracture line is horizontal, अगर fracture line nose की horizontal पे चल रहा है, तो then it is what? Then it is the 𝗏𝗵𝗶𝗀 fracture. 𝗏𝗵𝗶𝗀 fracture. Whereas if it is parallel, if it is parallel, then we'll call it as 𝗬𝗏𝗏𝗀 fracture. 𝗬𝗏𝗏𝗀 fracture. So here आप देख रहे हो, then there is this line is going fracture. Okay, this is the bone fracture, which is actually what? Which is this 𝗬𝗏𝗏𝗀 fracture. इतना याद रखो. And we know for reduction of this nasal bone fracture, what is the name of the instrument you will use for nasal bone reduction? nasal bone reduction. What is the name of the forceps we will use? Yeah, guys, is it Ashley? No, it is what? It is the Ŵ forceps. It is the Ŵ forceps. Yeah, good. Yeah, it is the Ŵ forceps. Whereas for nasal septum, whereas the nasal septal reduction, then we will use this Ashley's forceps. Ashley's forceps. See this W, it is looking like going inside. So we know outside it is a cartilaginous part, whereas inside it is the bony part. So अगर सीधा जाना है तो लंबा होना चाहिए, or it should be straight. So this Ŵ forceps, it will be straight in nature. It will be straight in nature. That's why we'll use this Ŵ forceps, right? Just remember. Then for nasal septum, we'll use this Ashley's forceps. Okay. Then yeah, I told you the most common bone to be fractured in nose, fractured in face, it is the nose. Okay. And उसके लिए हम क्या management करेंगे? In the case of nasal bone fracture, what we'll do immediate reduction, because once there is this formation of edema, it is difficult for us to reduce the bone. So we'll do with Ŵ forces, but we'll do before the edema occurs. अगर edema आ गया, mostly within 8 hours, अगर edema आ गया, then we'll wait for 7 days, then reduce करेंगे. पहले edema को settle होने देंगे, then after that we'll do this reduction. Then we'll do this next part. For example, you are going to the mall and there is this automatic door, like it should open, but it does not open, so that you got hit into your nose. So initially what will happen is this septum will got injured, and we know the septum will be having these blood vessels. It leads to this collection of blood into this nasal septum. इसको हम क्या बोलेंगे? It is the septal hematoma, and the patient usually complains of there is a history of trauma and there is a difficulty in breathing, or there is a bilateral breathing difficulty. So ये क्या है? Septal hematoma है. So in a case of nasal trauma which is causing the septal hematoma, then what you need to do? You need to do immediate aspirations. You need to do immediate aspiration of the blood, because if it is not being aspirated very much immediately, then this can lead to this formation of septal abscess. अगर septal abscess बन गया, then it can lead to the septal perforation as well. It can lead to the septal perforation as well. ठीक है, इतना याद रखो. Yeah, correct Dr. Drukshi, correct Dr. Anash. Fine. Yeah, good Dr. Quinen. Fine. Next, we need to know about this paranasal sinuses and its visualization. हमें पता है there are this around this nasal cavity there will be this paranasal sinuses. ठीक है, फिर maxillary sinus है. Then we have our inside we have this ethmoidal and sphenoidal sinuses. ठीक है, then we have this frontal sinuses. ठीक है, and around this sinuses, what is the main important is that what is the views will you use? For example, there are 3 views you should remember of, or 2 views at least you should know. One is this Caldwell's view. If you see, the head is touching here and you are taking X-ray from here. So it is what? It is this Caldwell's view, which is this occipito-mental view. It is this occipito-mental view. It is this Caldwell's view. Yeah, good guys, good. It is the Caldwell's view. Caldwell's view. Next, there is one more view which is mostly we'll use to see this maxillary bone. Okay, to see this maxillary bone, हम क्या करेंगे? Maxillary sinuses. We'll use this one more view, which is known as what? Which is known as here from mentum will pass the ray. So we'll do like this. So it is known as what? It is known as Waters view. Okay, so Waters view में there are 2 views of Waters view. Waters view is usually what? It is the closed mouth view. See, it's closed mouth view. अगर it means अगर आप means if you keep water inside the mouth, will you close the mouth or will you open the mouth? If you open the mouth, it will fall, right? So you will, in the case of Waters view, it is this closed mouth view which is used to see this maxillary sinus. Whereas we have one more view which is similar to this Waters view, but instead of closing the mouth, we'll keep it open. Okay, we'll keep it open. It is known as Pierce view. Okay, we will keep it open. It is known as Pierce view. So this is the Caldwell's view. Okay, Caldwell's view. We know this Caldwell's view, which is mainly useful for this frontal sinuses and the ethmoidal sinuses. ठीक है, और sphenoid sinus देखने के लिए हम क्या करेंगे? We'll take from the lateral side. Okay, whereas for this maxillary sinus हम एक Waters view लेंगे, और मैंने बोला कि मतलब you should keep the water in, so you should close the mouth. ठीक है, whereas in the case of Pierce view, it is the open mouth plus Waters view. It is known as Pierce view. It is known as Pierce view. ठीक है, Pierce view. ठीक है, इतना याद रखना. And remember about this sinuses, where they will open. Means we know this nasolacrimal duct. It is usually opens into this inferior nasal meatus. Inferior nasal meatus. Because that's why if you start crying, okay, If you start crying, then you will get this water into your nose, right? You will have this nasal stuffiness. It is because of this internal, means because of this opening of this nasolacrimal duct at this inferior meatus. But we'll see in ophthalmology there is a condition where there is blockage of this duct. In those condition only, we'll keep them to drain into medial meatus. Okay, just have a pause for it. Okay, yeah, good. Then about this middle meatus, you need to remember. See, in middle meatus, M for M, it will be having this maxillary sinus. Then uske baad above this maxillary sinus, we have this frontal sinus. You will have drainage from this frontal sinus, but the catch point is that which ethmoidal sinus will drain? Is it anterior ethmoidal sinus or posterior ethmoidal sinus? Remember, it is this anterior ethmoidal sinus. It is draining into this middle meatus. So like a family, it is draining. It is like a family. So frontal, anterior ethmoidal, and what? And maxillary sinus. All of the sinus, it will come and join here. Like mostly about this Townis view, they won't ask, but Townis view, it is mostly used to see about this superior orbital features and things. Okay, just remember. Fine. And next about this special cells. Yeah, special cells. If you see, this is which sinus, guys? This is which sinus? Is it ethmoidal sinus? No, it is the maxillary sinus. It is the maxillary sinus. It is the maxillary sinus. And this is the orbit. This is the orbit. And we know in the case of orbit, if you see, there is a cell which is at the floor of orbit. The cell which is at the floor of orbit, okay? It is the Hallus cell. It is the Hallus cell. Agar if it is in this bulla, if it is on the middle meatus, it is what? It is the bulla ethmoidalis. It is the bulla ethmoidalis. Okay, ethmoidalis. Okay. Then if you see, there is one more cell which is in relation to this optic nerve. Optic nerve के साथ relation है. तो ये कौन सा है? It is the O for O. It is the onody cells. It is the onody cells. It is the onody cells. ठीक है? कितना याद रखो ये इसके बारे में. Okay, yeah, good guys. Good, Dr. Rahul, Ashley, and 𝗃ci, 𝗵𝗵, Shanvaskan, and 𝗃ci. Fine, good. Then we'll come into some more parts of this trauma. If you see about this CSF part, this traumatic CSF rhinorrhea, we have this type of fracture which they are known as Lepfort's fracture. In Lepfort's fracture, the fracture type 1, it separates these pallets. Okay, it will be fractured at the level of palate. Whereas in the case of Lepfort's type 2, remember the hand 1, keep one hand, it is the Lepfort's type 1. Whereas keep two hand, it is the Lepfort's type 2. So Lepfort's type 2, it is what? It is triangular in fashion, and it will cause damage to this cribriform plate. And if there is any damage to this cribriform plate, it leads to this leakage of the CSF along with this blood. It is known as traumatic CSF rhinorrhea. It is known as traumatic CSF rhinorrhea. Whereas type 3 Lepfort's fracture, it is what? It is this craniofacial distinction. It is the craniofacial distinction. Okay, so it will be most commonly seen in a case of type 2 and type 3. Type 2 and type 3 Lepfort's fracture. Okay, type 2 and type 3 Lepfort's fracture. Okay, and in such cases, you will be able to see this type of halo sign. And this is what? This is in the case of traumatic CSF rhinorrhea. So what is the confirmation test, or what is the gold standard test you will do here? You will do the confirmatory test, which is what? This is this beta 2 transferrin analysis. This is beta 2 transferrin analysis. And we studied yesterday where you will see this beta 2 microglobulin deposition. In which type of amyloidosis, or in which condition? Remember, this beta 2 microglobulin will be seen in a case of dialysis. Okay, remember, it is seen in a case of dialysis. Okay, and mostly how will you differentiate this CSF rhinorrhea with other secretions? You see, the CSF rhinorrhea, it won't be sniff backs. Means when you do like this, you won't sniff this thing back. And when you keep a kerchief, you will be able to see this halo sign or target sign. Fine, and the patients cannot sniff backs, and it will be non-sticky. Like our nasal secretions, it will be sticky, right? Whereas this is non-sticky in nature. Fine. And yeah, and to confirm, we'll use this beta 2 transferrin in nature. Yeah, it will be clearly fluid, but in a case of trauma, it may mix with blood. Okay, then for radiologically, what we can do is that we can do this 𝗧𝗵𝗶 of skull, and we can do this T2 weighted MRI imaging. You know, water is white, so whatever CSF it's looking, it can come in MRI T2 weighted imaging. Okay, and we can do CT cysternography, but we need to put dye into the subarachnoid space, so it is much invasive. Okay, and or else we can do nasal endoscopy with intrathecal fluorescent dye. Means we'll need to inject dye here and we need to do this nasal endoscopy. Okay, that is very difficult. Okay, so the most of the treatment, it is what? It is this conservative management. It is the conservative management. Yeah, good. Yeah, green color fluorescent. Yeah, good, Dr. Ansh. Then about this epistaxis. Once you see about this epistaxis, we know that mostly the patients will be having these complaints. They will be scratching their nose, and because of that there will be a bleeding. Okay, and we know the most common cause of epistaxis location, it is this Little's area. It is the Little's area, and Little's area, it locates at this anterior inferior part of this nasal septum. Anterior inferior part of this nasal septum. Okay, and previously, and this will form a plexus which is known as what? 𝗪𝗪𝗃 plexus. It is known as what? It is known as 𝗪𝗪𝗃 plexus. And this 𝗪𝗪𝗃 plexus will be having the supply from this greater palatine artery, 𝗵𝗵𝗿𝗺 artery, which is the artery of epistaxis. Artery of epistaxis. Okay, and then superior labial artery and anterior ethmoidal artery. There are few evidences which still there is involvement of posterior ethmoidal artery in the 𝗪𝗪𝗃 plexus as well, but as of now we consider it as anterior ethmoidal only. So okay, just remember, it is not a still not a part of 𝗪𝗪𝗃 plexus like that you consider, but now in recent editions they start using it. So see, what are this 𝗪𝗪𝗃 plexus? It will be formed by this anterior ethmoidal artery, yeah, but not posterior ethmoidal artery. No, if they ask you in exam which of the following is not a part of 𝗪𝗪𝗃 plexus, if you have all these options, you choose posterior ethmoidal artery. Okay, and it is still controversial. Okay, see, it is what? It is this anterior ethmoidal artery and branchiofascial artery, which is this supralabial artery and sphenopalatine artery. See, here this sphenopalatine artery and this greater palatine artery. Sphenopalatine artery and greater palatine artery. So all of these arteries will give rise to this formation of 𝗪𝗪𝗃 plexus. Okay, 𝗪𝗪𝗃 plexus. Now what they will ask you, if a patient of epistaxis come to you, what is the first thing you will do? What the first thing you will do? You will tell them to do this tortoise method. What you will tell? You will tell them to pinch the nose. You will tell them to pinch the nose and to sit and bend your neck and sit behind. Okay, you will pinch your nose and you will bend your neck and you will sit like this for a while. And if it is not being controlled by this, then we'll do nasal packing. In nasal packing means we'll put up this glass piece inside the nose, because we know this mostly this anterior 𝗪𝗪𝗃 plexus which is bleeding. So in such scenario, we'll do this nasal packing with saline and adrenaline. It will cause vasoconstriction, and because of this compression force, the bleeding will stop. But if it doesn't stop, then we'll move ahead with posterior nasal packing. Anterior, then posterior nasal packing. Yeah, good. Then we'll do a thing which is known as what? If both of them they didn't stop it, we know the artery of epistaxis, it is the what? It is the sphenopalatine artery. So next step what we'll do is this, we'll do go by endoscopic, and we'll do endoscopic sphenopalatine artery ligation. Endoscopic sphenopalatine artery ligation. Okay, and if it doesn't resolve, then we'll go for the next method. Okay, next method, what is that? Because we know all of them, they are the part of this facial artery, and before this sphenopalatine artery, this is the branch of maxillary artery. So we'll ligate the maxillary artery first, and if it doesn't stop, then we'll go on ligate the axial carotid artery. Okay, we'll go on ligate the axial carotid artery. So first we'll ligate this SPAL, this endoscopic sphenopalatine artery ligation, followed by this axial carotid artery ligation. And if nothing stops, if still the bleeding happens, then we need to go on ligate this anterior ethmoidal artery. We'll go on ligate this anterior ethmoidal artery. Bas itna yaad rakho. So anterior nasal, so first we'll pinch the nose. Then what we'll do? We'll do anterior nasal packing, posterior nasal packing. Then we'll go on ligate this sphenopalatine artery. Then we'll go on ligate this maxillary artery. Then we'll go on ligate this external carotid artery. Then we'll go on ligate this anterior ethmoidal artery. Bas itna yaad rakho. Fine. Then we'll move on to the next condition. Next, there will be usually a female who is presenting with features of wide roomy nasal cavity. Wide roomy nasal cavity, and there is a formation of this excessive crust. So there is this wide roomy nasal cavity along with this formation of this excessive nasal crust. This will be typically seen in a case of females. Okay, females, and this is seen in a case of atrophic rhinitis, also known as Oziana. The causative agent of this, it is what? It is this Klebsiella ozianae. Okay, 𝗧𝗵𝗶𝘀 only. On examination, if you are able to see this atrophy of this turbinates, this inferior turbinates, all these turbinates will become atrophied and shrunken, and along with this there is this crust formation. And when you sit and examine the patients, you will able to see there is a presence of this foul smell. Okay, there is a smell, but the patient does not feel the smell because of this olfactory involvement. So they will be having this type of anosmia, which is known as merciful anosmia, Okay, merciful anosmia. So हम initially treatment के लिए क्या देंगे? So the things sees that this they are wide roomy nasal cavity. They causing this dryness, causing this excessive crust formation, and this turbinates they are hypertrophied. तो उनको हमें energy भी देना है और ये crust को lysis करके बाहर भी ले आना है. Then we need to do two things. We need to supplement with this estrogens, vitamins. Then along with this we'll give sodium biborate, bicarbonate and sodium chloride. Okay, to support and to remove the crust. If this doesn't help them, then we'll do this surgery, which is known as modified Young's operation. Because of this more air going, this causing this dryness. Okay, because of this air there is a dryness. So if you close this nasal cavity and left over this small opening, this leads to this condition, which to heal this condition. So this is known as what? This is known as modified Young's operation. This is known as modified Young's operation. This is the partial closure of both nostrils. Okay, partial closure of the both nostrils. दोनों को completely बंद नहीं करना. अगर complete बंद करना, if we completely make them close, then ऊपर चला जाएगा. So we need to close them partially. Fine. Then we'll move on to the next part, which is this nasal polyps. Okay, there is this patient who is complaining of this kind of nasal fullness, and mostly they are this allergic patients which is having this nasal fullness. So mostly, on examinations you can do two examinations. Okay, there are two types of polyps. One is known as anterocoinal polyp, another one is known as 𝗃𝗏𝗧𝗧𝗧 polyp. Yeah, Dr.G, it is in the ratio of 2:1:1. Oh, correct. Yeah, if you see this nasal polyp, then it is what? It is this two types. One is known as what? One is known as this anterocoinal polyp, and another one is known as what? 𝗃𝗏𝗧𝗧𝗧 polyp. So remember, it is anterocoinal. Remember this coina, it is at the posterior aspect of the nose. So this anterocoinal polyp, it will be at the level of posterior part of this nose. So it is at the posterior part of the nose, so will be visible in a case of posterior rhinoscopy. It will be visible in a case of posterior rhinoscopy. And we know this polyp, it is what? It is this prolapsed mucosa. It is this prolapsed mucosa of this sinus. So because it is a prolapsed mucosa, it will be avascular. So it will be pale in color. It will be having this. It won't be having what? It won't be having the blood or this very pinkish color. It will be pale in appearance. Okay, and it will be a result of this chronic sinusitis. Okay, and in anterocoinal polyp it will be single. Okay, mostly it will be single in nature. Whereas this ethmoidal polyp, it will be mostly in anterior, and it will be like a bulky. So it will be multiple and seen on anterior rhinoscopy, anterior rhinoscopy. So it is what? It is this ethmoidal polyp. It is this ethmoidal. As posteriorly we see, it is the posteriorly we'll see the anterocoinal polyp. Okay, बस इतना याद रखना. Okay, these are the things you need to remember about this polyps. Okay, फिर आगे बढ़ते हैं. Next, you say up this adolescent male, like young male or adolescent, around 18 years male, who is presenting with features of painless bleeding and this kind of nasal mass and this kind of deformity which is causing this involving into the eye as well, known as frog face deformity. So what is the condition, guys? In which conditions there will be presence of this painless nasal mass along with this painless nasal bleeding along with these features of this frog face deformity? Yeah, guys? Yeah, you got it correct. It is what? It is this juvenile nasopharyngeal angiofibroma. So there will be this 12 to 16-year-old boy with the features of nasal mass and profuse epistaxis, presenting with features of also nasal obstruction and cheek swelling. Okay, and if there is any involvement of this orbit, it lead to this sign which is known as what? Frog face sign. Next, on CECT, if you are able to see, this is the maxilla. And maxilla, there are two walls. This is the anterior wall and this is the posterior wall. Okay, so this is the bowing of this posterior wall. It is not anterior wall, it is the bowing of this posterior wall of this maxilla. Okay, and this is known as Holman Miller sign. It is known as what? It is known as Holman Miller sign. It is known as Holman Miller sign. And the treatment of choice, it is the surgery. And treatment of choice, it is the surgery one. Fine. And next we'll move on to this pharyngeal abscess. Fine. 𝗶𝗀, it is nothing but it is just the formation of abscess in the tonsil. Take a formation of abscess in the tonsil, and we know if there is an abscess formation, this abscess, what will happen? It will form here and it will cause pushing this uvula. So this formed abscess, it will push the uvula to the opposite side. So if it is like this, we will call them as 𝗶𝗀, and because of this, the patients will be having a hot potato voice. Okay, we'll be having this hot potato voice. Yeah, correct. Yeah, here also in a case of juvenile nasopharyngeal angiofibroma, you won't do biopsy. Biopsy is contraindicated. Okay. And this is how 𝗶𝗀. This is what? This is the 𝗶𝗀. Okay, there is a patients with features of fever, dysphagia, throat pain, difficulty in mouth opening, and hot potato voice. Okay, this is suggestive of 𝗶𝗀. Okay, it is suggestive of 𝗶𝗀, are also known as peritonsillar abscess. Peritonsillar abscess. So it is what is that? Due to collection of pus between this tonsil and its bed. And an examination you will be able to see. Yeah, that's good. Yeah, on examination you will be able to see this tonsil is pushing this uvula to the opposite side. Okay, and now you saw a patient. There is the presence of this abscess. Okay, but the uvula is in center, but he is also presenting with features of outer neck swelling. So under bhi abscess hai or bar bhi abscess hai. So if it's inside also, outside also, it is what? It is this parapharyngeal abscess. It is what? It is the parapharyngeal abscess. And if you see just swelling and abscess over submandibular region. Submandibular region. तो ये क्या हो सकता है? It is what? It is this Ludwig's angina. Ludwig's angina. It is a Ludwig's angina. ठीक है, याद रखो. It is a Ludwig's angina. ठीक है? Yeah, good guys. Next about this adenoids. Okay, if you see about this adenoids, we already saw. We saw this adenoids. The child will be having these features of recurrent fever. There is a blockage of the nose, and there will be features, and there will be this peculiar facial features which include this overcrowding of the teeth, and there will be this high arched palate, and there will be this mouth breathing. Okay, because adenoid, it will be from this nose connection to this nose to the mouth, right? So they will be having this difficulty in breathing by nose, so they will be having this mouth breathing. So there is this features of recurrent respiratory infections along with the features of mouth breathing. Okay, along with the features of mouth breathing and crowding of this upper teeth. Okay, crowding, there will be this crowding of this upper teeth, and because of this there will be a blockage of this nasal cavity which is known as rhinolalia clausa. Rhinolalia clausa. Because of this rhinolalia clausa, there will be hyponasality. Okay, there will be this hyponasal voice. It is known as hyponasal voice. Okay, so for this adenoidectomy, to remove, we'll do this surgery. Okay, to surgery, we'll pose them in a position which is known as rose position, means we'll extend them. Okay, we'll extend around this, the junction of this cervicothoracic junction, and we'll extend to see the field. Next, how will we do? We'll do either coagulation or suction diathermy. We'll do the surgery. And in some conditions, if you do overflexion, will cause what? Overflexion or overextension. It will cause this dislocation of atlas, dislocation of the atlas axis. It is known as what? It is known as Grisel syndrome. It is known as Grisel syndrome. Fine. Then this is the adenoidectomy. Then in a case of recurrent tonsillitis, then we need to remove the tonsils as well, right? So in such conditions, it can lead to some complications. The complications of this tonsillectomy include, the one of the main, it is what? It is this hemorrhage. Yeah, hemorrhage. Yeah, correct, Dr. Gautam. It is the C1 to C2 subluxation. Fine. And this tonsillectomy, it leads to few of these following complications. The complications include mainly the hemorrhage. The primary hemorrhage, it occurs during the surgery. So during surgery, whatever hemorrhage you can conclude by cauterizations. Whereas this reactionary hemorrhage, it occurs within 24 hours, mostly in wards. Okay, the patient is admitted in ward, as in a post-op ward, and the bleeding starts. Okay, now it is because of the slippage of the ligature. You put and ligature and it is being slipped off. Okay, there is a slippage of this ligature. So because of the slippage of this ligature, this will cause this bleeding, and in such scenarios you need to shift them to OT, and you need to resuture it back, remember. And about this secondary hemorrhage, it is happens mostly after the 5th day of surgery because of this infection. It's actually after 24 hours. It is usually happening after 24 hours. Okay, so it will be usually because of these infections, and we know if there is any presence of infection, तब हम क्या करेंगे? Then we need to give antibiotics. So in the case of infections, we give antibiotics. We'll give antibiotics. Yeah, good guys, good. I'm from Tamil Nadu, doctor. And next one is the nasopharyngeal carcinoma. ठीक है, अगर आप nasopharyngeal carcinoma के बारे में सुनेंगे, then the most common sign the patient will present with what? It will be having this cervical lymphadenopathy. Will be what? Will be this cervical lymphadenopathy. So there will be this features of painless cervical lymphadenopathy in old age patients, and along with this nasal bleeding episodes. And we know, we already studied this Epstein-Barr virus is in close relationship with this nasopharyngeal carcinoma. So there is a 56-year-old male who is complaining of nasal bleeding. Under an examination you will be able to see there is this painless cervical lymphadenopathy. और हमें पता है this nasopharyngeal carcinoma, it is origin from this fossa of Rosenmuller. Okay, this is this eustachian tubal opening, and this is the fossa of Rosenmuller where this tumor of esopharynx which is occurring. So fine. So this is the first one. It is the eustachian tubal opening, which you see most anteriorly it is the eustachian tubal opening, and posteriorly means see from you like this. This hand, this is the eustachian tubal opening, and this hand, this is this fossa of Rosenmuller. Okay. So this is like this. So actually it is oriented like this. So this is the first, you will see this eustachian tubal opening, followed by this you will see this fossa of Rosenmuller. You will see this fossa of Rosenmuller, and it can lead to this triad which is known as Trotter's triad, which can be removed by this mnemonic as NPC. So initially there will be this neuralgia, and neuralgia it is due to the involvement of 5th nerve. It is due to the involvement of 5th nerve, and there is this palatal palsy, ipsilateral palatal palsy due to the involvement of this 10th cranial nerve, and also will be this ipsilateral conductive hearing loss. There will be a conductive hearing loss, palatal palsy due to the involvement of 10th nerve, and there is a involvement of this neuralgia due to the involvement of this 5th cranial nerve. So NPC, neuralgia, palatal palsy and conductive hearing loss. Neuralgia, palatal palsy and conductive hearing loss. We studied in COSOM there is a Grady-Negro syndrome, GERD. Grady-Negro syndrome, E for ear discharge, R for what? What is the R one? Yeah guys, answer me in the chat box. Did you remember what is the R? Here we studied, right? God. It is what it is this? Retroorbital pain. Then you are getting it correct, Dr. Ragul Singh. It is what it is this? Retroorbital pain. Here also it is due to this 5th nerve involvement. Okay. Whereas here also there is a neuralgia which is due to the 5th nerve involvement. And here the third D for this diplopia due to this 6th nerve involvement. Okay. 6th nerve involvement. Okay. This is about this nasopharyngeal carcinoma. So treat this, what we'll do? We'll do this chemo radiation. Badya. Good Dr. Nida. Good Dr. Dsruxi. Good Dr. Gautam. Good, good, good. Right. Next. We'll move on to the next part where there is this laryngomalacia. Usually this laryngomalacia, it is an means floppy epiglottis, and it is a congenital condition, and mostly it won't have any complication or any symptoms until unless there any complications arises. Mostly the stridor will be there in supine position. So when you turn the baby into prone position, the stridor will settle. Okay, the stridor will settle. Okay, in supination, in supine position, the baby will be having the stridor, whereas you up ulta karoge means you make them in prone position, then the stridor will decrease. Okay, and we know it is mostly asymptomatic in nature, and here you will be able to see this type of omega shaped epiglottis. Okay, omega shaped epiglottis are either cry be normal रहेगा. Unlike esophageal webs, there will be abnormal cry. Here the cry will be normal. And the treatment what will do? It is the mostly the conservative management it will do in a case of laryngomalacia. Okay. Next one about this epiglottitis and tracheobronchiolitis. So if you see about this epiglottitis it is the involvement on the involvement on this inflammation of this epiglottis. We know this epiglottis, it is in close relations with this tongue. So if there is an inflammation of this epiglottis, then it will go and irritate the tongue. Means here is the tongue, here is the epiglottis. It will go and irritate the tongue. When it starts irritating the tongue, the child will not swallow the saliva. So there will be drooling of saliva. Okay, there will be drooling of saliva. The child will be having this difficulty in swallowing, in breathing, and everything. Okay, so this is this typical feature of this epiglottis. There is a 5-year-old child with a fever, inspiratory stridor, and there will be a drooling of saliva. And then lateral soft tissue neck, you will be able to see this thumb sign. Yeah, good, Dr. Dr.G, Gautam, Naresh, Shanwas Khan. Well said. Okay, it is what it is. This thumb sign where you will see in a case of lateral side of this soft tissue neck. Next, you will see what is the management you will do. Once the baby comes, the baby is unable to even breathe, I told you, right? So immediately what you will do, immediate intubation. So you will secure the airway, and you will avoid multiple laryngoscopic procedures. Because multiple karoge to it will cause more spreading and more injury to the area. So you will avoid multiple laryngoscopic procedures, so that initially itself we will do intubation. Okay, and for treatment you will give dexamethasone and antibiotics. And the most common cause now it is what is Streptococcus pneumoniae. And if they mention in questions, there is an unvaccinated child. Who is presenting with this features of this epiglottitis. What is the causative agents? Then you can think of 𝗵𝗵𝗶𝘀 influenza. Yeah, good. Then we'll see about this acute laryngotracheal bronchitis. In the case of acute laryngotracheal bronchitis, the causative organism is it is this para-influenza virus. And we know this acute laryngotracheal bronchitis, this para-influenza virus, it affects the trachea. So it will produce this, an AP X-ray will produce, see this steeple sign. You will see this steeple sign. So on X-ray you will see this steeple sign. There will be this 3-year-old child will be complaining of low fever, mild respiratory difficult, and this cough resembling this buckling of this jaw, which is known as what? Whooping cough. It will be seen in a case of acute laryngotracheal bronchitis, also known as croup. Okay, and this here the treatment will be providing this humidified oxygen and adrenaline and dexamethasone. As it is viral infections, mostly will avoid antibiotics until unless there is a secondary infection or secondary complications. Fine. And next, you saw a child who is presenting with this hoarseness of speaking. This child will be having this hoarseness of speaking or hoarseness of voice. You will be able to see. You plan to do an laryngoscopy, and on laryngoscopy you will be able to see this multiple outpouching structures. So, it is the juvenile laryngeal papillomatosis. Okay, and the causative agent is it is this HPV6 and 11. HPV6 and 11 for treatment you will do MLS, microlaryngeal surgery with carbon dioxide laser. Whereas if you see, there is adult smoker. Instead of this multiple outpouching, if the vocal cord is like a single outpouching, okay, single flocculent swelling in a smoker, adult smoker, तो आप क्या think कर सकते हो with the features of this dysphonia and diplophonia. या ये कौन सा ये क्या हो सकता है? There's this single flocculent swelling. ठीक है, there's a collection of fluid in between these layers of vocal cord. तो ये क्या हो सकता है? It is what, yeah, good guys, good. It is what is the 𝗵𝗵𝗀𝗃𝗃. It is the 𝗵𝗵𝗃𝗃. Remember, it is the 𝗵𝗵𝗃𝗃. फिर उसके बाद आगे बढ़ते. Next, this vocal nodules. This vocal nodules, it is most commonly seen in a case of this professions where there is the loud using of this shouting or loud voices. Like they are known as singers, screamers, and teachers nodules, where there is a history of vocal abuse is there. Okay, common in vocal abusers. Okay, and their complaints is the hoarseness of voice. And on examinations, you will be able to see it is the bilaterally located at the level of junction of 1/3 to this anterior 1/3 to this posterior 2/3. You will be able to see there is this bilateral small nodule. They are known as vocal nodule, or also known as teachers nodule, also known as singers nodule. तो इनके लिए क्या करेंगे? सुनो, अब थोड़ा देर के लिए रुको. Means you just wait for a while. Don't speak loudly. Speak less for few days. So this is known as what? This is known as speech therapy. So we'll give speech therapy. Sometimes this can be occur because of this acid reflex. तो हम दो चीज करेंगे. एक चीज क्या है? First we'll do speech therapy, which is just to give some voice rest. Then we'll give them proton pump inhibitors. तो यही करेंगे in a case of vocal nodules. And in a case of vocal nodule, it is seen in a case of sudden vocal abusers. Means normally, means you are hearing a DJ in a party, okay, or you are dancing in the pub, and then you saw this sudden your favorite song, okay, favorite song sung by Dinchak Puja, then you started hailing, okay, there is a sudden vocal abuse, okay, there is a sudden vocal abuse leading to this one polyp formation, and it is also around the location of anterior 1/3 to the posterior 2/3, anterior 1/3 to this posterior 2/3, okay. So it is what it is, this vocal polyp, okay, it is the vocal polyp, it is the vocal polyp, you will see here, okay, yeah, and it will be mostly unilateral in nature, it will be mostly unilateral in nature, and there will be a complaints of dysphonia, there will be a complaints of dysphonia. To treat this, you will use this microlaryngeal surgery, you will do what, you will do this microlaryngeal surgery, okay. Then after laryngectomy, आपने तो उड़ा दिया, means you just took this larynx, you just removed it because of there is any laryngeal cancer. So in such conditions, हमें तो उनको means we need to make them respire, and also we need to make them to speak a little, right? So in such cases, we can do different types. One is what, we'll tell them to take the ear and we'll speak from the esophagus, okay, that is known as esophageal speech. There is some more devices which we can use, like this one, which is known as Bloom-Singer's prosthesis. Bloom-Singer's prosthesis, yeah, prosthesis, yeah. I dream MBBS, yeah, I think you are dreaming till now, that is why good morning now, huh? Okay, so if you are able to see, this is known as what, this is known as Bloom-Singer prosthesis, okay, good morning Dr. Bloom, fine, dream. Okay, next one, it is this electrolarynx, okay, which produces this robot like a voice. So Bloom-Singer prosthesis and then the electrolarynx, these are the few processes we'll use for this post laryngectomy voice rehabilitation, fine. And there will be a few cases, there is a usually these diabetic patients or any immunocompromised patients who is on long-term steroid therapy. Now they are complaining of this blackish discoloration of this nose, or this around the nose there is a mass which is in blackish color or necrotic mass. What you will think of? Yeah guys, what you will think of? Best. Okay, it is the mucormycosis, because it is the mucormycosis, okay. So this is what, this is the mucormycosis, okay. And in a case of mucous mycosis, it can even involve into the eye. So eye के around भी ये क्या हो सकता है? It can come and involve around this eye and can cause diplophobia. So there will be swelling around this eye, redness and swelling around the cheek. So for this diagnosis, what we'll do? We'll do this MRI with contrast. We'll do this MRI along with this contrast. Okay, and treatment हम क्या करेंगे? We'll give this amphotericin B. We'll give this amphotericin B. Okay. Then we need to see about the structures. The first structure, it is what? It is this. Mark this 4. मैंने बोला क्या पहले क्या आएगा? It is the eustachian tube opening, and the second, it is the fossa of Rosenmuller. Fossa of Rosenmuller. Okay, fossa of Rosenmuller. That is the eustachian tubal opening, and next one, it is the fossa of Rosenmuller. Okay. Then we'll have one more syndrome which is known as Ramsay-Hunt syndrome. Okay, it is nothing but our facial nerve palsy. If it occurs because of this herpes zoster, we'll call them as Ramsay-Hunt syndrome. Okay, Ramsay-Hunt syndrome. और हमें पता है this facial nerve palsy, okay, if it is involving this lower motor neuron, okay, then it will be involving this lower motor neuron. It will be involving the same side. Same half will be involved, and we know there will be this what? There will be non-closing of, there is no complete closing of eye, and then there will be what? There will be loss of this nasolabial fold, and there will be absence of wrinkles, and along with this, the corner of the mouth will be shifted to the opposite side. There will be this corner of this mouth deviation to opposite side. Yeah, opposite side. Yeah, good. This is due to the facial nerve involvement, and for these cases, we'll give two things. Okay, if it is because of trauma, we'll give steroids to decrease the inflammation, or if it is because of this infections like herpes zoster, then we'll use acyclovir. Or mostly we'll don't differentiate them, so we'll give them both acyclovir and steroid therapy in a combination. Okay, this is the lower motor, whereas upper motor, it is this contralateral opposite side, just lower heart. Just opposite side lower heart will be involved in the case of upper motor neuron. It will be the contralateral lower half only, Okay, remember. These are the things you need to remember about this Ramsay-Hunt syndrome. फिर उसके बाद they ask the simple questions. What is this bone? This you know, it is the stapes. Tell me, what is this bone? Is it malleus or incus? Like I said, is it malleus or incus, the second bone? Second bone, ये क्या है? Second bone, it's what? It is the malleus. It is the malleus. Whereas the third one, क्या है? No, that is what? That is where the confusion. So remember, like these small things we make mistakes. ठीक है, अगर आप स्मॉल थिंग में भी मिस्टेक करोगे ना, आप मेन एग्जाम में जाके यही मिस्टेक करोगे. सो ट्राई टू डिफरेंशिएट. अगर उसका ब्रॉड है तो इट इज व्हाट? इट इज द इनकस. Incus is a broad in nature. ठीक है, and we have few more processes. They are known as TORP and PORP. Partial prosthesis, like for example, the half of the bones, they are still intact. So we'll call them as PORP. Whereas the entire ossicular chain is replaced, we'll call them as TORP. Total ossicular reconstruction prosthesis. So this is a TORP, and whereas these are the PORP one. Okay, these are the PORP one. So remember, it is the partial one, and whereas this one is total ossicular reconstruction prosthesis. Okay, and as I told you, you saw a patient who is presenting with features of sensory neural hearing loss. Okay, and you did a gadolinium enhanced MRI. Okay, nothing but a contrast enhanced MRI. And contrast enhanced MRI, you will be able to see this bilateral ice cream cone appearance. This bilateral ice cream cone appearance in a case of contrast enhanced MRI will be seen in a case of, yeah, it will be seen in a case of acoustic schwannoma, also known as vestibular schwannoma. Okay, remember, it is seen in a case of vestibular schwannoma. And we know in the case of vestibular schwannoma, if it is occurring in bilaterally, it is because of this NF2. So this, if it occurs on the two sides, it is what? It is because of this NF2. So this is the vestibular schwannoma. Mostly it will originate from this inferior vestibular nerve. It will be originating from this inferior vestibular nerve. So these are the main things and most important topics you need to remember from this ENT perspective. Just remember one thing, it is not everything what you read, okay, like what you read or what you do, it is a little thing, it will be in your conscious mind, whereas rest of the things, it will be behind you. It means it is under your subconscious power, like something you read like 1 year before or few months before, but see this, whatever you read, it will go and sit into your subconscious mind. Okay, and that will provide you this infinite power to solve this examination, to pass this examination. Okay, guys, that's it about this ENT part. Take a 2-minute short break. Just if you have any doubts, we'll solve it up. Okay, then we'll start with PSM part. Okay. Hello doctors, welcome back. Welcome back to the PSM part of Dr. 𝗚𝗫's game changer session. Fine. In this, we'll discuss about the PSM part. We'll take up the total is around like more than 1.5 hours, but we'll keep it for 45 minutes, and after that we'll have a lunch break, and after that we'll complete PSM and ophthalmology. Okay, that will be our aim for the day. Fine. And if you have any doubts regarding the same, you can put up in the chat box. We'll help you out. Fine. I guess there is no any doubts, right? We're back. Apta will do after lunch. So PSM, it will be having this more than 30 to 35 questions, and out of which like half or more than half will be from this PDF, because it is very much high yielding, so don't miss it out. Okay, that is my point. Okay, yeah, fine. Okay, Shamas, we'll continue with this. Fine. Okay, we'll start with the PSM part. In PSM, as I told you, it will be from 30 to 35 questions it will be asked from this PSM point, and out of which you will get 10 questions in each sessions. It will be new. Okay, they will change the trend of this PSM in each time with new sets of questions, but the rest 20 questions it will be always fixed. Okay, and it will be from this topic, so you will get around 20 to 25 questions of your PSM from this notes. Okay, that will be based on my experience what I have. Okay, first we'll see about this epidemiological study. Okay, what they will ask you in epidemiological study is that which of the following study which is used to assess the incidence. So remember, in the case of cohort study, we can measure the incidence, because if you see the cohort study, it is of different types: prospective cohort and retrospective cohort. In the case of cohort study, what we'll do, we'll start from the risk factor, means whether the smoking is present or not. Like he's smoker, he's a non-smoker, and we'll travel in time and we'll check for the effect. Like what are the effects it is causing, or is it causing this lung cancer or not? Okay, this is the proper cohort study. Whereas you evaluated for one disease, you have this prospective cohort already. Now you can go retrospectively, like yeah, he had this exposure. Okay, now he had this exposure, and now you are associating with another factor. Okay, another factor. Okay, that is what, or another disease. That is this retrospective cohort study. And with this cohort study, we know we can identify incidence. Incidence means number of new cases. It is the number of new cases. Okay, and with this incidence, we can tell what is the relative risk, attributable risk, and population attributable risk. Like what is the risk that you have between a normal person who is not smoking to the smoking person, and how you will affect in this community, and how it will affect in this overall population. So you will tell all of this with this cohort study, and this will be done. Yeah, it will be from today to this future. Today from 2024 to this 2026. Remember. Then it will be the unit will be what? It will be this unit of the study. In a case of cohort, it is the individual. And next, what can happen is that it is 2024. Like you passed your FMGE examinations, you are out of stress. You thought, okay, stress तो निकल गया, तो चलो सुट्टा पीना छोड़ देते हैं. So you will leave this habit, or you will leave this study designs itself, or leave for the study itself. So it is known as attrition bias, also known as last to follow up. It is known as last to follow up. Okay, and here we'll be able to see, we can tell about this natural history of disease. Yeah, good, Dr. Shanvaskan. We can tell here about this natural history of disease, and also we can tell what is the association between this risk factor to the disease. And next one, it is the case control study. This case control study, it is what? It is a retrospective study. In the case of case control study, you have the disease present. The disease is already present. While having this patient itself, you are having the disease, like, and you will be having a normal control. You will ask him whether you got a lung cancer patient, and you asked him whether did you smoke before. So you are asking questions to him. You are taking history from him. So it is what? It is this case control study. Okay, we are going from disease to the risk factor, or from the effect to the cause, and it measures nothing. It measures one thing, which is known as what? Which is known as odds ratio. Odds ratio. It will tell us this association. If odds ratio is equal to 0, okay, then there is no association. If it is more than 1, then we'll call it as there is the positive, there is a relation. Okay, there is a relation with it. If it is less than, actually there is no relation. Okay, the unit of study here, it is the individual. And what the patient can have is that when you ask questions to him, or when you ask history to him, the patients may forget. this is known as recall bias. So recall bias you will see in a case of case control disease. Yeah, and this usually done in backward directions, and especially for the rare diseases. Okay, for any rare pancreatic cancer. So in such cases, you will use this case control study. You will use this case control study. And next it is the cross-sectional study. Okay, now after this class, you went for the lunch. Okay, you went for a biryani center in the Saket, or you went for a biryani center in the Gautam Nagar. ठीक है, उसके आसपास क्या होगा, मतलब चाय की दुकान होगा, तपरी होगा, तो देयर दे विल बी हैविंग द स्मोकर्स. एंड नाउ जैसे आपने खाना कर मीन्स व्हाइल यू आर हैविंग द लंच, आपको याद आया ठीक है आज तो हमने क्रॉस सेक्शन पढ़ा, तो चलो ठीक है उसका इस्तेमाल कर देते. सो यू प्लान टू वर्क आउट लाइक कितने लोग एक टाइम पे सुट्टा पी रहे हैं. ठीक है, सो यू आर evaluating at the certain point of time. Okay, at this moment how many of them they are smokers. Okay, so it is like a kind of snapshot study. It is known as snapchat, it is snapshot study. It is also known as snapshot study at the present time. Okay, and with this I can tell you this many इतने लोग यहाँ पे सुट्टा पी रहे हैं करके. So you can tell about this prevalence of this thing. So it will tell you about the prevalence. So cross sectional will tell you about the prevalence, and this also will be done in a case of individually. It will be done in individually. Next one, it is what it is, this ecological study. And this ecological study, they also known as correlational study. When it is just comparing the populations, like then you means you passed FMGE, you cleared the UPSC, and you became an officer. You became an officer come doctor. Okay, once you became an officer means you got multiple cases of this लंग कैंसर, तब आपको पता चला ठीक है यार कि कितना सुट्टा फेंक मतलब बेच रहे हैं करके. then you were able to analyze how much cigarettes they are selling. So from that you got to know that how much this is occurring so in the population. So you went to the government, you got the details or data of it. So if you are taking the data from the general publications or from the government and you are comparing it, so it is what it is, this ecological study. It is the ecological study. So it is what it is, the correlation of variables where we can measure using this ecological study. And with this ecological study, it will be done in population. It won't be done in individual level, it will be done in the population level. It will be done at the population level. It will be done at the whole population. ठीक है, whole population मतलब एक बंदा एक दिन में 3 सिगरेट पी रहा. So it is like that, but there will be few people they won't even smoke. Okay, so there will be the few people. So it is the ecological studies. It won't be equally spread, but it will tell an average value. Okay, that's it. You need to know about this epidemiological study designs. They will tell in question, they will describe a patient is presented with lung cancer. So you want to evaluate the cause for this lung cancer. Now you have the patient and you chosen a normal person as a control. Okay, you have the patient and normal person as a control. Which of the following study designs you will use to analyze the relation with it? तो आप क्या करोगे, कौन से स्टडी डिजाइन यूज करोगे, where you have this patient or the diseased person and the normal person? क्या करोगे या कौन से स्टडी डिजाइन यूज करोगे? या guys, you will use case control. You will use case control if there is a presence of disease. Okay, yeah, you will use case control if there is a presence of disease. Okay, yeah, good Dr. Rahul. Then we'll move on to the next part, which is this. Yeah, next part, which is this levels of prevention. Levels of prevention mean nothing. You need to know whether the risk factor is present or not and the disease is present or not. ठीक है, अगर कोई risk factor बिल्कुल अभी तक आया नहीं है, means someone is telling, okay, well in your small ages they are telling like जैसे आपके बचपन में थे, in your small age they are childhood they are telling like not to adapt bad habits. ठीक है, बस अब तुम्हें बोल रहे हैं कि bad habits नहीं डेवलप नहीं करना. ठीक है, so it is what it is, the primordial prevention. ठीक है, because there is no risk factors present, whereas you became young or you became adolescent, then there is a risk factor of cardiovascular diseases because of your family and things present, and someone is telling try to exercise. So if there is presence of risk factor and you are doing some changes in it, that is the primary prevention. For example, in a case of COVID-19, you should wash the hands. Because of COVID-19 only, you are washing the hands. That is a risk factor is present. That's why you are doing some intervention. Okay. Whereas in a case of secondary prevention, okay, in secondary prevention, what you will do is that there is a risk factor, and because of this risk factor, there is a developed disease. For example, you had this lifestyle changes, very bad lifestyle. Because of that, you have developed hypertension. अगर आपको hypertension हो गया, then what you need to do is that you need to do early diagnosis and treatment. So you should do early diagnosis and treatment. So diagnosis or screening and treatment, it will be under this secondary prevention. It will be under the secondary prevention. Okay. Next, about the tertiary prevention. Okay, there is risk factor is present, the disease also present, but complication is also present. For example, there is a RT occurred and there is this complications of unable to walk. Then now what he will do in the case of tertiary preventions, to prevent from this further damaging, what he will do, he will remove the leg or he will give some aids. For example, wearing a chashma, wearing a specs for this ocular morbidity, it will be a tertiary prevention for reducing its complications or not progressing into the disability. So it is what it is, the tertiary preventions. So in the case of primary prevention, how will you do prevention? आप बोलोगे उनको, will do health promotion and health education. As primary prevention, like diseases, they do exist. For example, vaccination, there is a risk. That's why we are doing what? That's why we are doing the vaccination. So like specific protection like vaccination. And here also health promotion like hand washing because of the presence of risk factor. Then in the case of secondary, the disease is present. So we need to make diagnosis. Yeah, make diagnosis and treatment. Fine. And in the case of tertiary preventions, the disease already is there, and because of this preventing complications and further disabilities, we are using what? We are using chashma. So it is what? It is a type of tertiary prevention. It is a type of tertiary prevention. Like for example, leprosy patients, giving them proper aid. So it is what? It is the preventing the tertiary complications, which is the tertiary mode of prevention, like disability limitation and rehabilitation. Okay, fine. So these are the things you need to remember about the levels of prevention. फिर उसके बाद आगे बढ़ते demographic cycle. Yeah. Vaccine is a primary prevention until unless it is given for a treatment. For example, in a case of superficial bladder cancer, we'll give TB vaccine for a treatment. Okay, that is a treatment, but usually we'll give vaccine for a prevention. Okay, that is the primary level. It is not primordial, it is the primary. So primordial, primary, secondary and tertiary. Okay, remember. Yeah, good guys. Then we'll move on to the next part, which is this demographic cycle. This demographic cycle, if you see, the demographic cycle, they have love on it. They were keep on asking about this demographic cycle in all the examination, irrespective of NEET, PG, INSET and FMGE, and mostly it is present in all the examinations. So you should know in and out of this demographic cycle. Okay, if you see, initially it is known as what? High stationary phase, and there is early expanding, followed by this late expanding and low stationary and declining. Yeah, but yeah, India is in early, like India is in stage 3, which is this late expanding. So if you see in early stages, both the birth rate and death rate, both of them will be more. The birth rate and death rate will be more in the case of stage 1, which is this high stationary, and followed by which will be starting this interventions to decrease the death. So the death rate will start decreasing. So in stage 2, the death rate will start decreasing, whereas this birth rate will remain high. Okay, will remain high. So there will be this variations between this birth rate and death rate. So this is known as what? This is known as demographic gap. And we'll see maximum demographic gap in a case of stage 2. We'll see in a case of stage 2, which is this early expanding. Whereas in a case of stage 3, if you're able to see, this birth rate, it also start decreasing. This is where in India, okay, there is already decreasing death rate, but the birth rate also started decreasing. Okay, the birth rate also will start decreasing. Once the birth rate start decreasing, this demographic gap, it will start decreasing. So here the demographic graph will start declining. Okay, here the death rate is already low, but the birth rate will be start decreasing. Okay, next, if you see the stage 4, followed by the stage 4, the birth rate will become very minimal and death rate will be around less, but around a stage level. So that way it is known as low stationary. First high stationary, early expanding, late expanding, then low stationary, and then decline. Okay, then decline. These are the stages you should know of. Fine. And if you see about this low stationary part, it is what? It is both death rate and birth rate will be less, but still the birth rate is more than the death rate. Okay, birth rate is more than the death rate. Remember, this is the one thing. Birth rate is more than the death rate. Okay, this is the low stationary phase. Fine. And followed by which the declining phase. In declining phase, the death rate will be low, whereas birth rate will be lower than the death rate. So this is the one catch point. Here the birth rate will be lower than the death rate. Here birth rate will be lower than the death rate. So they can give you this phase and they will ask you which phase is this. You will should tell it is high stationary. Which phase is this? It is this late expanding. Which phase is this? It is the declining phase. And they will ask you in which of the following where there is a negative, means where is this negative gap, where there is this negative dermographic gap. You should tell it is the stage 5, which is the declining phase. Stage 5, which is the declining phase. Yeah, that's it, guys. That's it. You need to know about this demographic graph. You should see it once or twice before going to the examinations, and there will be one solid questions from this. Okay, we'll move on to the next one. There are few parameters you should know about their content. Means what are these parameters? For example, HDI, which is this Human Developmental Index, and PQLI, Physical Quality Index of Life. Okay, or Physical Quality of Life Index. Okay, and both of them will be remembered by this mnemonic of LIL. Okay, LIL, LIL. So L stands for literacy rate. Okay, literacy rate. Then I for infant mortality rate. Literacy rate, infant mortality rate, and life expectancy in 1 year. Remember, how will you write this? PQLI. So this I is looking like a 1. This I is looking like a 1. So it is PQL1. So it is life expectancy at 1 year. At 1 year. So life expectancy at 1 year. Next one is this Human Developmental Index. This Human Developmental Index, it ranges from 0 to 1, and it also has this LIL. So one is the same literacy rate. So instead of infant mortality rate, here it is the income, or this gross national income per capita. Okay, it is the gross national income per capita, fine, which amounts for our living standards. Then here also this life expectancy, but remember this is the life expectancy at birth, whereas in the case of PQLI, it is the life expectancy at 1 year. It is the life expectancy at 1 year there. Here it is life expectancy at birth. Okay, next one more scale. It is known as what? 𝗵𝗶𝗀 scale. It is known as 𝗵𝗶𝗀 scale. This 𝗵𝗶𝗀 scale is used to tell whether the population is in which class, like upper class, upper middle class, or lower middle class, or lower class. Okay, based on their, to define their socio-economic status. Okay, to decide their socio-economic status, and the score will be from minimum from 3 to 29. But what they will ask you, what are the components? See here, the component is education and occupation of head of the family. Education and occupation of the head of the family. And the next one, it is not the salary of the head of the family. It is the income per month from all the sources, from all the people. It is not the head of family, it is from all the people. So they will ask you, income from only the head of family. That is a false statement. So you should be vigilant in these cases. Yeah, okay, yeah. Good, Dr. Mohammed. I will use mostly for this urban scales. Next, about this few more things. If you see about this DALI, which is this disability adjusted life years, which is this disability adjusted life years, it will be having this two components. Like this is with disability, how much life you have lived. Okay, years of lost means because of this premature death or something, how much year has been lost, or along with this years he lived with this disability. So this is known as DALI, which is this disability adjusted life years. It will tell the burden of the disease in the community. So how much percentage of the people they are suffering, means how much people they are living with the disability, and how much yearly they are dying when compared to the normal population. This is known as disability adjusted life years. For example, if normal people is dying at 70 years, they will die at 50 years. This is the years of lost, whereas normal people, they will live without any problem until 50-60 years. Here they start their problems at 30 years. So this is the years lost, means 20 years are being lost than usual. So it will tell about this burden of the disease. Yeah, good, fine. Next, about the quality adjusted life years. About this quality adjusted life years, you need to know how much years, or after intervention, how much years has been increased. Increase in number of years or gain in number of years after an intervention. For example, you diagnose a case of hypertension or diabetes much early in your life, and because of your diagnosis, you took some intervention, you given them drugs, and because of these drugs and the medicines, the patient is living for more 10-15 years. So it is known as what? Quality adjusted life years. Fine. And next one, how much year he lived without any disability, or he lived without any disability or disease. For example, if the disease is started at 30, means till 30 years he was without any disease or disability. Okay, remember that thing. That is known as Sullivan's index. That is known as Sullivan's index. Fine. Do you have any doubt till now? Fine, clear, fine, good, then well, fine. We'll proceed with this next part. In recently they started asking about this formula. What are this formula? If you see, the most important differentiating formula is this maternal mortality rate and maternal mortality ratio. Fine. If you see about the rate, usually this numerator will be a part of the denominator, whereas ratio, it won't be a part of this denominator, won't be a part of, means this numerator won't be a part of this denominator. So likewise, in the case of maternal mortality ratio, it is the number of maternal deaths per live birth. It is the number of maternal deaths per live births into 1, 10, 100, 1000, 10,000 lakh into 1 lakh population. It is 1 lakh population. So it is the number of maternal death per live births per 1 lakh populations. Whereas maternal mortality rate, it is what it is this number of deaths in a woman in reproductive age. Which what is the reproductive age? It is the 15 to 49, the same 1 lakh. Same 1 lakh. So remember, it is maternal mortality ratio, it is number of per live birth. Okay, maternal deaths per live birth. Whereas here it is the woman in the reproductive age. We know this woman in the reproductive age, they only will get pregnant, right? So the numerator, it is a part of denominator. So that is the maternal mortality rate. Fine. And in pediatrics, we need to know few formulas. One is this infant mortality rate. We know we'll call them as infant if they are within 1 year. And there are two. And there are few modes. Okay. So to calculate this, it is what it is, this number of infant deaths during the year divided by number of live births during the same year into 1000. Whereas there are this neonatal mortality rate. This neonatal mortality rate, it is of two types, yearly and late. Neonates are those peoples, are this child 0 to less than 28 days. Okay, 0 to 7 here or 7 to 28. So it is this, yeah. Let me write clearly. Yearly and late neonatal mortality rate. If you see yearly means it is 0 to 7, whereas late it is what? It is 7 to 28 days. So usually neonates, they are the 0 to less than 28 days. Okay, these are them. So there are two more formulas there. Just replace with yearly and late, you will get it. So here this number of infant deaths less than 29 days. Okay, less than 29 days during the year to this number of live births. So it is what it is, this neonatal mortality rate. Next one, it is what it is, the child death rate. Child death rate is number of death of children of 1 to 4 years during the year divided by mid-year population. Remember, it is the mid-year population between 1 to 4 years into 1000. So all of this mostly it will be 1000. Whereas maternal mortality ratio and rate, it will be having this 1 lakh formulas. Fine. Then this under 5 mortality rate. Under 5 means within 5 years, how many children have been died during this year to this number of live births. Okay, so we will measure like neonates till 1 year how much they are surviving, until till under 5 how much they are surviving, and how many children they are usually surviving. So we'll check it. Okay, yeah, the mid will calculate from the 1st July. Next one, it is the crude death rate, means number of deaths divided by mid-year population into 1000. And case fatality rate means how much the patients are dying from the disease, or how much patients who are suffering from the similar disease are ended up in death. Okay, so number of death from a particular disease, okay, to this total number of cases of the same disease. It is the same disease into 100. Here it is 100 because we express them in percentage. So it is the 100. Fine. Next, we'll look into this instruments. If you see these instruments, these are most commonly used. So it is what? This is this 𝗏 thermometer, and this 𝗏 thermometer, it is used to measure the cooling power of the air, and it is used to measure the cooling power of the air, and also it can measure this low air velocity. It can measure the low air velocity and cooling power of the air. And next, good Dr. Shanavas, good Dr. Anush, and good Dr. Anirudh. Next, if you see this image, it is this globe thermometer means globe. So globe thermometer can pick the heat from anywhere. So it can pick the heat from anywhere. So it is what it does. It can pick the radiating heats. So it can pick the radiating heat. It is the globe thermometer. And then this is this sling psychrometer. You will keep in hand and it will move like in a slingy motions. So it will tell the humidity of the air. Okay, there will be two thermometer. Okay, wet and dry. Okay, so it will be the sling psychrometer. It will tell the humidity of the air. Okay, next it is what? It is this Psm psychrometer, and it is also tell about the humidity of air. Fine. And next, if you see, this one will tell about this velocity or movement of the air, or what is the velocity of the air. It will be told by this anemometer, or will be measured by this anemometer. It is what it is, this anemometer. Yeah, good Dr. Naresh, good Dr. Prototype, good Dr. Anash and Shanavaska. Good. It is the anemometer. It is the anemometer. Fine. And next, we'll move on to this daily dosage. If you see first about this energy, it is calculated for this normal men and normal women. So who are calculated as normal men and women are ideal. So they should be within the age of 19 to 39, like you and me, and they should be having this BMI of 18.5 to 22.9, 18.5 to 22.9, and for men it should be 65. Men should be more, right? So men should be 65 and female should be 55. So men should be 65 and female should be 55. Fine. And there are three levels: sedentary, moderate, and heavy. If you see now, we are just sitting, reading, revising. We are giving work to our brain. So it will be mostly considered as sedentary. Whereas when you join your internship, like initially we'll think it is a moderate, but actually we'll do what? You will do this heavy walks. Okay, you will taking samples, sometimes taking the patient even, some taking this instruments, taking this big files. So that is the heavy work. So for this, now you can eat less. Okay, you can become fat also, no issues. Fine. So to know now, it is this caloric requirement. So it is very easy. It is easy peasy for you. Remember, have a calculation of first. For sedentary, you should remember. Fine. For sedentary, if you see, it is the 2100. Okay, it is 2100. And if you add around 600, okay, 600, it is what? It is the 2700. It is 2700. And next, if you add more 800 or more 700, it is what? It is around 3400. It is actually made it round. It is 3500. Okay, and this is the opposite of here. Here, if you see, initially for women, it is 1700 for a sedentary life, and the first and second for of male, 2100 and 2700. Okay, that's it. Okay, you need to remember 2100 and 1700. 2100 plus 600 कितना हुआ? 2700. 2700 plus 800 कितना हुआ? 3500. The same here. Just keep the same. 2500 first one, 2700 second one. Put it into this moderate and the heavy walker level. That's it. It will be remembering for you. Okay, it will remember for you. Then during the pregnancy, you should start giving this extra calories, like from 350 calories. Okay, you should start from 350 calories. In second trimester, it can go up to 400. Whereas during lactation, you should go from 600 plus 520 calories. 600 to plus 520 calories, like based on the time, like for example initial 6 months, then later on. Okay, remember. Then about the infants, for first 6 months you should feed at least 550 calories. Fine. And 670 calories for 6 to 12 months. For 550 for first are infants till 6 months, whereas for 670 for 6 to 2 months. 670 for 6 to 12 months. Just remember. Then about this RDA. In this, remember, this man will be having this around 20, like 20, 30, 40. So see, this man will be having around 19. So the ideal requirement in man, it is what? It is 20. Whereas woman, usually it is around 30, it is 29. So in pregnancy, it is bit more. So it is what? It is 40. Okay, it is pregnancy, it is 40, and in lactation, it is less. It is 24. It is 23 or 24. Next, around folic acid. For man, it is 300. For woman, it is 220. Whereas in pregnancy, it is more. It is 570. So that's why we'll give supplementation of folic acid during the pregnancy. Okay, that we'll see how much we'll give based on the age. We'll see in the anemia mukta bharat. Fine. Whereas during lactation, we'll give 330. Okay, 330. And rest of these conditions, will use same calcium, whereas for old age patients and on lactation will give 1200 mg per day. Fine. Next, about vitamin A. For man it is 8000, woman it is 840, pregnancy it is 900, and lactation will give more, that is 950. And the questions are being asked from the iodine part. Okay, the normal male and female it is 150, whereas during pregnancy it is 250, whereas during lactation it is 280. During lactation, the only or the main which is increased is, we know obviously calcium will be given more, whereas iodine also will be given more, which is 280 during the lactations of the child. Fine. Then we'll move on to this adulteration. Fine. We'll move on to this adulteration. During this adulterance, if you see, this adulterance, first one, it is the neuroletharism. It is what? It is this neuroletharism. This neuroletharism will be because of this flower. What is the name of this flower or this plant? It is what? It is this 𝗧𝗵𝗶𝗀𝗀. Okay, 𝗧𝗵𝗶𝗀𝗀. Yeah, which is having an adulterant component of this 𝗓𝗃𝗃. Okay, this is the plant name of the plant they will ask you. It is what? It is the 𝗧𝗵𝗶𝗀𝗃, and this will cause this neuroletharism. And in neuroletharism, they will hold this stick. They will hold this stick. So it will be staged as stick stages. Okay, and they will be having this toxin which is known as 𝗵𝗵𝗿𝗆 toxin, which is known as beta-oxalyl-aminoalanine. Beta-oxalyl-aminoalanine, which will be causing this neuroletharism. Okay, and it is due to because of adulterated 𝗓𝗃𝗃. Fine. And next, how will you remove this? You can remove by adding this ascorbic acid, which is the vitamin C, or also by steeping and paraboiling it. Fine. Yeah, good. To treat, will use this vitamin C. Next one, it is this endemic ascites. Endemic ascites, it is due to this pyrolysin derivatives of these plants. Okay, of these plants, and it is actually what it is, this adulterated millets, and it can be removed by sieving. It will be removed by sieving. No, see, endemic ascites, it is the pyrolysin. Okay, pyrolysin. Okay, it is the millet spot. Whereas next we'll see there is epidermic drops. Remember, drops. What will drop? Water and oil will drop. ठीक है, water and oil. ठीक है ना, तुम्हें पता ना कि oil, ठीक है, water means पानी भी नीचे गिरेगा, तेल भी नीचे गिरेगा. So see, it is epidemic 𝗵𝗃𝗃. It will be what? Water and also will fall, and oil also will drop. So see sanguinarine. Okay, narine. Okay, sanguinarine is what it is, looking like water, like other name of waters, right? Sanguinarine. Okay, narine. So remember, it is the water component. So water also will fall. So the toxin here, it is sanguinarine. Then it is adulterated in the case of with mustard oil. So mustard oil की जहाँ पे ये adulterated हो जाता है. Okay, so it is what? It is adulterated mustard oil. So हम कैसे करेंगे? इसको हम निकालेंगे. And this is the plant, okay, which is causing this epidemic dropsy. Can anyone tell me what is the name of this plant which causes this sanguinarine toxicity? This is being adulterated with this mustard oil. Yeah, guys. Yeah, good, Dr. Shanavas Khan. It is what? It is this 𝗓𝗵𝗀𝗀 mexicana. Yeah, no, it is not yellow oleander. It is not yellow oleander. So yeah, good Dr. Anchi, good Dr. Rahul Singh. Yellow oleander हमने देखा था. It is what? It is cardiac poison. Whereas here it is not like yellow oleander. You see here this stones like this there. It is what? It is this 𝗓𝗵𝗻 mexicana. It is the 𝗓𝗵𝗻 mexicana. Good, Dr. Anirudh. It is this 𝗓𝗵𝗻 mexicana. Next, you see this groundnuts which are being affected by this fungus. Groundnuts which are being affected by this fungus. It is what? It is this Aspergillus fungus. Aspergillus fungus, especially this Aspergillus flavus, which is causing this aspergillosis. And here it will be causing this aflatoxicosis by this aflatoxin. And this aflatoxicosis can be related to a tumor or a carcinoma. Which of the following cancer will be caused by this aflatoxin? Yeah, guys, tell me, which of the following tumor will be caused by this consuming of this adulterated nuts, or this nuts with this aspergillus toxin or aflatoxin? Yeah, it is the hepatocellular carcinoma. And mostly, if this nuts which are being not dried properly, this will lead to this aspergillus formation. Okay, so what we need to do? we need to reduce the humidity and we need to improve the ventilation. हमने पता है जैसे where there is improved ventilation, this ventilation carry out this moistures. ठीक है, इतना याद रखो. Next, this ergots. It's mostly seen in a case of this rice, sorghum and bajra plants. There, this ergots will grow. Okay, where this ergots will grow like this. So it is what it is, this ergotism. And this ergotism, how will you differentiate? Usually this will sink, whereas this ergots, they will float in a, they will float. ठीक है, वो तैरेगा means like, ठीक है, so they will float in this 20% saturated solution. Okay, it will be 20% saturated solution में it will be floating. Fine, just remember ergotism. Next about this vectors. Okay, next about this vectors. Fine, we'll do this vectors. Okay, and one more thing, then we'll wind up. Okay, we'll have a break. Fine. கண்டிப்பாக தமிழில் சொல்லலாம், மீன்ஸ் தமிழில் சொல்கிறதுக்கு எனக்கு எந்த பிரச்சனையுமே கிடையாது. பட் என்னது அப்படின்னா உங்களுக்கு எந்த விஷயம் வேணும் அது மட்டும் தான். Means whatever things you need, you can ask me. I will help you out in the language barrier. Language is not a big barrier. So I'll try out in English and Hindi. And if you need any other things, I can help you out. But teaching in a specific language, தமிழில் மட்டும் பேசணும் அப்படின்னா எல்லாருமே பார்க்கணும் இல்லைங்களா, எல்லாருமே FMG பாஸ் பண்ணணும். ஸோ அந்த ஒரே ஒரு நோக்கத்துக்கு மட்டும் தான். ஸோ ஜஸ்ட் தட் இஸ் த ஒன்லி motive. I need every and each and nook and corner of the country to be watching this, who are watching, it should be helpful for them. உங்களுக்கு ஏதாவது டவுட்டா நீங்கள் கேளுங்க, நான் சொல்கிறேன். If you have any doubts, you can ask me in your language and I can help you out. Okay, don't worry. Okay, that is a good Hmm. Hello, doctors. Hello, doctors. Welcome to the game changer session. I guess I'm audible and visible. Is it all clear from my end? Can you please confirm back? Yeah. Hi, Dr. Rituraj. Hi, Gautam. I guess you had a good dinner. Yeah, good, good. Dr. Nida. Yeah, good. Yeah, hi, Dr. Parul. Yeah, fine, fine then. Yeah, I guess then things are fine. Then we'll move ahead with the session. Like I told, like we'll complete it for first PSM, then we'll move on to the ophthalmology part. So exactly maximum will complete by 4:30 to 4:45. That is our expected time to be completed. Okay. So if you have any doubts, is it fine? Is the sound? Is there any? Hmm? The sound is good now. What is the problem? Is the sound is good now? Is it? Check, Hello, check. Hello, hello. Problem है उनको बोलो. Just give me a second. Yeah. Welcome back, guys. Can you please confirm it whether the sound is clear or not? Right. Just a second. The same is yeah. Okay. Yeah. We are checking it. Take a listen. Hello guys, welcome back. Is it all fine now or is it still the same? Right. I guess still the same. No, just yeah. Hello, is the still the crackling sound is there, right? एक मिनट इधर आ जाओ. Just sorry. There is a problem. Glitch. Okay, fine. Shall I start? Okay, fine. I will start. We'll check in the way if there is any problem or if it persists. There is a problem. Hello, check. Guys, is it visible or is it audible? Like there will be for first few minutes there will be this small glitches there. Let's just go with it, and if any changes, the technical team is working behind it. Okay, I guess it is better than this. Hello, welcome back, doctors. Is it fine now? Can you confirm it? Welcome back, doctors. Is it fine now? Yeah. I guess it is audible and it is, we have done our best to restore it. Fine, right? I guess someone needed a big break. That's why it happened like this. Yeah. It means I got confirmation from Dr. Nida, Dr. Dinesh and Dr. Aishi. Yeah. Well, yeah, fine. Well said. Fine. But this will move on to a PSM part. And as I told you, we'll complete around 4:30 to 4:40. That's our final call and we'll fill it up. Fine. Yeah, okay. Thank you for your confirmation, Dr. Aishi, Parul, Dinesh and Dr. Nida and Dr. Trisha. And there is TMA. Yeah, sure. Fine. We'll start it. The first we'll start it is the vectors. If you see about these vectors, the vectors we need to know they are these mosquitoes, fleas, larvae and ticks. And if you see about them, first we'll see about these mosquitoes. If you see this mosquito, which is this Anopheles mosquito. Anopheles, you cannot tell it is as just Anopheles. It is what? It is female Anopheles mosquito. It is what? It is the female Anopheles mosquito which is responsible for malaria. And we know females, they are what? They are angels. They are what? They are the angels. So remember, they are these angels, we know, as they are angels, and this is not small and simple angels. They are the sophisticated angels. Since they are these sophisticated angels, they will be having these wings. The angels will be having the wings, and these sophisticated angels will be having the special dots in their wings. That's why this Anopheles mosquito will be having a wings along with black spots on its wings. Okay, black spots on its wings. Okay, and it sits at an angle of 45 degrees. Okay, and we know the most of the girls, they will be clean in nature, and they will be always, or most of the time, if you ask whether you are single or committed, most of the time their answer will be they are single. So they will lay their eggs in a single forms, and they are angels which are having this special dots in them. Okay, and they are very sophisticated, and they cause what? And they will cause malaria. They will cause malaria, remember. So it is the female Anopheles mosquito which is responsible for this malaria, and they will set it on degree of 45 degree. Fine. Then next we'll come to the 𝗡𝗧𝗧𝗃. If you see about this 𝗡𝗧𝗃, the 𝗡𝗧𝗃 is also known as nuisance mosquito. Why it is known as nuisance mosquito? Because if you see, you know this hip hop singers, right? The rappers are hip hop singers are these rappers. Okay, if you see them, they will make the nuisance, like how in the way, like it won't be like a song, it will be a crowded people making a noise, and they will ask you why, what, like in Hindi they will ask kyun kyun kyun. So, and they won't sit like this straight, they will always having this thing and they will ask. So see and remember that they will be sitting like this. So remember this 𝗡𝗧𝗃 as they will ask Q. Okay, so remember it as 𝗡𝗧𝗃, and they won't be sitting straight, they will be having these hunchbacks. So it is known as hunchback appearance. Fine. And we know this usual singers, they will come single and sing, whereas this rappers and this hip hop singers, they usually come in yeah, it is kyun kyun kyun, and they will come in clusters or in groups. Okay, and they are noisome. For some people it is like a nuisance. So remember, they come in clusters, or they lay eggs in clusters, and they will ask you kyun kyun. That's why they are the 𝗡𝗧𝗃, and they will be dirty most of the times. Remember, they will be dirty most of the times, and they will be sitting like this, and they will asking you. That's why they will be having this hunchback appearance. They will be having this hunchback appearance, and the disease which are being spread by the 𝗡𝗧𝗃, which include this lymphatic filariasis and Japanese encephalitis. Lymphatic filariasis and Japanese encephalitis. Fine. And next mosquito, it is this Aedes mosquito, also known as tiger mosquito. Okay, tiger is a vegetarian or a non-vegetarian, guys? Is tiger is a vegetarian or non-vegetarian? Batao. The tiger, it is a non-vegetarian. So remember, to see this, to remember this mnemonics, or this, to remember the disease which are being caused by the Aedes, remember it as dry chickens. Dry chickens. Okay, it is a non-veg. Yeah, good. It is a chicken. So remember, it is the disease which is being caused by this Aedes mosquito includes dengue fever, Rift Valley fever, dengue fever, Rift Valley fever, yellow fever, chikungunya, and Zika virus. Chikungunya and Zika virus. D for dengue, R for Rift Valley fever, Y for yellow fever, then chikungunya and Zika virus disease. So all of this following will be spread by this Aedes mosquito, which is known as tiger's mosquito. Okay, tiger's mosquito, and it will be having this tabs. This will be having this stripes, like white and black stripes. It will be having this white and black stripes. And next one, it is what? It is this Mansonia. This Mansonia mosquito, it has a peculiar feature. It will lay their eggs in this Mansonia plants, which is actually what? Which is an aquatic plants. This Mansonia plants. So they given this name as Mansonia itself. And they will be having this long legs. They will be having this long legs when compared to the other mosquitoes. And they also lay eggs in clusters, but they lay eggs in star-shaped clusters. Yeah, they will lay eggs in star-shaped clusters, and it is responsible for causing this lymphatic filariasis. So lymphatic filariasis will be transmitted by two mosquitoes. One is this Mansonia. Next one is the Culex. Okay, remember. And next about this few more vectors. If you see, if you are able to see this head, if head is present, then it is what? Yeah, then it is what? Then it is the hard tick. Whereas if head is absent, then it is the soft tick. Okay, if head is absent, it is the soft tick. Where if head is present, it is what? It is the hard tick. Then you need to remember the disease which are being spread by this hard tick and soft tick. Okay, so remember this. First, remembering this disease which are being spread by this soft tick, remember as QRS. Okay, QRS. So soft tick will transmit this Q fever and relapsing fever. Q fever and relapsing fever will be transmitted by this soft tick. Next, this hard tick, all of this hard tick will be having this tick in their name. Remember, Indian tick typhus, tick encephalitis, and tick hemorrhagic fever. Okay, tick hemorrhagic fever, and some other diseases with their tick, like tularemia. Yeah, tularemia, and one more important disease. It is what? It is this 𝗏𝗏 forest disease. It is the 𝗏𝗏 forest diseases. It is the 𝗏𝗏 forest disease. Fine. And next, it is our favorite friend, which is actually our pet. Remember, it is our pet. Who is our pet? Like our lice. It is our pet because it is with us, right? We have a dog, cat, and one more pet, which is this louse. Fine. So remember them as PERT. Okay, remember. So this louse include this PERT. Pediculosis, epidemic typhus. It is epidemic. Okay, remember it as LEP. It is the epidemic typhus and relapsing fever and trench fever. So these are the four diseases which are being spread by this louse. Yeah, good guys. Then if you see this next bug, it is what? It is this kissing bug which causes this disease, which is known as Chagas disease. Redweed bug, also kissing bug, which causes this Chagas disease. Can anyone tell me what is the name of the disease which call them as Kissing's disease? Kissing's disease? Yeah, guys. It is which disease? It is what? It is the infectious mononucleosis. It is the infectious mononucleosis. Yeah, by this ABV, we'll call them as Kissing's disease. Okay, Kissing's disease. Yeah, good. Dr. Naresh, Mohammed Shanvas Khan, 𝗏𝗏𝗀𝗀𝗀𝗀, and Nida. Yeah, good. Well played. Well. Nice. Next we see this fly. Okay, this is what? This is sand fly. Okay, sand fly. Okay, this sand fly actually having the wings, but it won't usually fly. Because there will be this attachment. There will be this attachment of the small hairy projections into their wings. So because of this, it won't fly. It will just hop. So remember, the sandfly will just hop. And the disease which is being spread by the sandfly include Kala-Azar, oriental sore, and this Oraya fever. Yeah, and we know for this Kala-Azar we use antigen which is known as RK39 antigen. RK39 antigen. Just remember. Yeah, good guys. Good Dr. Gautam. Good quinine. Yeah, good everyone. Then if you see this organism, this is what? This is this rat flea, also known as 𝗏𝗵𝗶𝗀, which is responsible for this plague. Remember this flea, pen and lip. So flea will causes endemic typhus. Whereas louse will cause this epidemic typhus. Okay, yeah, good guys, good. Yeah, there are different types of plague is there. Yeah. Fine, and these are the vectors you need to remember of. Okay, just have a go through this ones, and you will be remembering this for lifetime. Fine. Next, about these pillars of this primary health. So if you see, there are few principles of this principles and pillars. First we'll see about these principles. If we see about these principles, the principles include equitable distribution, okay, equitable distribution and community participation and intersectoral coordination. Like for example, you are working in a PHC, it should be helped by this police station and by this municipal corporation. So all of these things will do this intersectoral coordination and using this appropriate technology where it is needed. For example, using this apparatus and using these methods for demonstration. So these are these 4 principles of primary healthcare. 4 principles of primary healthcare. Fine. And we'll come to the numerical part where how much is the requirement for a PHC subcenter and rest more. If you see from the subcenter wise, the subcenter it is 1 per 5,000 in plains, whereas in hilly areas or tribal areas it is 1 per 3,000 population. Fine. And mostly whoever will be there in subcenter, they are this health workers include this multi-purpose worker male and multi-purpose worker female. Okay. And usually there is number of beds which includes 0 to 3. Means 0 to 3 in the sense was, if it is A means which is where there is just to monitoring or just to rest, will have 0 or 1 bed. Whereas in type B, it is the better one. It is the better one which has this delivery option, which will be having the bed. So if you are allowing delivery in subcenter, there will be a bed should be available. So it is type B which is having this beds. Fine. And next about this PHC, if you see about this primary health center. So after subcenter, it is the primary health center. Where actually the medical officer works. So in PHC, the medical officer will be. He won't be in subcenter. Fine. So it will be in usually in urban PHC, UPHC, it will be in for 5,000 population. Whereas in plains it is for 30,000. Whereas in hilly areas it is for every 20,000 population. And there will be this medical officer, health assistant, A&M, pharmacist, and a lab technician as well. Fine. Here it is also based on this number of deliveries only. A, there will be a less number of deliveries. B, there will be more number of deliveries. That way there is more number of beds in a case of type B type of PHCs. Fine. In the case of CHC, for the CHC, yeah, good Dr. Shanavas, yeah, good. In the case of CHC, if you see, it is 5 lakh per CHC for metro cities, whereas 2.5 lakh for non-metro cities. For plains, it is 1,20,000, and in hilly areas, it is 80,000. Fine. And there will be the specialized doctors, OTs, technicians, and lab technicians will be there. So the beds will be in rurally it will be from 30 to 50, whereas in urban it is 50 to 100. Fine. And in district hospital it will be mostly now it is per district, and they converted them into this medical colleges as well. Fine. There should be this specialized doctors or super specialized doctors along with this blood banks. Fine. And the minimum it is 100, where it is recommended it is what? It is 1 per 1,000. Okay. Just remember. And medical colleges, there is no any population norms that after this many it should be medical college. But now most of these CHCs are this district hospitals. Like after the district hospitals, they has been promoted to this medical colleges. Just remember that's only. Fine. Now this will move on to this international part. Do you have any doubts, guys, till now? If you see that, no, okay, fine, good, okay, good, Dr. Shanavas, good, Dr. Nash, fine. If you see the first one, it is this World Health Organization, yeah, school health checkup, we'll see, we'll see. Yeah, the rules also we have, we'll show you, we'll tell you, don't worry. Fine. We'll see about this logos. This is the WHO logo, and the headquarters of this WHO, it is located at Geneva. Fine, it is located at Geneva. And next it is this United Nations International Children's Emergency Fund, and the head office it is at the New York. And it runs a campaign which is known as 𝗵𝗵𝗶𝘀 campaign. And it is very important one, I will tell you. Then it runs one more thing which is known as baby friendly hospitals. Okay, or baby friendly hospitals initiatives. Fine. Then this Danida. It is a Danish one, but it is in India, it helps in this blindness control program. Whereas SIDA, the Swedish one, it helps in the TB. The Swedish one, it will help in the TB part of India. Fine. As I told you, this 𝗵𝗵𝗶𝘀, it is under this UNICEF. And this includes the 𝗵𝗵, growth monitoring of the child, providing ORS to them and breastfeeding them and immunizing them, and also for two things which is necessary. What are they? They are this female education and family planning. So remember this, you will often get confusion with this F things like female education, family planning and food supplementation. So female education, family planning and food supplementations. These are the three things which stands for this triple F. Okay. Whereas G for growth monitoring, O for ORS, B for breastfeeding and I for immunization. Yeah. Good guys. That's you should remember of. Next about the type of vaccines. And this thing. If you see, this is known as ILR. This ice-slide refrigerators, they are kept at the level of subcenter. Is it true? Is they kept under or kept at subcenter level? Yeah guys, answer this comment section. No, they are not kept at the level of subcenter. They are kept at the level of PHC. Yeah, good Dr. Quinin, good Dr. Nida, good Dr. Shanvas and Rohan. Yeah, good Dr. Rajat. Yeah, so they are kept at the level of PHC. And if you see them, there is a sequence we should keep. For example, initially we on the top of it, this will be having this less temperature. There we need to place this freeze sensitive vaccines. This freeze sensitive vaccines, fine. Whereas this hepatitis B, pentavalent and IPV, okay, it should be the order. So pentavalent and hepatitis B, they are much freeze sensitive. So we need to put them in upper lines, followed by this DPT, and in middle it should be TT. Okay, the TT should be in the middle of this freeze sensitive and heat sensitive vaccines. And the heat sensitive one, the most one, it is this OPV, and we need to keep measles, then Japanese encephalitis and BCG, then finally the rota. So OPV, measles, JE, BCG and rotavirus. This is the sequence. That's how we need to keep, or how we need to line in this ice line refrigerator. Okay, so this is based on this freeze sensitivity and heat sensitive. Fine. So how will you find like whether this vaccine is freeze or frozen or not, or undergo much degree of frozen or not? What is the name of the test you will use? Yeah guys? Yeah, we'll use a test which is known as shake test to know this freeze sensitivity, or this whether the vaccine has been frozen or not. Frozen, like we'll use this shake test. Yeah, good Dr. Hone, we'll use this shake test. Fine. And we have this few vaccines. They are this live vaccines, culled vaccines. This live vaccines include our BCG, varicella, MMR vaccine. Yeah, good Dr. Shanvas Quinin. Yeah, good. Then influenza, then rotavirus, JE, polio and typhoral vaccine. Okay, all of the vaccines, they are what? They are this live vaccines. Whereas killed vaccines include TD and Tdap, which also they having this proteinous subunit. Then killed influenza vaccine. Fine. And conjugate vaccines we usually develop from this capsules. Like for example, pneumo PCV and meningococcal vaccine. Okay, both of them will develop from this capsule of this organisms. Fine. So these are the types of vaccines that you should know of. Next, we'll move on to this one, which is this vaccine vial monitor. Okay, this is this vaccine vial monitor, and we know the outer, it is a circle. Outer circle which is darker in nature, whereas the inner square it will be lighter in nature. So we should always see outer circle या inner circle, inner square. इसको हमें पहले देखना है. Yeah guys, we need to see the inner square in respective to this outer circle. तो आप देखोगे तो inner square should be what? Inner should be lighter. It should be lighter. Yeah, the inner square should be lighter. Agar if it is lighter or if it is pure white, then we can use them because it is well maintained. Whereas if it is of same color or if it is darker, then we'll avoid it. Fine. And you found a vaccine. Okay, you found a vaccine which the vaccine color was like this. Okay, the vaccine was like this. Okay, but the vaccine has been expired. Will you use the vaccine now? Will you use the vaccine now? Because it is well maintained but just expired. Will you use the vaccine now? Yeah, good Dr. Shanavas, Naresh, Gautam, Rohan. Yeah, good. If it is expired vaccine with normal or stage 1 VVM, still we discard it. Okay, discard it. Fine. And if we want to use any vaccine which we opened, then we need to use them within a certain period of time. Okay, certain period of time, and it should be well maintained with the temperature. Okay, remember this thing. And whenever you open a vial like multi-purpose vial or multi-loading vial, like for example pentavalent vaccine, you should mention the date and the time of opening. Fine. Next, this policy is known as open vial policy, but this open vial policy will not followed for this measles, rubella and BCG vaccines. Once you open, it's broken, so you should use it. Fine. And there are few side effects following this administration of vaccinations. The side effects include paralysis in a case of OPV. The vials which don't follow this are include this previously 𝗵𝗵𝗶𝘀, BCG and COVID-19. Previously there was this variant of J was there, but now it has been replaced. Fine. And what are the adverse events? What are the side effects? If you see about this OPV, then it can lead to this paralysis. It can lead to the paralysis. Hepatitis B, it can lead to this anaphylactic shock. Pertussis can cause this persistent crying in the child, and hypoxic ischemic encephalopathy will be seen in a case of pertussis. Okay, pertussis will see this 𝗏𝗏 and toxic shock syndrome will be seen in a case of measles. And rotaviral vaccine will cause what? Rotaviral vaccine will cause intussusception as a complication. Intussusception as a complications. Whereas this influenza vaccine will cause Guillain-Barré syndrome as a complication or side effect. Then thrombocytopenia is caused by this MMR and hepatitis B. Then about this part, which is this delayed immunization. COVID-19, we need to use within 4 hours. That's good. That's correct. Then about this delayed immunization part, if you see, means if in a very rural part of India, okay, not in urban India, in very rural part of India, there are few people who will be living in the poverty, so that they won't carry their children for this regular vaccinations. Now, if they are bringing their child for first time, like after 1 year, like around 2 years, then you should not tell no, you shouldn't bring before, so we cannot vaccinate it. So there are few exceptions, or few vaccines can be given after certain ages. For example, like if it is BCG, then it can given up to 1 year. The same for Rota, pentavalent, IPV, fractional IPV, PCV, hepatitis B vaccine. So all of them, they can be given till 1 year of age. Whereas up to 5 years, the OPV, oral protein drops, MR vaccine and vitamin A drops, all of them can be given up to 5 years. All of them can be given up to 5 years. Whereas till 7 years, we can give DPT. In pregnant females, we can give this TD. Okay, TD. Okay, TD. Fine. Next, the JE vaccine can be given up to 15 years. Okay, these are this elapsed vaccination. Means in question they will describe. There is this 13-month-old child presents for immunization. Okay, which of the following vaccines he will give? Option A BCG, option B PCV, option C pentavalent, option D OPV. What will be your answer? Yeah, guys, what will be your answer? Yeah, what will be your answer? You will give the D. Yeah, good, Dr. Shanavas. It is what? It is this option D. Will give OPV. Will avoid all these things because it is 13 months, which is more than 1 year. Okay, yeah, good Dr. Rituraj, good Dr. Niresh, good Dr. Nida, good Dr. Srinath and Trisha Kaunan. Yeah, well played. Fine. Then we'll move on to our next part. Then about this part, which is known as health communication methods. In health communication methods, first is what? It is the focused group discussions. It is between the 6 to 12 members, and what they will do, from one person they will start with another person, and like this the talk will be keep on going on, and one person will be sitting and drawing like us. Okay, so drawing like this. So this is known as what? Sociogram. This is known as sociogram. Next, if you see, there are two things: panel discussion and symposium. Okay, in the case of panel discussions, like our TV panel, okay, there is no set speech, and anyone can interfere. Okay, that's what, there is no order. And no set speech. Whereas in symposium, there is a set speech and order will be followed. Yeah, TD will be given in pregnancy. Yeah, or we can also given as TDAP. Okay, yeah, that component as well. Order will be followed. That's it. Fine. Next about this method, like showing how to prepare the ORS. It is what? It is the demonstration. It is the demonstration. Okay. Next, we have few more health communication methods. For example, you want to tell about this cancer prognosis to the patients. Then you need to set up this protocol which is known as spikes protocol. You need to set up this based on this spikes protocol. Okay. Fine. Next, about this approach which is known as gather approach, also known as previously known as cafeteria approach, which is used for this contraceptive usage counseling, which is known as contraceptive usage counseling. Next, this funnel graph, like for example, you are going for a village where most of this non-literate people will be there, they won't be literate. So for them, to make them easily understandable, what you will do, you will make the pictures of this scenarios or pictures of these things, and you will arrange them in a sequential order in a cloth. So this is known as funnel graph. It is known as funnel graph. Yeah. Why there is, yeah, that's true. Yeah, spikes media, which is for Streptococcus pyogenes. Yeah, good correlations. Good. Then about the next thing, it is the Suraksha clinic. If you see about this Suraksha clinic, the mainly they will ask you is about the quit. The patient is presented with urethral discharge. If there is any presence of urethral discharge, cervical discharge, and anorectal discharge, will give the first kit. So remember, how will you remember this kit? Remember it as great girls wear blue, red, yellow bags. So you can remember by this mnemonic as what is the first sequence? It is the great. So remember, it is the gray color kit. It is the first kit. It is a great girls. So green, okay, wear for white, then blue, red. So next one is the blue, then red, then yellow, then black. So these are the sequential lineage of these kits. Okay, just remember how sequentially it is placed. And then remember, what is the discharge? First, UV. So the first one, it is this urethral discharge. So for urethral discharge, you will give gray color. Okay, for urethral discharge or anorectal discharge, you will give this A color, which is the gray color one, is the kit one. Then for vaginal discharge, you will use this green color kit. You will use this green color kit. Then for genito ulcer, okay, it is ulcer disease which is non-herpetic, means it is because of this bacteria and it's sensitive to penicillin, where you will use what? You will use this white kit. Whereas if the bacteria, if the organism is non-sensitive to penicillin, then we'll use blue color. If there is any herpetic ulcer, okay, herpetic ulcer, we'll use this red color kit. Okay, red color, yeah. Then about yellow, remember it is L-low, it is what? It is lower abdominal pain. So L for lower abdominal pain will you be using the yellow kit, and black for 𝗵𝗵𝗀. Okay, this is the 𝗵𝗵𝗀. Okay, black will use this inguinal 𝗵𝗵𝗀. In the case of inguinal 𝗵𝗵𝗀, will use this black kits. Okay, just remember, and this is the logo of Suraksha clinic, which is this reproductive tract infections or sexually transmitted infections clinics. Okay, remember. Next about the triage. You know, this triage is based on this likelihood of survival, and it done at the site of disaster. Okay, done at the site of disaster. So if you see red one, they are this highest priority ones. So they need this immediate resuscitations. If there is no immediate resuscitation, they will die. For example, in a case of pneumothorax, in a case of cardiac tamponade, they need this intervention within less than 6 hours. Okay, less than 6 hours. Next about yellow, they can wait. Okay, they can wait. Okay, they can delay it for few hours, and who need a surgery within 6 to 24 hours. Next about green, they are this low priority. Who are telling like, sir, 2 दिन से बुखार है, means 2 दिन से बुखार है बोल के, they will come for this emergency. When they ask, like, yeah, literally the patients will come like this. Like it will be around 6 o'clock where your OPD will be closing, and you will be sitting your casualty, putting the cannulas and things, and there will be like around this young males or young females, they will be coming at around 6 o'clock, and they will ask you, they will tell you, क्या हुआ? पूछोगे, means you will ask what happened. You will tell, sir, 2 दिन से बुखार है. Okay, so they will tell they have this fever, but they could have come to the OPD for a proper evaluations. But this type of ambulatory cases will come to this green thing. Okay, so this minor injury, small crashes, small aberrations, it will come under this green one. Okay, then about this black one, that is this least priority are the dead or moribund patients. Okay, who is in this coma, who is dead, who is brain dead, they are classified as the black one. So remember, this triage will not have 3 colors. The name is triage, means to segregate. It will have 4 colors. Remember, it will have how many colors? It will have 4 colors. It will have 4 colors. Good. Fine. Next, we'll see about this biomedical waste management. Biomedical waste. Yeah. Yeah. Good, Dr. 𝗏𝗏𝗀𝗀, good, Dr. Ansh. Fine. Good. Then about this yellow, remember. Here, remember, these are this body secretions. Body secretions are in contact. Yeah. In context. Remember, if you know Hindi, you just remember it is patti, plaster will be in pila. Okay. Okay. Patti, plaster, and pila means if there is any soaked gauze pieces, if there is anything which is exposed to your body fluids, it should be thrown on into this pila, which is yellow. Okay. Whatever the plaster it is, whatever the patti you have used it. Fine. So this cotton waste, this dressing materials, this body fluid and contaminated paper and cloth with it, and your face mask. Remember your face masks and your cloth and all of your cytotoxic drugs and the microbiological waste, all of them, they should be thrown into this yellow color bag. Whereas for this red, remember red for this recyclable one. Red, rubber and lal mein nahi hoga. Yeah, don't worry. Yeah, red, rubber and recyclable. Remember. So here, what we'll use? We'll put mostly this rubber and recyclable plastics, which includes this IV set, catheters, gloves, even gloves with pinch of blood. We'll put in the red only. Okay. They will ask you where you will place this blood bag. Your answer should be what? Your answer should be yellow. They will ask you once more where you will place this empty blood bag. What will be answered now? It should be yellow still. Okay, if the blood bag is empty or full, it will be what? It will be always discarded in the yellow. Fine, it will be always discarded in the yellow. That's why I asked you. Okay, if the blood bag is empty or full, there is no matter. It should be always discarded in this yellow bin. Fine. Whereas a red one, if it is new, plus like new gloves also, or if it is soiled gloves, then also it will be put into this red one. Okay, and all this IV set, catheters, okay, urine analysis kit, urine bag, IV bottles, plastics and goggles, all of them should be thrown into this red one. Fine. फिर उसके बाद white. If you see on the road, who will be wearing this white, right? Like who will be wearing this white shirt? They will be having this very brightness, very sharp. Okay, you can find them wherever they go. So likewise, remember this white, it will be for sharp. Okay, sharps for this white. For example, your scalpels, your blades, and your syringes with fixed needles and the rest of the needles. All of them should be thrown into the white. And remember, rest we can use bags. Whereas in a case of white, we need to use this cardboard boxes because it should be puncture proof to prevent this injury from the shops. Okay, it should be puncture proof. Fine. And next about blue. Remember blue for broken glass. Broken glass. So blue should be used for this glass and metallic implants. Glass and metallic implants. Okay. Yeah, good. It is used for this glass and metallic implants. Okay. The blue one. Then this is how you will remember. So patti, pila, plaster, you will put in pila, means yellow, means whatever the contaminated with body fluids like blood and other like secretions from the wounds, it should be thrown into yellow. Whereas red one, recyclable plastics, your urinary catheter, your IV sets, your bottles, it should be thrown into red. Whereas white for your sharp needles and scalpels, it should be thrown into white. Whereas for blue, it should be the broken glass and this metallic implants. All of them, they should be thrown into blue dustbin. Fine. Yeah, good guys. Then about how will you treat them before disposing? If you see about the yellow, these are the most of these anatomical waste. For them, what we'll do to prevent infection or spreading of the infections, we'll do incineration. Incineration, if there is any anatomical waste like our placenta, our amputated limbs. Whereas in a case of microbial and chemical waste like our radiological developmental films, will do deep burial. Okay. Then about this red one, we'll do autoclaving and microwaving, followed by this with shred and we'll recycle and use it. And blue, what we'll do, we'll do same autoclaving and microwaving. Then after that, we'll shred them and we'll use in construction of roads. Fine. And white, you need to landfill them or we need to put it in shopping. Okay, mostly this is the thing which we use for this biomedical waste and how will be managed. A good Dr. prototype and 𝗏𝗏𝗏𝗏 and 𝗏𝗏𝗏𝗏. Fine. Next we'll move on to this graph. Fine. About this graphs, if you see, you want to know how will you differentiate this histogram from this bar diagram? Fine. Without broken, like if it is telling where you will discard this vaccine vials, which is expert, then you should discard in the yellow one. Okay, if it is just any vials they are the broken glass, they will be given in the blue one. Fine. The first one, if you see, if it is touching together, like a H, so draw this H. If it is touching together, it is what? It is the histogram. Yeah, we are continuing. It is the histogram. Fine. Next, about, you saw this histogram, and in histogram you see on center you draw some points and you are connecting them, so it is what? It is known as frequency polygon. So you have this histogram in the back and you have this connecting dot, so it is what? It is this frequency polygon. And next, the same thing, you draw a curve in the center of behind this or in front of this histogram, so it is what? It is this frequency curve. It is the frequency curve. And next, if you see this, like kind of bars, but it is not this quantitative variables, or it is not in the frequencies, so it is what? It is this bar diagram, which is having this discrete variables. Okay, this is the bar diagram. And there are different types of bar diagram. If it is having same bar diagram which is in two colors, it is the component bar diagram. And if it is two things together, like three things together or two things together, we'll call them as multiple bar diagram. Okay, and next, to know this trend of these events, we'll use this, or trend of this disease, we'll use this thing which is known as line diagram. Okay, based on the trend it will change. Okay, based on the trend it will change, like this trend can go up and even go down, so that is the catch point. So this is in line diagram, this will go down, whereas give, remember, it is give. अगर आप किसी को देते हो तो प्यार बढ़ते रहता है. So remember, if you start giving love to someone, then your love towards them, or this love towards your subject, will keep on increasing. ठीक है, जैसे आप पढ़ते रहते हो तो उसका means then you will get more urge to read, right? The same thing in the case of give, it is the cumulative. See, remember, it is 20 plus 40. So 20 plus 40, it will remain as 60. It won't come down to again 20. So then if there is 60 plus 2, it is 62. Then 60 plus more 3, it is 65. It won't come to 20 or 40. So in the case of give, it won't be any negative value. So it is the cumulative frequency diagram. So if it is not coming down, it is the give. If it is having the dip, it is what? It is this line diagram, which is showing the trends of events. Fine. And next, about this scatter diagram. This scatter diagram will show like what is the relations. Is there any relation, like positive correlation, negative correlation, and no relation? Okay, this is what? This is the scatter diagram. Next, you will see kind of pi. Okay, kind of pi, you have this 100%, and each of them, they will have this individual specific values, and there is no overlapping. So it is what? It is this pie chart. It is the pie chart. Fine. And next one, it is this stem and leaf plot. You want to separate them, so based on the stem and the leaf. So it is this stem and leaf plot. Okay, then about this plot, which is known as what? Then about this, pi is easy to identify, right? It is very easy. Okay, then it is what? This is the funnel plot, like funnel they are drawing, right? It is known as funnel plot. Okay, it is known as funnel plot. And next, if you see, this is a box and whisker. This is the box and this is the two whisker. So it is known as box and whisker plot. Fine. And next, this is for this systemic analysis and meta-analysis. We'll use this type of plot, which is known as forest plot. So remember, it is the forest plot and rest of the plots. For example, histogram, remember. Then if it is drawing lines, it is the frequency polygon. If we are drawing a curve, it is this frequency curve followed by this bar diagram. And in line diagram, we know it will be having this dip, whereas give. Okay, if you started giving, you won't be having any fall. You will be in heights in your life. So that is this give. It is a cumulative frequency diagram. And next is this scatter diagram, and this is the pie chart, and this is how this sequential segregation, which is the stem and leaf plot, and this is how this funnel plot looks like. And finally, this is the box and whisker plot, and this one, this is the what? This is this forest plot, which is used in the case of meta-analysis. Okay, so these are the things you should know from this images. Fine. With this understanding, we'll move on to the next part. Good, Dr. Naresh Nida, Dr. Dr.G, Mohammed Shanwas Khan, and Mohammed Anush. Good, well said. Fine. Next, we'll move on to this standard deviation. If you see about this standard deviation, the normal standard deviation curve, it will be this normal distribution curve, it will be this bell-shaped curve. It will be this bell-shaped curve. It is this bell-shaped curve. And once you see this bell-shaped curve, you will be able to see this type of standard deviations. There will be few standard deviations. If it is line at the center, if it is a line at the center which is having a symmetrical distribution, then the mean, median and mode, all of them, it will be what? It will be equal. Whereas if you see from the mean, if you take around this one standard deviation, so how much amount of variables or how much percentage of these things lies in? Okay, it is what it is. This 68% of these things will lie within this one standard deviation. Whereas within two standard deviation, it is 95%. Whereas within three, it is 99%, whereas for 100% it is at the level of infinity. So remember, it is not 4 will see 100%, at infinity only will see the 100%. So always this gap will be maintained. Okay, remember, it is the gap will be maintained. Okay, fine. So 1 it is 65%, 2 95, 3 99%. Fine. And they will ask you this about this positive skew and negative skew. In the case of positive skew, which is the which will be having the maximum value. So first you remember the middle unit, right? What unit, right, is the median. Mean, median, mode. Mean, median, mode. So see, this negative skew, also known as, this is skewing on the left side, so also known as left skew. Always on the, always look into the tail. This is the tail. So always look into the tail. So this is the left side. So this is the left skew. So remember, how will you, what is the main value or the chief value in the left skew? So make this L and convert it like this. So if you see, if you draw like this, so here the maximum value kya hai? It is the mode. It is the mode. Okay, so I told you mean, median, mode. So here the maximum value will be the mode part. Fine. Whereas here it will be what? It will be on this opposite side. Here the maximum value will be for this mean. So here the maximum value will be for this mean. So itna yaad rakho. Next we'll move on to this few programs. Fine. If you see about this national TB elimination program, we will see few programs. One of them is NTEB. This what it is, this national TB elimination program. Okay, so it is what it is, this logo which is TB Mukt Bharat, TB Harega or Desh Jitega. Okay, this is the logo of it. And in this you need to know our aim of this NTEP, it is what it is, reducing the incidence of this TB by 80% and reducing the mortality by 90%. Then for diagnosing of this TB, we'll use multiple tests. So the initial modality of diagnosis kya? Like initially it is clinical along with the sputum smear and chest X-ray. Sputum smear or करेंगे और chest X-ray करेंगे along with this clinical history. फिर उसके बाद करेंगे कि culture. Then once we make a diagnosis of TB nowadays, then what we'll do? We'll do CBNAT. क्यों CBNAT करेंगे? We'll able to see or we'll able to confirm the diagnosis. Along with this, we know that we can detect this 𝗵𝗵𝗶 resistance. ये कौन सा 𝗵𝗵𝗶 resistance करेगा? Which resistance we can find? We can find about this, 𝗵𝗵𝗶 resistance. And we know the culturing of these organisms will culture in the case of LJ media. It will take more time. So we have new generations of media which is known as Bactec media, but in which the time will be more. So initially what we'll do this CBNAT and we'll tell whether the bacteria is present or not. Then we'll go for this resistant testing and it will tell. Then about this culture, we'll use this LJ media and this automated liquid culture like Bactec medias. Fine. And about this molecular analysis, we'll use this CBNAT, which is a PCR, and then we'll use this line probe assay for this resistant testing of other drugs. Okay, resistant testing of these other drugs. And we have this ICT enabled online service system, which is known as 𝗡𝗚𝗁𝗃𝗃. It is 𝗃𝗃𝗃𝗃. Okay, it is the 𝗃𝗃𝗃. It is the 𝗃𝗃𝗃𝗃. Okay, it is the 𝗃𝗃𝗃. It is the 𝗃𝗃𝗃. Whereas remember, it is 𝗃𝗃𝗃. What is 𝗃𝗃𝗃? Yeah, like in India, if you ask me, the first one you need to tell it is CBNAT, because we call in India we'll use only one thing which is known as CBNAT. Okay, we won't usually use a TrueNAT. Okay, remember, because in NTP portal itself or in forms itself it will be written as CBNAT only. Okay, so don't confuse it. So 𝗃𝗃𝗃, remember it is 𝗃𝗃𝗃, it is the free UPT kits. Yeah, good Dr. Rajat, good Dr. Quanin, Evangeline, yeah, good Dr. Ritraj. So it is what it is, this free UPT kits. Fine. Next, this logo is asked in the recent 𝗵𝗵𝗀 examination. Okay, so this is what, this is the lotus, this is the lotus and the hand holding it. So it is the leprosy program, National Leprosy Elimination Program. Fine. And don't confuse this 𝗚𝗔𝗁 with 99 dots. So 99 dots we used to use previously, but now the main, like if they ask you online portal for this TB, it is what it is, 𝗚𝗔𝗁. You should remember only 𝗚𝗔𝗁. Okay, fine. Next, about this leprosy, we are using the drugs. Like now the government or this WHO recommends to use this 3-drug regimen or this uniform drug regimen, which includes dapsone, rifampicin and clofazimine. Whereas we have two types of leprosy. One is known as paucibacillary and multibacillary. Paucibacillary will use drugs like dapsone and rifampicin. Here will use clofazimine, and it is given for 6 months and it is given for 12 months. Okay, and it is given for 6 months and it is given for 12 months. Okay, just remember. And this classification is based on the skin lesions and the nerve involvement. The skin lesion should be 1 to 5, and if it is one or more, one lesion will consider as paucibacillary only. If it is more than one, will consider it as multibacillary leprosy. ठीक है, बस इतना आपको याद रखना चाहिए. So multibacillary हमें 6 महीने तक, paucibacillary we need to give for 6 months, whereas multibacillary we need to give for 12 months. Okay, then we'll move on for this National Program for Control of Blindness. As I told you, this blindness program, the most common cause of blindness in elderly care, it is the cataract. It is the cataract. Fine. And previously WHO used to tell, like, it is the blindness which is less than 3/60 in the better eye with better possible or this best possible correction. Okay, this is less than 3/60. Fine. And for this vision, we run this school vision program where we analyze this vision in this children's as well. Okay, usually we go 2 times. For every 6 months, we do this vision analysis, and mostly initially it will be screened by this teachers only. Fine. Yeah. It will be, if there is if the visual activity is less than 6/9, then it is being referred to this PHC. It is refers to this PHC. Remember. Then this one, this logo is also asked in this 𝗵𝗵𝗀. If you see, this is what this, she is the Janani. Janani, it's a Shishu. So this Janani 𝗚𝗵𝗀𝗀 means Janani also should be good and Shishu also should be good. So here, this for maternal there is a free transport, free drugs, free diagnosis, free delivery, blood transfusion is free, and surgery if like cesarean section. Okay, and diet for vaginal delivery for 3 days and cesarean section for 7 days. Whereas for newborn, what is the free? The same diagnosis, drugs, blood transfusion, and newborn care corner and newborn stabilization unit and special newborn units. They comes under this Janani Sishu Suraksha Karikram. This is the logo of Janani Sishu Suraksha Karikram. Remember, fine? Yeah, good, Dr. Shanwas Khan, Ansh, and Prototype. Good. Next one, it is the Navjit. It is a Navjit Sishu, which mainly aims in training this doctors, especially doctors and this people who are walking in closely to this labor wards. So in such scenarios, we need to resuscitate these children. So mainly it is training program on newborn care and resuscitation for all this healthcare personnel. Okay, fine. Next, about ASHA will perform one thing which is known as home-based newborn care. What is this home-based newborn care? Means after delivery, the ASHA will go to their home to see their wellness and to check whether they are vaccinated and or not. Fine. So in the case of institutional delivery, the ASHA will go on day 3, 7 because they will release on the second day. So she will go on this 3, 7, 14, 21, 28, 42. It will be having 6 days. Whereas home delivery, she will go on the first day also. Remember, first day also. Fine. And next one, which is this Rashtriya Bal. So Bal means children. So here it will measure for this 4 Ds in children, like which include diseases, deficiencies, and developmental delays or any congenital defects. Okay, they will ask you the congenital defect in a child, the congenital defect in a child between the age of 0 to 18 years is being monitored or is being taken care of by which of the following programs. It is what it is, this RBSK, Rashtriya Bal Swasthya Karikram. Then Rashtriya Kishore Swasthya Karikram, it is for this adolescents for their diseases. Okay, just remember. Fine. Next, the drugs. We already yesterday we saw about this malaria drugs. Today we'll see have a glance on this TB drugs and this HIV drugs. If you see for TB, we use this regimen 𝗧𝗵𝗶𝗀 regimen. Okay, but it can lead to some resistance. We call them monodrug resistance if it is resistant to any of these first line drugs like 𝗧𝗵𝗶𝗀 drugs. Fine. Whereas this polyresistance means more than one first line antituberculosis drugs are other than isoniazid and rifampicin, because this rifampicin resistance, it is itself is a separate entity. It is known as rifampicin resistance. Then multi-drug resistance means if there is a resistance to both isoniazid and rifampicin, then we call them as multi-drug resistance. It is two drug, but we call them as multi-drug resistance. Fine. Then extensively drug resistance. This extensively drug resistance to any fluoroquinolones and resistant to this second line injectable drugs. Okay, previously we used to use this second line injectable drugs, which if they get resistance, we'll call them as extensively drug resistant TB. Fine. And we use this drug regimens, which is this 4 months, which is 4 means 4 plus 2 months. So 2 months of initial phase, which is having this 𝗧𝗵𝗶𝗀, and 4 months of HER. Okay, HER and HERS. Okay, so 2 months, initial 2 months for HERS, and for next 4 months for 𝗧RE. Fine. And in pregnancy, we'll usually use 2 months of 𝗧RE and 7 months of HR in 9 months. Fine. That's it. So this is the method of this TB treatment in usual conditions. Whereas in a case of resistance, then we can use this kanamycin, levofloxacin, fine, then ethonamide, okay, then pyranozepam, ethambutol, and isoniazid. So we can use all these drugs for 6 to 9 months, here for 18 months. Just remember. Okay, just see this table before your examination, because it is very rarely asked, but it can have this chance to be asked in your examination for sure. Then about HIV, see, remember, just remember this DTG or TLD. That is tenofovir, lamivudine, and dolutegravir. And this is the drug which you use for the HIV, and we'll use them irrespective of their CD4 count. CD4 count. So CD4 count is good, bad, better? No, we don't care. We'll use this thing irrespective of their CD4 count. Okay, next, if the child is more than 6 years and in the case of pregnancy, we'll use zidovudine, then or abacavir, then lamivudine and dolutegravir. So what we'll do, we'll replace this D, and with this D, we'll use this dolutegravir. Then the rest 2 drugs, we'll use zidovudine or abacavir along with this lamivudine. Fine. Whereas in the case of neonates or child, we'll use zidovudine or abacavir along with lamivudine or lopinavir, or any of this lopinavir. Fine. Or raltegravir. So just remember these things. If you don't remember, just remember this TLD for usual things, and the same TLD will be used for this prophylaxis in the case of needle stick injuries. Fine. Needle stick injuries. Fine. That's it. So we'll use the same TLD. Fine. TLD. And for prevention of this maternal to child transmission, we'll use this drug which is known as nevirapine. We'll use this drug which is known as nevirapine. Fine. And we'll look into this very important topic, which is the ASHA part. So this workers, you need to know about this. What are these qualifications? What are their functions in the society? Okay, and on where they get their training and for how many days, right? And for how many days. So it will be a bit volatile. PSM will be like this only. It will be very rough. It will be very difficult. But make sure you are doing it perfectly, because this notes, it will be carrying at least 20 to 25 questions. Okay, 20 to 25 questions in examinations where 1 mark play a bigger role. It is really very important. Okay, that's what I will tell you. Then about this ASHA worker. ASHA worker, it should be a female who is either married or divorced, mostly resident of the same village, would be from this 25 to 45 years old. And for population norms, it should be 2 per 1000 ASHA, but now it is the minimum, it is the 1 per 1000 ASHA. Okay, okay, that's remember. Then the education should be 10th pass, and who will give training? It is the Anganwadi worker and the ANM. Okay, so now the minimum quality or the minimum ASHA should be there. It is 1 per 1000 population. It is not 2 which was proposed one. Okay, so now we are having is 1 per 1000 population. Okay, and training will be given by the Anganwadi worker and ANM nurses at PHC level. Okay, yeah, and main thing is that they won't give vaccine. So what they can give? So they can give or create awareness on this health and social issues. They can counsel women for this reproductive and child health. and they can act as a depot holder for this iron and folic acid and this small contraceptives. Okay, contraceptives they can keep, and this ORS they can keep, and few necessary drugs. Okay, and other family planning methods. So these are the things can Asha do, but she won't give vaccines. Take a question में यही पूछेंगे whether Asha can give vaccines. The answer is big no. ठीक है, good Dr. Shanwas. Fine. फिर इसके बाद आगे बढ़ते हैं कि multi-purpose worker. There are two multi-purpose worker male and multi-purpose worker female. Okay, multi-purpose worker male, he will be helping in all other like this outside works, like for example sanitation of the water and chlorination of the water, whereas multi-purpose worker female, she will be helping in the inside like the record books maintenance and about this preparation of the slides, remember. And this is mainly for this malaria workers, and the population now it is 1 per 5,000 population. Okay, at the level of sub-centers, and education should be 12th pass and training will be for 12 months. Fine. Yeah, the spraying also will be helped by this MPW. Then village health guides, it will be population is 1 per 1,000, but there is no such. Then they need to have at least 6 pass to be done, and they are training for 3 months. And we know this die. Okay, they don't need any education, but they need a training for 1 month. Okay, the population, since they are at village level, like village health guide and the die, both of them they are at this village level, so they need a training of 1 month, remember. And they will be around this population of 1 per 1,000. So village, imagine it is 1 per 1,000. Asha, it is also 1 per 1,000 population. Okay, whereas this multi-purpose worker, she will stay at the level of sub-center. We know sub-center in a case of plains it is 5,000. Okay, इतना याद रखना. Then Anganwadi worker, we know this Anganwadi worker, they are based on this ICDS. And one Anganwadi worker, it is for 400 to 800 population, and their minimum education qualification is 10th pass, but if they pass for 12th, then it is better. Fine. And they will undergo 4 months of training. Imagine they undergo 4 months of training. They are this Anganwadi workers. That's why they can give vaccines. Okay, remember. Okay, they will clean Anganwadi shops and clean drinking water, and they will be helpful in immunizations along with ANC क्या? Fine. They will do this growth monitoring with this few scales. Salter scale which is used to measure the weight. Salter scale for measurement of weight. Then this 𝗚cie_𝗁𝗲 is used for which of the following guys? Yeah, heart. Means they are this Anganwadi workers, they are the heart of ICDs. Yeah. 𝗚cie_𝗁𝗲 it is used for which of the following guys? It is used for measurement of, yeah, good Dr. Mohammed, it is what it is, this mid-arm circumference. Then they also record this growth and development. Good Dr. Dr.G, good Dr. Parul, good Dr. Rahul. Okay, and good. Then about this most important program. Okay, if you should read this program and you should go to the examination. Okay, make sure you are reading and going. Fine. This anemia mukt program, it will be having this strategy which is known as 6x6x6 strategy, and main thing is that it will be having this 6 beneficiaries, 6 interventions, and 6 institutional mechanisms, and their aim is to reduce this prevalence of anemia by 3%. By reduce this prevalence of anemia by how many percent? It is not again 6%, it is 3%. It is 3%. Remember, it is a 3% reduction in the prevalence of anemia. Okay, and they will use 6x6x6 strategies, 6 institutional mechanisms, 6 interventions, and 6 beneficiaries. Who are the 6 beneficiaries? If you see the first one, it is what? It is 6 to 59 months old. They are what? They are this infants. They are this people like from this infant age. Fine. They will be given bi-weekly of around 20 milligram of iron along with 100 folic acid. So 20 plus 100. Okay, 100 mcg of folic acid. Fine. Next one, it is around 5 to 10 years of their children. So this 5 to 10 years of the children, remember, this is this children's which will mainly grown by this mother. So this mother, what will do? Means the mother need to give the tablets, right? So what is the color we'll use? So what is the best color? Are this the favorite color of the girls or this mother? It is what? It is the pink. So this pink color tablet will be given for these children. Will be given for this 5 to 10 years old children. Yeah, pink. Yeah, that's why initially we'll give 5 to 10 years. We'll give this pink color tablets to these children. Okay. Once they grow, they'll become boys and girls. Once they grow, they will become boys and girls. Okay. Here the dosage is here 20 100. Here it is 45 plus 400. It is 45 400. It is 45 400, and after it is everywhere it is same. It is 60 plus 500. It is 60 plus 500. It is 60 plus 500. Okay. Yeah. Yeah. Then the peoples will grow. Then boys will grow. Girl also will grow, right? So boys will pick their color. What is the favorite color of boys? It is what? It is the blue color. So this 10 to 19-year boys or this adolescents, they will be having this blue color tablet. They will be having this blue color tablets. Yeah, Neela, blue color tablets. Then followed by which the pregnant, means the pregnant who is under this, who is pregnant, and all these females who are under this reproductive age, they will take this red color tablet. Okay, red color tablet, lal. Okay, they will take this lal tablets, red color tablets. Okay, which will be having this 60 mg of elemental iron and 500 mcg of folic acid. Okay, right. So initially for syrup we won't have a color, right? Syrup, whatever color with the child will drink, whereas girls are more specific with their colors. So initially तो बच्चों को भी वही पहनाएंगे. So initially they will be having this pink color between the age of 5 to 10 years. फिर 10 साल के बाद बच्चों को अम्मा बस काफी है, फिर उसके बाद मुझे तो ब्लू कलर पहना. So they will use this blue color tablets with the concentration of 60 to 500, like 60 mg of iron and 500 mcg of folic acid. And this next one, this reproductive age females, and along with this pregnant and lactating females, they will use this red color tablets. They will use this red color tablets with 60 milligram of iron and 500 microgram of mcg of folic acid. ठीक है, बस इतना याद रखो. Yeah, good guys, good Quinen. Yeah, I guess you got these things correct. Yeah, pinky. Yeah. Next, about this rabies immunization. Okay, we are about to see. Okay, we are about to conclude this PSM part. See about this rabies immunization. Remember, first you need to know what are the different types of rabies immunization. Like, let's see, you are a means no, you not you are a doctor obviously. Means you have a pet, or your friend or your sister is a veterinary clinician. So they have this highest risk of exposing to this rabies. So they will be doing this pre-exposure vaccination. So remember this pre में कितना अल्फाबेट है? 3 अल्फाबेट है. So pre में 3 doses होगा. So 0, 7, 21 or either 28. ठीक है. So pre में 3 अल्फाबेट है. So it is 3. So remember it is the 3 doses and 3 visits. So 0, 7, 28, 28, and both we can use this intradermal route, which is this 0.1 ml intradermal or 0.5 IM. Okay, बस दोनों कर सकते हैं. ठीक है. And as they are told, they are at the risk. वो तो veterinarian है, ठीक है. And if you have कुत्ता, means if you have dog in your home, obviously वो मतलब whether it will bark or not, someday it will bite. इतना तो कोई ना कोई तो करेगा, means कुछ ना कुछ तो करेगा. So someday or other day, whether this dog will bark or not, it will bite for one day. So after this one, you already exposed this pre-exposure vaccine. Now you need to go for re-exposure vaccine. So in the case of pre-exposure vaccine, remember it is re मतलब इसमें 2 अल्फाबेट है. So you will be having the 2 doses. It will be having this 2 doses and 2 visits. 2 doses, 2 visits, the same intradermal or intramuscular. But you are not like this. Means you don't have a kutta. Means you don't have a dog or cat. Okay, or something, any pets. Now you are just walking in your road. You passed your FMG. You are just enjoying your time. You are just going to your hospital. And some other day, means like or your friend is going. Okay, imagine your friend is going and he got bitten by this dog. Okay, but he doesn't had any previous exposure. So then we'll use this 2 regimens. Now we usually use this updated Thai regimen, where we'll give 4 doses on 0, 3rd, 7 and 28. Previously we used this SN regime, which is an IM regime, which we use to give 5 doses and 5 visits. But here it is just 4 doses. It is the friend ka kutta, remember, it is this 4 doses only, 4 visits, and along with this each time you will put 2 doses, like 2 doses. Okay, 2 doses. So it is 8 doses and 4 visits, and it is the intradermal. So remember Thai to thoda aram se, like, so it is what it is intradermal, just 0.1, just for 4 days. It is what 4 days or 4 visits with 8 doses. So 0, 3, 7 and 28. So remember it is this post exposure. So remember post में कितना 1, 2, 3, 4. So 4 alphabets. इतना याद रखो. और SN में 5. SN में E for 5th alphabet, D for 5. इतना याद रखो. Next, you saw this post exposure. You saw this now the patient who is coming after this post exposure, but you should decide whether you need to give immunoglobulin or not. For example, there is category 1, like first you need to see and categorize the injury. Obviously, you need to give this vaccine, but you need to give immunoglobulin or not, it is based on the category of the wound. For example, category 1, it is just licking or touching of this of these animals. Like for example, they are just licking your skin. Okay, it is categorized as category 1 and it is none. We don't give any immunoglobulins in this case. Whereas in category 2, it is what, it is just minor scratches but not yet bleeding. So for this minor scratches which is not yet bleeding, what we'll do just use some of this vaccination and just local treatment. Whereas in a case of category 3, where you will able to see this bleeding, thing, there you will give what? You will administer this rabies immunoglobulin. There you will administer this rabies immunoglobulin. This rabies immunoglobulin, it is of two types, the equine one and the human one. So human one, it is given at the ratio of 20 international units per kg, whereas equine one, it is given at the ratio of 40 international units per kg. Fine. So this is the rabies immunoglobulin. Okay, and there are few things you need to remember. If someone took rabies immunoglobulin previously, then they no need to take again. They don't need to take again in their life. And maximum of this immunoglobulin, it will be infiltrated around the wound. Okay, and remember one more thing, all of this rabies immunization, this previously this IM immunization, it should not be done at gluteal region, it should be done at the deltoid region. Remember, it should be done at the deltoid region. Yeah, that's it. Category 3, what we'll do immunoglobulin plus vaccine. Whereas category 2, it is just the vaccine. Category 1, kuch nahi karna, bas घर जाओ मौज रहो. ठीक है. Then we'll see about this tetanus immunization. Tetanus mein there are two things, there is clean wound or unclean wound. Clean wound matlab, if it is less than 6 hours, we will call them as clean wound. If it is more than 6 hours or tidy wound, we will call them as unclean wounds. Fine. So if a patient who is completed his immunization just within 5 years, फिर उनको कुछ नहीं करेंगे. If it is clean unclean wound, ठीक है, कोई ना, चले जाओ. If it is the patient which is under category B, he is completely immunized, but immunized within the gap of 5 to 10 years. ठीक है, 5 से 10 साल के बीच में कभी भी हो, then we need to give just one dose. Whereas if it is completely immunized more than 10 years, we need to give, if it is clean, then we need to give just one dose only. Whereas if it is an unclean wound, तब हमें tetanus immunoglobulin भी देना है. Fine. Then whereas in a case of, they don't know, like if you asked him when you have been vaccinated previously for tetanus, they don't know, I don't know. Then in such cases, you need to give 2 doses of this TT for this clean wound, whereas for unclean wound, you need to give complete course, which is this 2 doses along with this tetanus immunoglobulin. Itna yaad rakho. Fine. These are the most things, and we'll look into this few extra topics. Fine. If you see, this is this rule of half for the hypertension. Okay, there will be this 100% population, out of which 50%, they know, like they are having, out of which 50% they will be having this hypertension. Or how many of them 50% will be having hypertension? This 50% will be diagnosed with hypertension, and those who diagnosed with hypertension, 50% of them, they will be taking treatment. Okay, and 50% of them who is taking treatment, they will be having this adequacy of treatment. So it is known as rule of 50, which is used in a case of hypertension. We'll see in a case of hypertension. And you measured a blood BP of a child who is 90/60, and the child is grown now, and like at 10 years, or and now the child is 20 years. The BP is still 110/60. So there is a phenomenon which is known as tracking phenomena. Means this BP follows a tracking phenomena. If the BP is low in their childhood, it will remain lower in their lifelong time. So this is known as tracking phenomena. Yeah, it is known as tracking of BP. Then if it is higher in this initial days or initial years, then it will be obviously at the end also it will be higher. Bas itna yaad rakhna. Then about this test, there are 2 tests. One is this qualitative test and this quantitative test. Agar qualitative test mein, if you want to compare between more than 2 groups, or if you want to compare 2 groups or more, we'll use this test which is known as 𝗡𝟐 test. Okay. Then if you use this quantitative test, like they'll be mentioning here, they will mention about this percentage or proportion. If they mention in question about this mean or standard deviation, there will be three scenarios. Fine, remember there will be three scenarios. If it is within one group, if it is between two group, if it is more than two group. Okay, remember. So remember, if your friend is single, okay, if your friend is single, okay, you will make them committed. Okay, if it is only one group, you make them committed. So it is known as paired t-test. Okay, paired t-test. If you are single and if your friend is mingled, then you separate them. So if it is two groups is there, if they are paired, means two is there, then you unpair them. Then it is known as what? It is known as unpaired t-test. Okay, unpaired t-test. And if it is more than two groups, it is known as ANOVA test. It is known as ANOVA test. Okay, it is known as ANOVA test. Bas itna yaad rakho. Good guys. Then about this factory act. Based on this factory act, the maximum work hours it is 48 hours per week. Fine. And if including overtime, it should be within 60 hours, and minimum space in a factory for a person it is 500 cubic feet. Then this is the logo of ESIC. This is the logo of ESIC. And we know ESIC, there will be few benefits will be there. Okay. The employee and the employer. The employer pays higher, which around 3.25% of this amount, whereas here he will pay 0.75%. Fine. And this benefits include this sickness benefit. In sickness benefit, there he will get 70% of the salary for 91 days. Whereas for this extended sickness benefit, for 2 years he will get 80% of the salary. Okay. For this 2 years, for this 80% of the salaries. Fine. Remember. Next for enhanced. Remember, enhanced matlab you are keeping hands and you are doing some surgery. For example, you are doing tubectomy and vasectomy. For tubectomy, it is for 14 days. For vasectomy, it is for 7 days. For tubectomy, it is for 14 days and vasectomy, it is for 7 days. Fine. And next about this thing, this disease, impairment, disability and handicap. Okay, disease means, for example, a man is undergoing RTA. RTA, it is a disease, and he lost his limb. And because of this lost his limb, he is unable to walk. So he is unable to walk, he is unable to do his work as a driver. Okay, so it is DIDH. So disease, impairment, disability and handicap. So they will ask you, the patient is unable to walk after an RTE. So this is an example of disease, impairment, disability. You should tell he is unable to walk, he is unable to perform his daily activities. It is known as disability. Okay, disability. And he is unable to perform any social tasks, then we'll call it as handicap. Remember, okay, this is the main difference that you should know. Yeah, good guys, good, well going. Then about this one, single exposure points of epidemic. If you see all of these cases within this one incubation period, and there is a sudden rise and sudden fall. Like example, the Pani Puri wala. Okay, if there is any food poisoning, it will be having this single exposure points of epidemic, and all of the cases will rise rapidly and fall rapidly. Okay, all of them, they will rise rapidly and fall rapidly. This is the case of single exposure points of epidemic. Example is staph aureus poisoning. Okay, and next, if you are able to see, there is this multiple peaks. The multiple peaks, but their common source is there. So it is known as multiple exposure point source epidemic. For example, the well contaminated, well and contaminated wells with typhoid bacilli. Remember, fine. Are this milkman carrying this contaminated milks? Fine. And next one, if few diseases are there, it is being spread, and this disease will cause spread to others and to others. So it is known as propagated epidemic. The example of this propagated epidemic, it is the TB and our hepatitis A. Next, you need to remember about this data. The current infant mortality rate is 28, whereas current neonatal mortality rate is 20, under 5 mortality rate is 32, and maternal mortality rate is 97, perinatal mortality rate is 18, and sex ratio of current is around 943. It is 943. And see, this most of this, to identify whether is there any social problem, we'll use this infant mortality rate, and whether the females are having the maternal health properly will be assessed by this maternal mortality rate. Okay, so the health status of the community will be mainly measured by this infant mortality rate. Yeah, good guys, good. Yeah, sure. We'll give a 10 minutes break. Yeah, okay, fine. I guess today the session will be till 5:15. Yeah, we'll have a break. Yeah, okay guys, we'll have a break. Don't worry. Yeah, no, like to remember this ratio, remember, like try to remember in the ratio of like just try to write them in this sticky notes and keep pasted to that. Okay, it will be remembered. Okay, don't worry. Then about these diseases, just if you're able to see this flower on the hands, it is this non-communicable diseases program, non-communicable disease program. And for this iron deficiency program, okay, this is the logo of this sun. Okay, and you need to know at production level it is 30 ppm, and at consumer level it is 50 ppm. Okay, and this is this 𝗧𝗵𝗶𝗀𝗀𝗀𝗀 Abhiyan, where he will conduct, yeah, where he will conduct this on 9th of every month for this obstetrics checkup. In this IDSP, the three people, SPL people, where these three forms will be there, S form, P form, L form, where it will be given by this health worker, the next one by this U, and third one by this lab confirmed diagnosis. Fine. Then Ujala, remember it is Ujala, it is the brightness. So Ujala, it is the LEDs. Next, this Ujvala, it is what? It is the gas cylinders. And next one, if you see this Ujavla, it is what? It is the child trafficking. Fine. And next one, this is this Mission Indrajanus, mainly for this 7 vaccine preventable diseases. Okay, it is for this 7 vaccine preventable diseases. Fine. And next, this is this Pradhan Mantri Jan Arogya Yojana. Here you will get 5 lakhs. There will be 5 leaves, so you will get 5 lakhs of your insurance, and it is not depend on your number of family members. बस इतना याद रखो, ठीक है? And Pradhan Mantri Matru Vandana Yojana. Okay, it is for this cash incentives. Okay, they will give this incentives during deliveries. Fine. And this is this RKSK, and here the both boys and girls of this adolescent age, they will be engaged, and they will be approached under this approach, which is known as Satya approach. Okay, Satya approach. And this is this Poshan Abhiyan, which will give this nutrition of half of their protein requirement and 1/3 of their daily calorie requirement. Okay, as I told you, this is this leprosy logo. Then Lakshya, it is for this improving this labor room quality. It is to improve this labor room quality. And this is this Food Safety and Standards Authority of India logo. And next one, it is this AGMARK, which is given for this few food items. Fine. That's it, guys. That's it for this PSM part. We'll have a short break. We'll have a short breaks of like, see, like we'll meet up at 4:30. Okay, or 4:30 or 4:35. Okay, give me 45 minutes for this ophthalma. We'll try to finish it up. Okay, we'll finish by 5:30 maximum. Okay, if you have any doubts, put up in the comment section. We'll check it out. Fine. Yeah, you're welcome. Hello. Hello, doctors. Am I audible? Yes, fine. We'll start up. Yeah, we'll start up with it. Like mostly we'll finish by 5 o'clock. Okay, that is our main mission. Like, but our main goal is to learn things. Okay, it's not about rush up. We'll learn perfectly. If you have any doubts, if you feel any confusion, please make sure to ask me. I'll help you out. Okay. Okay. Yeah. That's good. Dr. Venkatesh, Dr. Hassan, and Dr. Rahul. Fine. Okay. Fine. We'll move on to this game changer part of this ophthalmology part of this. We'll move on to this ophthalmology part of this game changer session, and first we're gonna see it is this cataract. Okay, there are different types of cataract. If you see, there is this mature cataract, and before this there will be this immature cataract. Immature cataract. We know this immature cataract, what it will do, it will absorb the water, and it will absorb the water, and once this cataract or this lens absorb this water, what will happen? This lens will swell up. The lens will swell up and it will closes this anterior chamber. So this type of immature cataract will causes what? Will causes this type of glaucoma, which is known as phagomorphic glaucoma. Phagomorphic glaucoma. Okay, it causes phagomorphic glaucoma. Fine. Next, if you see, after this immature, it will become mature cataract. This will become mature cataract. Once it becomes this mature cataract, we need to do surgery and we need to remove it. Okay, then once after this mature cataract, usually in rural Indias, they won't go for the surgery. They will lead to this type of cataract, which is known as hypermature cataract. Hypermature cataract. And this hypermature cataract can be of different types. One of them is what? One of them is in which the central nucleus sorry, the central nucleus of this lens, it will fall down. Okay, it will fall down. Okay, fall down. Okay, it will become like a gel and this central nucleus will fall down. Okay, so this type of cataract or this type of hypermature cataract in which the center nucleus will fall down, it is known as what? It is known as Morgagnian cataract. And sometimes this lens will get ruptured and this material can come and obstruct the flow of aqueous. So it will cause which type of glaucoma, guys? Will this same cause phagomorphic glaucoma? No, this will cause phagolytic glaucoma. So remember, this hypermature cataract like Morgagnian cataract will cause phagolytic glaucoma. Okay? And there is one more type of hypermature cataract in which the lens becomes sclerotic. So it is known as sclerotic cataract. And next, in mostly the questions they will describe, there is a patient who is presented with previously with a history of decrease in vision. Okay, decrease in vision and also presence of seeing halos around him. Now what happened is that now previously he used to use reading glasses for his near vision, but now he is able to read this newspaper or this books without the use of this eye glasses itself. So they will ask, what is the name of this type of cataract in which this phenomena happens, which is known as second sight phenomena happens. So which cataract it will be, guys? It will be the nuclear cataract. So in the case of nuclear cataract, if you see, this nucleus will become cataract. So the light cannot enter into the center. So the pupil will dilate. There will be this dilatation. Yeah, good, Dr. Rahul. It is the dilatation of this pupil leading to this light rays to be entered. This nearby light rays will enter in this sides. So this leads to this near vision to be clear. Okay, so there is an improvement of this near vision. It is known as second sight phenomena, which is seen in a case of nuclear cataract. Improvement of near vision. Fine. And then cortical cataract, mostly they will have this blindness, which is known as night blindness. Means on night we need more vision, right? So the pupil will dilate, but mostly this cortical cataract, it will be on the sides. They will be having the blindness over the night. Remember. And next, if around this posterior pole, if there is some kind of opacity is there, then we'll call them as posterior subcapsular cataract. Posterior subcapsular cataract. And remember, this posterior subcapsular cataract will cause us this maximum visual handicap. Okay, remember. And these are the few types of cataract you should know. Next, will know about this few other types of cataract based on this their mechanism. For example, in the case of diabetes, you will see this posterior subcapsular cataract as well, and you will see one more cataract which is known as snowflake cataract. You will see one more cataract which is known as snowflake cataract. Next, if you are able to see this type of sunflower shaped cataract, it is seen in a case of Wilson's disease, and in a case of blunt injury, you will see this rosette shaped cataract. You will see this rosette shaped cataract. And next, in a case of myotonic dystrophy, you will see this type of Christmas tree cataract. You will see Christmas tree cataract in a case of myotonic dystrophy, snowflake cataract in a case of diabetes mellitus, and Wilson's disease you will see this sunflower cataract, and rosette cataract in a case of blunt trauma to the eye. Okay? Then in a case of galactosemia, we know the deficiency it is this galactose 1-phosphate, GALP deficiency, galactose 1-phosphate uridyl transferase deficiency, and this leads to this oil drop cataract, remember, fine. And next, in the case of Loewe syndrome, there is a syndrome which is known as Loewe syndrome. There is this cataract which is associated with this posterior lenticonus, means this posterior part of the lens will become more conical in shape. This is known as posterior lenticonus. And there are few drugs which causing this cataract, which include the steroids, ethambutol, anti-tuberculosis drugs, and this amiodarone. We studied, right, these potassium channel blockers, which is amiodarone. All of them, they will cause us this cataract. Fine. Then for this cataract, we need to do surgery, right? Previously, we need to do two types of surgery, including this extracapsular surgeries and intracapsular surgeries. Now, mostly we'll prefer, in a case of if the patient comes with intermediate and mature type of cataracts, we'll do this phacoemulsification surgeries. And in a case of phacoemulsification surgeries, we know there is a probe which is known as phaco probe, and this phaco probe, it will use this ultrasound waves to break this lens, okay, to break this lens, fine. And for that, we'll make an incision with the blade which will be like this in a diagonal shape. It is known as keratome blade, with a keratome blade. So once you make an incision, then you will put a port. And we will enter in a Z manner. In a Z manner, you will enter, and then you will reach the anterior chamber, then into the lens. Once you reach into the lens, then you will need to stain the capsule of the lens. You will stain this capsule of the lens with a dye known as tryptan blue dye. And once you stain with this tryptan blue dye, you need to remove the capsule. So you will hold one end of the capsule and you will rotate in a circular motion, and this is known as capsulorhexis. This is known as capsulorhexis. And after this, so first you will do capsulotomy, then capsulorhexis, then you need to separate this capsule from the nucleus. That is known as hydrodissection. Then in nucleus, you need to differentiate. So to differentiate this nucleus, whether you reached or not, you will use this method, like where you will see this type of glow. So this glow, remember this glow for this nucleus, it is what it is, this hydro delineation. Then you will break. Then you will break them. Then you will break with phacoprobe. And once you break with the phacoprobe, then what you will do, you will aspirate them. Once you aspirate them, you remove this internal part of the lens. So we'll keep up this lens, which is this posterior chamber intraocular lens. So if you see, there is multiple concentric rings. So it is what it is, the multifocal PCIOL. Means for this you don't need to put one more glasses, whereas for only if it is unifocal, then you need to give additional lenses, fine, additional glasses also, fine. And this is this IOL insertion and finally draining. And for calculation of power, like how much this PCIOL, this posterior chamber IOL should be kept, will be calculated based on this SRK formula. SRK, now we are using SRK2 formula based on especially on this axial length, okay, remember axial length, okay. And there may be few complications can be arisen because of this cataract surgeries, okay. So one of the main complication is because of this unhygiene. Either if there is no unhygienic, if there is any unhygienic pre-op preparations, or if you didn't clean this eyelashes with this betadine, then it can cause to this deteriorate condition which is known as endophthalmitis. So they will ask you, what is the most important step in preventing this yearly endophthalmitis? The answer should be what? Cleaning these eyelashes. Cleaning these eyelashes with this betadine. Fine. On the later part, it can lead to this few other complications. After a few years, the patients will come and complain. There is a patient after cataract surgery. Patient after cataract surgery. Then now complains of decrease in vision. then you did an examination. There you will be able to see this type of opacifications. This is known as posterior capsular opacification. This is known as posterior capsular opacification. Fine. And in this posterior capsular opacification, also known as secondary cataract, it will be having two things. One is known as this 𝗏𝗏𝗃 pulse, like a pulse, it will be there. It is known as 𝗏𝗏𝗃 pulse. Fine. Then this type of rings, this is known as Somers ring. It's known as Somers ring. Okay, so Somers ring. So all of them, that is a part, or these are this component seen in a case of posterior capsular opacification or secondary cataract. And next, one more complication, if you're able to see, there is this accumulation of fluids in between the layer of retina. So this is known as central, it is cystoid macular edema. Okay, there will be accumulation of this fluid in this layer of this retina, which is seen on this OCT. So will produces this type of hump. That is this cystoid macular edema. Just remember, okay, cystoid macular edema. And to treat this posterior capsular opacification, we'll use this laser for the surgery, which is known as Nd:YAG laser. We'll use this Nd:YAG laser. Remember, it will use this Nd:YAG laser for this surgery. Okay, and this is this one of the most important part, which is this cataract, and one questions will be from this cataract. Fine. And next, if we move, it is what it is, this uveitis. If we see about this uveitis, this is the uvea. So this is this cornea, this is the iris, and this is the lens, and this is this uvea. And uvea will be having this parts of iris, ciliary body, and choroid plexus. On the choroid plexus, okay, and based on the place of the inflammation, this uveitis can be differentiated into anterior, intermediate, and posterior, and panuveitis. All of these things, they are based on the location. For example, if it is iritis or iridocyclitis, it is what it is, this anterior uveitis. Then ciliary body will be having two parts, pars plana and pars placcata. If there is inflammation of this, it is known as pars planitis. Then this choroid, if there is posterior part, which is this choroid getting inflamed, it is known as choroiditis. It is known as what? It is known as choroiditis. So these are the different parts of uveitis, and mostly they will be having this complaints of pain, redness, photophobia, and circumoral congestion. Means around the eye there will be this congestion of this eye. Okay, these are the usual complaints. And on evaluation of this anterior, mostly this is this pain sensitive area. So they will complain of more pain in anterior uveitis. So in this case of anterior uveitis, you can do examination. While doing examinations, you will able to see this type of arrangement of this precipitates. They are known as keratic precipitates. Keratic precipitates. And there will be this presence of cells. And there will be this presence of the cells. And when this neutrophils and the cells present in this anterior chamber, they will reflect their light. So that is what they will cause this flare. They will cause this flaring of this light. So in a case of anterior uveitis, you will see keratic precipitates and cells and flares. Okay, whereas the most significant one, it is the presence of cells. Okay, whereas the earliest you will see the flares. And the most common cause of this anterior uveitis is idiopathic more than this ankylosing spondylitis. Ankylosing spondylitis. Fine. And next, means once this anterior uveitis gets healed, means there is this involvement of this iris. So once it gets healed, there will be formation of the scars. Once the formation of the scar, this leads to this type of irregularly shaped pupil, which is known as fest-tuned pupil. And next, sometimes after this inflammation, either this iris will be there, like this will be the iris, and anterior to the iris, there will be this anterior chamber, and posterior to the iris, it will be the lens. So in some cases, this can attach to the posterior of this iris, which is this lens, which causes this posterior 𝗔𝗔𝗔, or it can cause attached to this anterior part, causing this anterior 𝗔𝗔𝗔. So in a case of posterior 𝗔𝗔𝗔 formation, this posterior 𝗔𝗔𝗔 will cause this cataract. Whereas this anterior 𝗔𝗔𝗔, I told you, anterior 𝗔𝗔𝗔, it will block this angle of this anterior chamber. So if it blocks this angle of this anterior chamber, then it leads to this glaucoma. Fine, it is this glaucoma. Fine. Then in intermediate uveitis, you will be able to see there is this involvement of this pars plana. So it is a pars planitis and vitritis. So once there is involvement of this vitreous, if you see, it will lead to this means it will lead to this haziness and causing this type of appearance, which is known as snow banking. okay, which is known as snow banking, and this will be presenting as floaters. This will be presenting as floaters. And one more thing about this anterior uveitis. In the case of anterior uveitis, you saw like this type of small precipitates, they are known as 𝗶𝗶s. Whereas if it is large one, if it is a large one present, they are known as mutton fat 𝗶𝗶s. Mutton fat 𝗶𝗶s. They are classically seen in the case of granulomatous uveitis. Okay, for example, in the case of TB, in the case of syphilis, in the case of leprosy, it will be causing this granulomatous uveitis. Fine. And in posterior uveitis, it will be causing this chorioretinitis. I told you it will be causing this choroid, and it also causes involvement of this retina, which is known as chorioretinitis. Fine. And the drug of choice usually for this anterior part, it is the steroids, and adjuvant to this there will be more pain, so we'll use atropine to provide this spasm. To relieve this spasm, we'll give this atropine. Okay. And we have one more ophthalmitis, which is known as sympathetic ophthalmitis. Like for example, there was a chiseler who was working with this chisel, and this foreign body has been scratched into this eye, and the scratched foreign body went into the choroid, and it caused damage to the choroid. So once it caused damage to the choroid, this choroidal antigens will be released into the blood, and antibodies will be produced against it. And once this antibodies comes and attacks this eye, okay, it will cause this other eye also will feel and will be having this choroidal antigen. So this antibodies will be produced against these two eyes, and this other eye will be sympathizes for it. So both eye will be affected. That is known as sympathetic ophthalmitis. That is known as sympathetic ophthalmitis. And there you will see a nodules which is known as Dahlen-Fuchs nodules. You will see these nodules which is known as Dahlen-Fuchs nodules. Okay. And about this next part, which is this IOP measurement. Yeah, good Dr. Shanwas. And next about this IOP measurement. So we know the gold standard for this IOP measurement, it is what? It is this tonometer, which is known as Goldman applanation tonometry. It is known as Goldman applanation tonometry. And now it is being replaced by one more tonometry, but it is not in widely used. It is known as, which is more accurate than this Goldman, which can tell you, because in Goldman we need to assume, because there will be formation of this kind of anion. Okay, there will be formation of this anion. Okay, so whereas in a case of Pascal's, it will give you the proper reading and value. Okay, proper reading and value. So it is more better than Goldman. Yeah, that is known as, yeah, that is good. My next one is this tonopin. This tonopin, it is used for this irregular cornea. Okay, if the cornea is not regular, for example, if there is any scarring of the cornea, if there is any opacity, after trachoma there is opacity, after vitamin A deficiency there was some xerosis, it leading to this irregular cornea. In such cases, we'll use this tonopin. Whereas we'll use this one more thing, which is known as rebound tonometer. For example, someone is having glaucoma, he want to test it by himself or herself. So in such scenario, we'll use this rebound tonometry. We'll use this, which tonometry? We'll use this rebound tonometry. Okay, rebound tonometry for self use. And next, most commonly in hospitals we use this type of tonometry, which is known as non-contact tonometry. We'll use, when you shoot this button, you will get some gush of air, and this air will find what is the level of this pressure. So this is known as non-contact tonometry. It is known as non-contact tonometry. Bas itna yaad rakho. Next we'll move on to this next important topic, which is this glaucoma. And we know that different types of glaucoma, and the mainly one is this acute angle closure glaucoma and open angle glaucoma. Fine, angle closure glaucoma and open angle glaucoma. If we see initially, this open angle glaucoma, it is the most common one, and it is due to this blockage of this trabecular meshwork. Fine, and it is most common seen in a case of high myopia patients. Fine, and usually there will be these few conditions which will be associated. There will be increased intraocular pressure. There will be visual field changes will be seen in them because of this increased intraocular pressure. There will be visual changes. Why there is visual field changes? Because there will be a damage to this optic nerve. Okay. Now you say a child who is having these features of bull's eye. Okay, bull's eye. Okay, bull's eye, also known as ophthalmos. So it is a feature of congenital glaucoma. It is a feature of congenital glaucoma. Fine. In congenital glaucoma, there will be features of lacrimation, photophobia and blepharopasm. So 3 will be there. Like because of this over large eye, he won't, means there will be always lacrimating, and he will be having this he will be having this photophobia to this light, and because of this he will be spasm to this lid. So it is known as blepharospasm. So blepharospasm, photophobia and lacrimations, all of these 3 things, they are classical for this congenital glaucoma. A good Dr. Naresh, good Dr. Mohammed Shanwas Khan. Good. Then in the case of congenital, we'll see this 𝗧𝗍 which is known as 𝗓𝗧𝗍. So we'll see this 𝗧𝗍 which is known as 𝗓𝗧𝗍, and there will be deep anterior chamber. So in a case of congenital glaucoma, what we'll do this thing which is known as trabeculectomy or trabeculotomy, means we'll remove some part of this trabecular meshwork and will promote this aqueous flow, or else we'll remove more part and we'll put the graft. So that is known as trabeculotomy and trabeculectomy. And next, there's this type of glaucoma which mostly occurs during the night time. So during the night time or during the theaters, you are sitting and watching a movie. Okay, when you are sitting and watching a movie, when there is an interesting scene, it will be, your eyes will be in the mid-dilated state, and mid-dilated state, it will lead to this falling of this pupil and causes closure of this anterior angle of this anterior chamber. Once this angle of this anterior chamber closes, then the pressure inside the eye will be suddenly increased. Once there is this sudden increase in the pressure, then it leads to this pain in the eye. There will be a gastrointestinal symptoms like vomiting, nausea, and all of this thing will be associated with this condition which is known as acute angle closure glaucoma. And here the pressure may increase even up to 60 to 70 millimeter of Hg. Okay. Then here you will be able to see there is this mid-dilated vertically oval pupil. Mid-dilated vertically oval pupil will be seen in a case of angle closure glaucoma. Fine. And here I told you the IOP will be high, and the treatment is what it is, this giving this mannitol and pilocarpine. So in a case of this, if it occurs in the one eye, there is a high chances it can occur in the other eye. So we'll do prophylactic iridotomy in the other eye as well. So what we'll do, we'll create a chamber with this laser iridotomy, or else we can put few valves which is known as Ahmad-glaucoma valve and express device, okay, to prevent this flow of this aqueous humor. Okay, they means this angle closure glaucoma, it is most common in a case of hypermetropes. This is most common in a case of hypermetropes, whereas open angle will be most commonly seen in a case of myopes. Okay, remember. Next, as I told you, there will be this optic nerve involvement. Because of this optic nerve involvement, what will be there? There will be a visual field changes. What are the visual field changes will you see? First one, what you will see, it is known as paracentral scotoma. It is known as paracentral. It is the blind spot, and it is around the center. It is known as paracentral scotoma. And next one, it will be forming this type of scotoma where it is forming this small ring. So it will be this arcuate scotoma. And then there will be this nasal stepping will be there, and followed by this there will be this small pace will be led. It is known as scrotal scotoma or sickle-shaped scotoma. And then there will be this formation of two arch. It is known as double arcuate scotoma. And finally there will be this scotoma which is showing this tunnel-shaped vision. Tunnel-shaped vision will be there, and finally there will be complete loss of vision. There will be complete loss of vision. So these are the stages of this visual field defect. And we know to measure this, to know this visual field defect, we'll use which instrument? Yeah guys, we use which instrument to know this visual field defect? We use perimetry. We'll use perimetry. Remember. Next, we'll see into the drugs which we use in a case of glaucoma. I told you, in a case of open angle glaucoma, we need to suddenly reduce the pressure. So in a case we'll use mannitol. Whereas here we need to use proper anti-glaucoma drugs. For example, here we'll use beta blockers. Okay, it will decreases the production. So we know, as we studied in Meniere's disease also, what there will be either increased production, there will be decreased production. Here also the same. Either there will be a more aqueous production or less excretion. So in such cases, either we'll decrease the formation by giving this beta blocker. And one more complication of this beta blocker, it is blocking this nasolacrimal duct. Fine. And there is one more drug which is this alpha receptor agonist. It will increases the drainage as well and decrease the formation. But side effect of it was, that is this CNS depression. And next is the carbonic anhydrase inhibitors like donzolamide and brinzolamide. Okay, and there are the most commonly used drug, it is this prostaglandin analogs, which is this latanoprost, travoprost and 𝗵𝗵𝗶. Usually, like there will be two mechanisms of this aqueous flow. One is known as what? One is known as trabecular flow and another is known as uveoscleral flow. So this prostaglandins, they will increase this uveoscleral flows. Okay, remember. And we know prostaglandins will be increased during an inflammation. So they will be contraindicated in the case of uveitis. Fine, they will be contraindicated in the case of uveitis. Okay, and hyperosmotics like benadryl we can use it, and recently it is getting popularity, which is this rho kinase inhibitors like 𝗵𝗲𝗀𝗃 we are using recently, and it can lead to this condition which is known as vortex keratopathy. So vortex keratopathy, it is a side effect of this rho kinase inhibitors. This prostaglandin analogs can lead to a side effect which is known as heterochromia iridis. Heterochromia iridis. It causes different color of this iris, and also it causes this hypertrichosis over here. So there's this hypertrichosis over this eyelashes. Remember. Next, we'll see few conditions. This is what, if you see this elastotic degeneration, this type of elastotic degeneration seen in a hot and humid climate, it is known as what? It is known as pterygium. And in pterygium, if there is iron deposition, if a line which is showing this iron deposition, it is known as Stokers line. It is known as Stokers line. Remember, and for this may come and include into our visual axis, and it can cause astigmatism. And the treatment of this is what? It is doing osteografting and putting 𝗵𝗏𝗻 C. Like we'll do this conjunctival autograft and put 𝗵𝗏𝗻 C. Remember, we'll do this, take this conjunctiva and put it here, and we'll put 𝗵𝗏𝗻 C to prevent any adhesions. Fine. And there is one more condition which is similar to this pterygium, but it is yellow fatty deposit, fatty and calcium deposit. It is also seen in a hot humid climates. It is known as what? It is known as pinguicella. It is known as what? It is known as pinguicella. It is known as pinguicella. Okay, and now one surgery will use for this pterygium, which is known as pterygium extended resection followed by a extended conjunctival transplantation. So it is a simple transplantation only, but it is given an extensive name. Okay, and next we see this few important conditions. Okay, this include the first one, which is this VKC, which is vernal keratoconjunctivitis. This VKC, which is also known as spring catarrh, but it actually occurs in the summer days. It will actually occurs in the summer days. Okay, it will be having this typical feature of this spots around this limbus, which is known as Horner-Taunter spots, this cobblestone papillae, and this type of ulcer, which is known as shield ulcer. So all of these things, they are this classical features of this vernal keratoconjunctivitis, and we know it is the type 1 hypersensitivity reaction. It is the type 1 hypersensitivity reactions. Usually in history they will give, there is a patient or adolescent patient who is presenting with features of ropey discharge with itching. Okay, with itching. On evaluation, you will be able to see this type of cobblestone papillae and Horner-Taunter spots. You will think of vernal keratoconjunctivitis. Fine. Next, if you see, this is known as what? This is known as spectranullar conjunctivitis. It is known as spectranullar conjunctivitis. Fine. This spectranullar conjunctivitis, which is what? Which is this flicton. Okay, flicton. This is small nodule, right? It is the flicton. So it is the flicton. Remember, it is the flicton. And this spectranullar conjunctivitis, it is a type 4 hypersensitivity reaction, and in India the most common cause of this spectranullar conjunctivitis, that is the tuberculosis. So to treat this spectranullar conjunctivitis, हम क्या देंगे? ATT, anti-tubercular therapy देंगे. Whereas in bold, the most common cause in bold, it is what? It is the Staph aureus. Staph aureus. बस इतना याद रखना. Next आगे बढ़ते हैं. Next disease, which is this trachoma. We know it is eliminated from India. Remember. And next, so there is high chance of being asked about it. Fine. This is due to this chlamydia infection of A, B, C. It is due to the infection of this chlamydia trachomatis of the species of A, B, and C. And in WHO classification, it is classified as Fisto. F-I-S-T-O. Fisto. That will be what? First one. Trachoma. It is Ma. माँ ने एक आर्ट बनाया. आर्ट मतलब कला बनाया. ये कौन सा कला? It is the art. So you will see this art lines here, and it is her who made it. It is the she or the her who made it. It is you. So trachoma, it made a art. Okay, it made a art. What is the art? The art is made up of this sago grain follicles. So उसने साबूदाना की the sweet बनाए. Okay, remember. So it is the ma, which is trachoma, which made this art, which is exclusive by her, which is what? Which is this sabudana ki, means like it is the payasam kind of thing which she made. Okay, remember. So here you will able to see this sago grain follicles, and then you will able to see this type of scarring in this upper tarsal conjunctiva, which is known as arch line. Okay, and here you will able to see this type of pits, which is known as Herbert pits. Yeah, the kir. Yeah. Fine. And this is this fisto follicles, inflammation causing the scarring, and then S for inflammation causing the scarring, then this Herbert pits, then this trichiasis, means instead of like this eyelashes, it will be turned inward and will be causing rubbing of this eyes. So it is known as trichiasis. So it is the misdirection. Okay, and it will cause this opacity over this region. So you can see, right, it is the cornea. Here you will be able to see this whitish opacity. Usually it will be white, but here you will be able to see there is this opacity is there, this opacity is there. So this type of opacity will be seen in a case of trachoma. And in trachoma we'll use this strategy, which is known as step strategy. क्या करेंगे? Surgery करेंगे, azithromycin, which is an antibiotics देंगे. Then we'll maintain this facial hygiene with cleaning of the eyelashes. Then we'll do this environmental modification. So safe surgery, antibiotics like azithromycin, F for facial hygiene, E for environmental management or environmental modification. Okay, this is about the trachoma. Next about this disease, which is due to this localized protrusion of this cornea. So if you see cornea, it will be like this, but here the cornea will become like this. So this is known as localized protrusion, especially due to the ectasia of this central part of this cornea. So it is what it is known as keratoconus. And what is the classical finding the patient will tell? The patient tells that he changes his glasses very frequently. So this is the frequent change in the glasses and difficulty vision even with glasses. And when you tell the patient to look down, he will able to see this type of cornea, which is known as what? Which is known as Munson's sign. Here you will able to see 𝗲𝗶𝗀𝗀. Here you will able to see which 𝗶𝗀? You will able to see this is keratoconus, and looking downside it is looking like a V. So this is this keratoconus, and here you will able to see this 𝗲𝗶𝗀𝗀. Remember, it is the 𝗲𝗶𝗀𝗀. Next, it can lead to this irregular myopia and myopic astigmatism even. And to treat this condition, we can give this hard contact lens and one more therapy, which is known as C3R, which is known as collagen cross linking with riboflavin. Okay, fine. Next about, we'll come to this corneal ulcer. In corneal ulcer, usually they will give the history. Like if it is a bacterial ulcer, they usually tell there is a contact lens users, and he or she doesn't remove this contact lens for a longer period of time. Okay, so this will be suggestive of an ischemia and leading to this corneal ulcer. And this corneal ulcer, we know the most common cause of corneal ulcer, it is what it is, this Pseudomonas. And if it is a bacterial ulcer, it will be having this well-defined margins. And along with this well-defined margins, sometimes it can be associated with this hypopyon and corneal scamming. फिर आप क्या करोगे? You need to find the organism, right? You will do this corneal scraping and you will do the gram staining. Whereas you get a history of farmer with a history of trauma with this vegetative matter. There is a farmer with history of trauma with this vegetative matter, and this farmer with history of trauma with vegetative matter with the sign of less signs will be having this type of fuzzy margins. Fuzzy or feathery margins. This fuzzy or feathery margins along with this presence of satellite nodules, satellite lesions. It will be suggestive of fungal corneal ulcer. So in this case, we use this KOH mount for a staining. Fine. And next, if you are able to see this type of dendritic ulcers, it will be especially seen in a case of herpes simplex virus keratitis. Okay, herpes simplex virus keratitis. Okay, there are two types. Epithelial, it will cause dendritic ulcer and geographic ulcer. Fine. And there will be a stromal keratitis, which comes this disciform keratitis and endothelial keratitis. So epithelial will cause dendritic ulcer and geographic ulcer. Dendritic ulcer and geographic ulcer will be caused by this epithelial keratitis. So dendritic and geographic will be caused by this epithelial keratitis. Okay, it will be caused by this herpes simplex virus. Fine. And next you saw a patient who is presented with this ring shaped ulcer. Ring shaped ulcer, and he is a contact lens user who washes his lens in tap water. So it is what it is. This is the diagnosis of amoebic keratitis, which is showing this ring shaped ulcer. So in a case of 𝗏𝗏𝗃 ulcer, we'll use FMGE as a treatment modality. Fine. And next we'll see this next staining of conjunctiva. So in the case of the recent cases of dry eyes has been increased. So they will tend to ask this type of questions. So in a case of dry eyes, we'll stain the conjunctiva and see whether the patient is having dry eyes or not. Fine. So we'll use first stain, which is rose in color, which is known as rose Bengal stain. Next one, in case of any corneal trauma, अगर जो भी corneal trauma के पास होगा या corneal aberration के पास होगा, then we'll start with this stain, which is known as what? Fluorescent stain for corneal aberration. Okay. Next, if you are able to see this green dye, it is what it is, this 𝗏𝗵𝗃 green. It is the 𝗏𝗵𝗃 green. All of them, they will be used for this staining of conjunctiva. Then we'll use few tests. If you know this test, it is the Schimmer's test, and the same fluorescent test we use here, and it is the rose Bengal stain. And we'll use one more test, okay, to know like after how much time the tear is breaking up. So it is known as tear breakup time. It is not your breakup time, it is the tear breakup time. Okay, it is a tear breakup time. Yeah, good Dr. Mohit. It is the Schimmer's test previously. Fine. And next we'll see this disease, which is this retinoblastoma. I told the most common presentation of this retinoblastoma, it is what? It is the leukocoria. And the condition which is being associated with this retinoblastoma kya? It is this osteosarcoma, and we know we'll see this calcification, and we'll able to see this type of central white or opaque one with this rosettes. If central white rosette, it is the true rosette, which is also known as what? Flux nerve intestinal rosettes. So based on the level of extension of this retinoblastoma, we will go either with small excision to the enucleation as well. Okay, so we'll do enucleation as well in later part if there is any more metastatic lesions. Okay, then this for this retinoblastoma, we'll use this chemotherapy method, which is this VEC, which includes vincristine, etoposide, and carboplatin. Vincristine, etoposide, and carboplatin. Vincristine, etoposide, and carboplatin. Remember. And next, if you see about this diabetes mellitus, we know in a case of diabetes, we need to screen them for this diabetic induced retinopathic changes. We know in a case of type 2 diabetes mellitus, whenever we see them for the first time, we need to tell them you should screen immediately. You should go to the screening immediately. Okay. And in a case of diabetes, if you see RB gene location, it is in the 13th chromosome. It is located in the 13th chromosome. Okay, especially 13p14. Right? Remember. Then if you see this next diabetic retinopathy, there will be this initially this non-proliferative diabetic retinopathy. There will be presence of this microaneurysms, intraretinal hemorrhages caused by this rupture of this microaneurysms. Then there is a presence of this Dotten blood hemorrhages, and there will be this superficial flame-shaped hemorrhages. So most of them you need to remember about this hard exudates. Hard exudates, which are actually what? They are this actually lipids. So these are these hard exudates, which are actually lipids deposits, and there will be this presence of this microaneurysms. These are the two main features which you will see in a case of non-proliferative diabetes mellitus. Okay, after seeing this non-proliferative diabetic retinopathy, it will progress into this proliferative diabetic retinopathy. In the case of proliferative diabetic retinopathy, there will be proliferation of this new blood vessels. Okay, there will be proliferation of this new blood vessels, and because of this neovascularization, it can lead to this vitreous hemorrhage. So in such cases, for preventive measures, we'll give anti-VEGF drugs like bevacizumab and ranibizumab. Whereas as a treatment modality, we'll do this thing which is known as PRP, also known as pan-retinal photocoagulations, will do in a case of proliferative diabetic retinopathy. Okay, bas itna yaad rakhna. Then you need to know about this few spotters. If you're able to see this type of cherry red spot, and along with this sudden painless loss of vision, okay, it is seen in a case of CRAVO. Okay, it is seen in a case of CRAO. Okay, whereas if you see this splash torpedo appearance, it will be seen in a case of CRVO, which is also known as 100-disc glaucoma, which can lead to 100-disc glaucoma. Okay, then this type of 𝗓𝗶𝗶 appearance will be seen in a case of CMV retinitis, and it will occur at a level of CD count less than 50 in HIV positive patients. Okay, HIV positive patients. Okay, and this is the CRAO, sudden painless severe decrease in the vision. The same for this sudden painless loss of vision along with this tomato plus splash appearance. Fine. And next, about this visual field defects, we know there are different levels of visual field defects. Which line? I guess. Yeah, fine. Yeah, I will try to zoom out. Yeah, okay, fine. See, if you see about this next one, which is this visual field defect, if you see, means there will be initially, if at the level of nerve blockage, if at the level of nerve, if there is an injury, then it will be what? There will be the resulting in this monoocular blindness. It will be resulting into this monoocular blindness. Whereas next, whatever next to it, it will results into this both eye injuries. Fine, like are both sides injuries. Fine. Next, if you see, this is this optic chiasma. If there is any damage at the level of optic chiasma, then it leads to this bitemporal hemianopia, also known as heteronymous hemianopia. Okay, then it is at the level of 2. If there is any other lesions next to it, it will be always homonymous. It will be always homonymous in nature. Okay, it will be, oh yeah, Mohit will, I'll tell you in once we complete it. Fine, don't worry. Okay, so it is once after it is known as homonymous hemianopia. So if you see this optic tract, it will result in a homonymous hemianopia. Fine. So whatever side is there, for example, see, this is the right side and this is the left side. So if there is a lesion at the right side, okay, it will lead to this left homonymous hemianopia. It will lead to this left homonymous hemianopia. And next, based on this radiations, there will be two radiations. There will be this temporal one, there will be parietal one. If it is parietal one, it will cause what? It will cause inferior quadrianopsia. Okay, if it is a parietal radiation damage. Whereas if it is a temporal lobe or radiation damage, it will lead to this superior quadrianopsia, also known as pie in the sky. Whereas this one, it is known as pie in the floor. And next, if you see, there is a homonymous hemianopia, and along with this macula sparing. This macula sparing homonymous hemianopia, it is due to this at the level of occipital cortex. It is due to the damage at the level of occipital cortex, because occipital cortex will be supplied by these two arteries, PCA and MCA. And the central part of this macula, this cortex region, which is receiving the supply from the macula, it will be getting supply from this PCA and MCA. If this PCA gone also, then this macula area will be supplied by this MCA. That's why there is this macula sparing. Okay, fine. Next, about this extraocular muscles, if you see this extraocular muscles, there are 7 extraocular muscles: levator palpebrae superioris, inferior rectus, superior rectus, middle rectus, lateral rectus, superior oblique, inferior oblique. Okay, 6 and levator palpebrae superioris. All of them will be supplied, means like most of them it will be supplied by this third cranial nerve, except superior oblique and lateral rectus. Superior oblique will be supplied by this 4th cranial nerve, whereas LR6, lateral rectus, will be supplied by this 6th cranial nerve. Okay, and if there is any damage to this nerve, it will result in this following conditions. For example, if there is damage to the 6th nerve palsy, then lateral rectus will be gone. So here the central gaze, here this side is normal, whereas this is deviated to medially. Okay, here this side, if you see, adduction is normal, whereas an abduction, the patient is unable to do abduction. So it is what? It is this damage to this 6th nerve palsy. Whereas in a case of 6th nerve palsy, the patient will be having these features of face turn to this affected side. The face will be turned to the affected side. Whereas in a case of 3rd nerve palsy, if you see, means the 3rd nerve palsy, if you see, there will be features of this one, which is known as ptosis. Okay, there will be features of this. Yeah, good, Dr. Naresh. There will be features of this ptosis. Why? Because this third nerve will supply this levator palpebrae superioris. So it will supply this levator palpebrae superioris. That's why there is a manifestation of this ptosis, fine. And it will supply all the muscles except SO4. So it will be manifesting as eye in and face out, eye in and face out. So there will be feature of eye in and face out position, eye in and face out. So the eyeball will be deviated to this opposite side. I guess told wrong. I will just check it and tell you. So in the case of third nerve palsy, you will be able to see this eye will be to the outside because only this lateral rectus and superior oblique are acting on. Okay, so the eye will be positioned outside. So this is, and there will be associated ptosis. This is what? This is the classical feature of this third nerve palsy. Okay, this is this third nerve palsy. The eyeball will be deviated to this downwards and outwards because of the pull of superior oblique and this lateral rectus, fine. And next one, just you need to know about this myopia, hypermetropia and astigmatism. We know in myopia will use the divergent, which is this concave lens, whereas in hypermetropia will use convex lens, whereas in astigmatism will use both cylindrical and spherical lens, बस इतने याद रखना, fine. Then there will be this, if there is any, in the case of hyperopia, if it is not correct, if it is hypermetropia, if it is not corrected, then it will be leading to this convergent squint, whereas accommodative exotropia will be seen in the case of myopics. If it is not being corrected in child, it will lead to this accommodative exotropia, remember. Next, if you are able to see this painless swelling on the upper eyelid, it is what? It is the 𝗓𝗪𝑖on. It is the 𝗓𝗓𝑖on, which is actually what? It is this chronic lipogranulomatous infections of this, which gland? It is the chronic lipogranulomatous infection of this Meibomian gland. And we know it is not painless. But so in the cases of this, we can do two things. Either we can give steroids or we can do scoop it out. Okay, we can give steroids or we can do incision drainage with the use of this clamp, which is known as 𝗓𝗪𝑖on clamp, and this scoop, which is known as 𝗓𝗪𝑖on scoop. Remember this two. Then about this ocular trauma, which is known as what? Ocular trauma will be resulting in this, all of the features, like ocular trauma will lead to this blowout fracture. We know in blowout fracture, there will be this ball will be coming and hitting you. Okay, once it hits, it will push down below, mostly because there is air filled maxillary cavity, leading to this fracture of this floor of the object. Remember, it is the fracture of the floor of the orbit causing this inferior rectus to trap. Once this inferior rectus traps, the one muscle is not functioning, so it leads to this double vision, also known as diplopia. So there will be a diplopia, there will be it while going, sometimes it will take up the nerve and go, so it will lead to this anesthesia over the region. And also once this eyeball content is going down, this eyeball will be looking like it went inside, so it will be presenting with three dye features. They are known as diplopia, infraorbital anesthesia and 𝗏𝗏𝗏𝗏. Okay, and along with this there is a trauma. Obviously they will be having this features of ecchymosis, fine. And finally this blunt injury, it can produce this rosette-shaped cataract. It is seen in a case of blunt injury, whereas sunflower cataract, it will be seen in a case of Wilson's disease. Yeah, on X-ray it will show this teardrops, fine, teardrops. Then we'll see this iridolysis is nothing but it is this break of this iris, and it will cause this D-shaped pupil. Okay. And next we'll move on to this lasers of this ophthalmology. If you see this laser, we already saw this NDIAC laser, where we'll use for this posterior capsulotomy, iridotomy and vitreolysis. Fine. Whereas we use this double frequency NDIAC. The frequency is 1064 here. It is half of this. So this type of frequency or doubled frequency NDIAC will be used in a case of retinal photocoagulation and cyclophotocoagulation. Okay, retinal photocoagulation and cyclophotocoagulation will use double frequency NDIAC. Argon laser will use for this trabeculoplasty. We used in a case of congenital glaucoma, right? So that is a trabeculoplasty. We'll use this argon laser. Fine. And the rest like iridoplasty, pupillomydriasis and retinal photocoagulation. And diode laser will use for retinal photocoagulation. Most of them will use for retinal coagulation. And excimer laser, which is a argon but fluoride. It is not argon green, it is the argon fluoride laser which we use for this refractive surgeries. We will call them as LASIK, right? So LASIK surgery will use this excimer laser. Then FMT laser we use for this cataract surgery. We'll call them as FMT laser assisted cataract surgery. It will call them as FMT laser assisted cataract surgery, and in LASIK also we can use this one. Okay, in LASIK also we can use this one. Fine, and that's it most of the cases, and we'll see just a few extra H and we'll wind it up. Fine, that is the which MR I couldn't get you. Middle rectus. So all the rectus, all the muscles of these extraocular muscles, it will be supplied by the third nerve. Only lateral rectus and superior oblique. Lateral rectus will be supplied by the sixth cranial nerve, whereas superior oblique it will be supplied by the fourth cranial nerve. Okay? Then there is a child who is presented with epiphoron discharge. So you will suspect of which disease? You will suspect of NLD obstruction. So in a case of initial NLD obstruction, what you will do? You will do this massage. You will do this massage. Once you do this sax massage, mostly it will cure. If not, around 1 year you will do this syringing and probing. You will do around 1 year syringing and probing, and if it is not yet resolved, then you will do this DCR surgery. And we know this DCR, after doing this DCR surgery, will make this opening into this middle meatus. Middle meatus. Okay, will make this opening into this middle meatus. Okay, and this is this endoscopic DCR punch, actually, which is used to create a hole in this on this area. Fine, and the final slide, it is what it is, this retinitis pigmentosa. Okay, in a case of retinitis pigmentosa, there will be a presence of this thin blood vessels along with this retinal pigmentations, and there will be a pale optic disc, and there will be a pale optic disc. Okay, and there is a pale optic disc. Can you please draw and explain nerve supply? Which nerve supply? Any or like I couldn't get you. Fine. Okay, so just remember one thing. सपने देखना अच्छी बात है, लेकिन सपने के साथ सो जाना अच्छी बात नहीं. So the same thing, just only dream, just wake up with the same dream and just put your efforts, you will succeed in life. Right? That's it from the ophthalmology part. If you are completed, you can leave. Who are having the doubts, you just reach me out, will help you. And about this CRAO, see, this is the cherry red spot. Cherry red spot will be seen in a case of CRAO, central retinal artery occlusion, and there will be one more sign will be seen here. It is known as cattle trucking sign. Cattle trucking sign. Okay, and they will be presenting with sudden loss of vision. Okay, that is the sudden loss of vision. Fine. Then about this image, this is this tomato splashed fundus, which will be seen in a case of central retinal vein occlusion. So if there is venous occlusion, more blood will stagnate and it will cause CRVO, this tomato plus appearance. And this is the pizza. In pizza, you will see what? You will see cheese and ketchup. You will see, yeah, we already shared, I guess, yesterday's tomorrow PDF. I'm working on it. The final editions to be confirmed and we'll share it back. Don't worry. Come on. Okay. And this is this pizza pie appearance. In pizza, there will be ketchup and mayonnaise. So this is this, and there will be cheese. So this is known as pizza pie appearance, which is having this cheesy appearance in a case of CMV retinitis. Okay. So that's it, guys. I guess your doubts also got cleared, and just draw. There is no drawing in to explain this. Just remember all of these nerves like superior rectus, medial rectus, in like inferior rectus and inferior oblique. All of them they are supplied by this third cranial nerve, whereas this lateral rectus and superior oblique supplied by this fourth cranial nerve, and lateral rectus supplied by this sixth cranial nerve. Okay, elastic so remember. I guess that's it, guys. I will see you tomorrow with same enthusiasm, and I will be waiting for you. Have a good day and have a good revision and do PYQs. Thank you. Bye bye.